Greetings to all the delegates at this week's Indian Drug Manufacturers Association event, and happy 60th anniversary to the IDMA. The need for life-saving diagnostics, therapies, and vaccines has never been greater. The work we do with our customers to solve problems that matter truly unlocks the potential of science. The last 2 years has proven that. As many of you know, Waters is a global leader in analytical technologies with a large focus on delivering these instruments and informatics for regulated applications, especially in QA and QC for pharma drug manufacturing. I'm proud of how our teams have worked together throughout the pandemic to help you achieve your business goals in the service of your customers here in India and around the world. Pharmaceutical companies represent Waters' largest customer segment, and India is indeed our fastest growing market. It is no secret that the Indian pharma market is dynamic. According to a 2021 E&Y report, it is projected to grow at a low teens rate to reach $130 billion by 2030. This won't simply happen on its own. We will need concentrated efforts from key stakeholders, not just policymakers, but from the pharma industry players, academia, as well as equipment manufacturers like Waters to accelerate research and innovation, equitable and sustainable healthcare, and to strengthen QA, QC, and manufacturing. Over the last 2 years especially, I'm grateful for the many ways in which we've helped one another in India and beyond to weather the extremes of this pandemic. So, on behalf of Waters Corporation, thank you for trusting us with your business. It is an honor to serve you, to innovate for you and partner with you on some of the biggest challenges facing our industry. Congratulations and thank you for your many contributions. I look forward to 60 more years of innovation and collaboration.
We know how hard it can be to get better, which is why for 60 years we've been getting better at working with our pharma and Nutri partners to make people better, from fighting a headache to beating cancer. We're there. In fact, wherever in the world there's a medicine cabinet, you'll almost certainly find ACG somewhere inside it. So let's do this. Let's get better.
BDR is a team of qualified professionals, but it's like one family. There is no hierarchy. My journey has been quite exciting. Started with the manufacturing of lubricants for a pharma industry. Became an MNC man manufacturing multivitamin, nicotinamide and nicotinic acid for Bicosules, B-complex, household names. Dedicated my life towards HIV medicines. Started concentrating on another life-threatening disease, cancer.
The infra of BDR is divided in such a way that we have got one facility with 3 blocks. One block is a dedicated oncology API facility where we make low volume, high value products. Second block is a general API block with the same concept of low volume, high value. And third block is the oncology solid dosage facility. We are highly focusing in those molecules that we can give the best kind of healthcare at an affordable rate to the entire demographic.
As BDR, we've been introducing the many new generic molecules, new dosage forms, complicated drug delivery systems, which are having not only the first generic but also the incremental innovation to the generics. Our journey, I believe, has just taken a new shape by introducing ourselves into this particular full-fledged world-class R&D, where we will be exploring new platforms by working on the new delivery matrices.
The new facility that is coming up is for injectables, general lyophilized injectables, general solid dosage, ointments, topical creams, and oncology injectables.
Once these particular buildings are made ready, all our CMO activities will be centralized into one campus, that is going to be the Bhaskar campus for injectable activities of BDR. This research center is spread across 65,000 square feet. The center is built in order to cater for a sophisticated analytical development lab, which in itself is a very big lab compared to the routine research and development laboratories.
I would say we are creating a world-class facility. I think it would be able to deal with any markets, be it regulated or semi-regulated or domestic market. And I believe that now with the kind of infrastructure we have created, we will have the entire horizon open to us.
We must be one of the only organizations in India that has invested heavily in our research and development.
Whenever we do any development, we keep in mind our highest standard quality.
We are going for the emerging markets. We are going for the rest of the world market. We are working in Egypt, we are working in Uganda, we are working in Kenya. And our future is to put a global footprint across such countries where we become the first entrant in the product. There's a lot more we have to do, a lot more we have to achieve, but I can proudly say that I know the difference that we are making.
There is always a team working towards improving yield. There's always a team working towards reducing costs. And the most important part is we do all of this without compromising on the quality.
BDR,
a very good morning.
Do not have any employees, it is BDR Pharma. So I've never seen people who are working with us as an employees.
I believe.
बंद है. Hello. Good morning, ladies and gentlemen. Thank you for joining all of us here for the IDMA 60th year celebrations. Our Honorable Minister for Chemical and Fertilizer, Health and Family Welfare, Dr. Mansukh Mandavia, will be here any moment. May I request all of you to please settle down. All our friends there at the back, will you please take your seats? Thank you. Bolo. Yeah, I already told people to take their seats. Yeah. Thank you. They are all seated. Thank you. Applause for our chief guest, our Honorable Minister, Mansukh Mandaviya ji. May I request all of you to put your mobiles on the vibratory mode, please? So, a very warm welcome to all of you. Especially our Honorable Minister, despite his busy schedule, is here with us. And before we begin the program, we will sing along our national anthem, and then we will go for the Idma anthem. So may I request all of you to please rise in your seats for the national anthem.
जन गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्छल जलधि तरंगा तब शुभ नामे जागे तब शुभ आशीष मांगे गाहे तब जय गाथा जन गण मंगल दायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Please remain standing for the Idma anthem.
Om Namo Bhagavate Vasudevaya Dhanvantraye Amrit Kalasha Hastaya सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे नमः. स्वस्थ भारत की है वजह जग में अपनी सेवाएं
हर जगह हम विश्व में दिखते हैं चारों दिशाएं
जख्मों पे रखते हैं हम जब स्नेह भरा मरहम बढ़ते हैं अपनी तरफ विश्वास के लाखों कदम सारी दुनिया में देखो लहराए आज अपना परचम IDMA 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 IDMA. वर्ष पहले हम सबको दूसरों का था आसरा फार्मा और ड्रग की दुनिया में हम अब है तीसरा
हमें देश पे और देश को अब हम पे नाज है हिंदुस्तान का इसलिए दुनिया पे राज है
आ जाए जो देश में कोई विपदा की घड़ी IDMA हरदम तेरे पीछे है खड़ी सबकी आशाएं सबकी उम्मीदें अब हमसे है जुड़ी IDMA 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 IDMA
Thank you very much. Please take your seats. We will begin our program with the blessings of the Almighty, and we'll request our Honorable Minister, sir, to please come up and light the lamp. May I request Madam Aparna to please join us in lighting the lamp. President, sir, if you can please escort the guests. Dr. Mandeep Bhandari, if you can kindly come up, and Dr. Somani. Yeah. Mr. Pankaj Patel, will you please join us for lighting of the lamp? Come here, ma'am, please. Are you around? Please. Where's the lamp? Very much, and may I now request our President and immediate past President to escort our honored dignitaries on the dais. A big round of applause for our Minister, sir, Madam Aparna. Mandip ji, please come up on the dais. Dr. Somani, may I request immediate past National President Mahesh Doshi to please take your seat. Bharat Shah, our Chairman of the 60th Year Celebrations Committee. Mr. Mehul Shah, our Honorary Secretary, and the man who's worked very hard to put up this show. And before we begin, may I request our President to honor our dignitaries on the dais with flowers. Quick. Go ahead. We'll take it back. Just take them back. Take them back. Yeah, go ahead. So thank you very much. A lot of hard work and homework has been done to put up this wonderful program. After all, 60 years in the life of an association is something to be applauded. It's a great milestone that IDMA has achieved. It gives me great pleasure to welcome our honorable chief guest for this inaugural session, Dr. Mansukh Mandavia, Minister of Health and Family Welfare and Chemicals and Fertilizers. Madam S. Aparna, IAS Secretary, Department of Pharmaceuticals. Dr. Mandeep Bhandari, IAS Joint Secretary, Ministry of Health and Family Welfare. And Dr. V.G. Somani, Drugs Controller General of India. I have great pleasure in welcoming our National President, Dr. Viranchi Shah, our immediate past National President, Mr. Mahesh Doshi, our Chairman IDMA Diamond Jubilee Celebrations, Mr. Bharat Shah, our Honorary Secretary, Mr. Mehul Shah, distinguished guests, our former presidents who have contributed not only during their year of presidency, but have been continuously helping us, supporting us, captains of the industry, fellow members of IDMA, learned speakers and moderators, distinguished winners of various IDMA awards, heads of other important associations with whom we have had the privilege of working very closely, our partners, Bain & Company, our knowledge partners, members of the press, our sponsors, our advertisers, ladies and gentlemen, and boys and girls. A lot of new entrants are there in our pharma industry. The young generation is now almost taking over, and they feel happy when I say boys and girls. A very warm welcome to all of you to the 60th IDMA annual celebrations, a milestone in the life of our association. 60 years, friends, of consistent and continuous contribution and support to the pharma industry, enhancing the business opportunities of our members, interaction with the government, and more, whilst being customer-centric. What a wonderful feeling, meeting government officials, colleagues, friends of the industry, and all connected with the pharma and health industry in person after almost 2.5 years. And we are so glad everybody just looks the same, or maybe even younger, because nobody moved out of their houses. Everybody was very happy working from home or working from anywhere. And now we are back here. We are glad that the pandemic is finally behind us, but let's not let our guards down. An excellent program has been lined up for all of you. We have 25 speakers, 4 panel discussions, inspiring talks, and fireside chats. So are you all ready for that? Some people have not had breakfast. Can we hear a loud yes? That's it. Thank you very much. So we'll also be honoring our stalwart achievers of the pharma industry, and more on this as we go along. The pandemic taught us some hard lessons, but also provided us the opportunity to continue doing our best, even in the hard times. Several webinars were organized in the last 2 years to keep our members abreast of new emerging systems, especially digitalization, telemedicines, health and wellness, and various other important relevant topics. Adversities turned into opportunities. Never before have we seen the extremely close and continuous working together with our Honorable Minister, Honorable Madam Secretary of DOP, our Drugs Controller, officials of the Health Department, officials of FDA, packaging material and API suppliers, our transporters, the police authorities, the AIOCD, and not to forget the coordination between the big 3 of the Indian pharma industry. It's not just the consultants who have the big 5, but pharma industry has the big 3. We have IPA, we have OPPI, and IDMA. It was a thrilling experience working together with government officials, their staff and industry associations, working in tandem 24/7 for the benefit of the patients, not only in our country, but throughout the world. We are extremely thankful to our Honorable Prime Minister, Shri Narendra Modi, for being an inspiration to all of us. Honorable Dr. Mansukh Mandaviya ji, for his unstinted support and encouragement. Madam S. Aparna, for always guiding us and working closely with all of us. Dr. Mandeep Bhandari, for always being available to us and understanding our issues. And our very popular Drugs Controller General of India, Dr. Venugopal Somani, who is also a friend, philosopher, and guide of the industry. He ensured that whatever we do is patient-centric. Thank you once again for joining us in these celebrations, and a warm welcome once again to all our dignitaries, invitees, and everybody present. Please enjoy the deliberations and the celebrations. And with these few words, I welcome all of you once again, and may I now request our chairman of the 60th year celebrations committee, Mr. Bharat Shah, who is the chairman and managing director of K. Lal, to please come up and give us his address. Come, Bharat.
The curtains tried to draw, and mask too held on. But in our dreams was a show that must go on. With this ambition in our heart, we set up upon a path, stumbled at times, and even roadblocked. Yet, we kept on working hard and hard. Now, as I stand on this stage, I am thankful to each one of you to be a part of our show, to make our dreams come true. Respected Minister of Health and Family Welfare and Chemical and Fertilizer of India, Dr. Mansukh Bhai, other dignitaries on the dais, ladies and gentlemen. Good morning and very warm welcome to Idma's Diamond Jubilee celebration. We are grateful for having you grace this occasion with your presence and to be a part of Idma's 60th year celebration. I vividly remember first meeting on 23rd June 2021, when the core team got together to kickstart the preparation for this mega event. 2021 being a VUCA year, as we know, volatility, uncertainty, complexity, anxiety, it was a year of VUCA. We too had our share of anxieties, uncertainties, and dilemma, whether will this event take place. And here we are on day one, a day that will showcase India's resilience, India's transformation, and India becoming a future-ready Atmanirbhar Bharat. This event follows Idma's mission to be knowledge-sharing platform for its 1,000+ member, majority MSME, and collectively strive for the exponential growth of Indian pharma. With this mission in mind, Idma has launched multiple initiatives over the years to make Indian pharma a global healthcare leader. I cannot thank our distinguished speakers and panelists enough for positively responding to our request to share their experiences, their key learnings, their thoughts on the future of India and our pharma industry. We are fortunate to have stalwart not only from pharma, but also from varied sectors and government bodies to enlighten us on the relevant subjects. It is heartening to see members traveling from across the country to be part of this event. This event has been planned for our members to extract maximum value from varied knowledge session, panel discussion, and fireside chats, and get the inspired for a bright road ahead for our industry. I would like to take this opportunity to thank all our sponsors. Your support and your encouragement have helped Idma to put up such a grand show, and we are grateful for the same. Lastly, an event of such a scale required many helping hands. and I am thankful to have worked with a team of ever enthusiastic, selfless, and tireless members. Specifically, like to mention Mehul for his all-round contribution. We went through the challenges, uncertainties together and through a problem-solving approach, could resolve and make the event a reality. A big thank you for the core event team and the Idma secretarial team, as well as Shaheen and her team. I hope I could provide you a glimpse of what the day holds and hope you have an enriching one. Thank you.
Thank you, Bharat Bhai, for that very inspiring and acknowledging everybody. Friends, the wonderful committee that we had formed, they are now called the change makers. Not for any other reason, but they kept changing the agenda very often. May I now call upon Mr. Mahesh Doshi, our immediate past national president, to please give us his address. Oh,
good morning, our distinguished guest, Honorable Minister Sri Manshukh Bhai Mandavia ji, Madam Aparna ji, IAS Secretary DOP, Dr. Mandeep Singh Bhandari ji, JS Health, IAS, and our friend, philosopher and guide of the industry, Dr. Somani ji, DCGI. Dignitaries in the audience and from industries, my seniors, ladies and gentlemen. The Indian pharmaceutical industry has helped our country from being an importer of a pharmaceutical to a net exporter to the world, so much so that when it comes to a pharmaceutical, the world thinks of India. IDMA journey began in the year 1961 through our stalwarts, Dr. Abraham Patani ji. Due to the bad health, he has not attended today's program. Of a Inaugural, Dr. H.K.A. Hamid of a Cipla, and Mr. A.V. Modi of a Unichem Laboratories. Right from the day one, IDMA campaigned for amending the old patent law British law model to allow Indian industry to grow freely without destruction and aberration. Dr. K.M. Parikh and Dr. Patani appeared before Parliament of India in 1963 and again in 1966 to press for this. Ultimately in 1970, with all our stalwarts and leaders' help, patent law was amended. This event paved the way for growth of Indian drug by leaps and bounds. Unhindered, over the next 25 years, then came to WTO impact, and industry had complied with the requirement and forced during the next one decade up to 2005. The Indian pharmaceutical industry is now recognized world over as a pharmacy of the world. And we thank our Honorable Prime Minister Sri Narendra Bhai Modi ji, our Honorable Minister Sri Manshukh Bhai Mandavia ji, Minister of Health and Family Welfare and Chemical and Fertilizers. I will tell you a small incident when we have gone first time to meet Honorable Minister at Delhi. That time, before start, he says, please put up your all industry problem. Means after the independence, according to our knowledge, he is the first person who is holding both the ministry, health and the chemical and fertilizers. So pharma is divided between the two ministries. So he says, you must have an experience when one minister has to leave something and other has to gain. So we have a little ego, we can't give. But here in this case, don't worry, from my right pocket to left pocket, I have to give. So absolutely, please be prepared your agenda, be prepared your thing, and come with your detailed representation. As far as whatever the help is needed from the government, we are always ready. So thank you very much, Manshukh Bhai. Sri Piyush Goyal ji, Minister of Commerce and Industry, Consumer Affairs, Food and Public Distribution and Textile, for giving the industry the much needed trust to complete globally with the signing of a free trade agreement with many countries. The year 2020 and 2021 were the two difficult and a tough year for the pharmaceutical industry due to the COVID-19 pandemic, but also a blessing in disguise. The pharmaceutical industry immediately turned towards the digitalization, and we all learned to work from home and from anywhere. We were trending on a social media and having a web meeting and webinars. Thankfully, we have learned to live with a new normal that we all have experienced during the COVID-19 pandemic throughout this year. I have always believed that team works and work well. I thank for our entire team, consisting my National President, Dr. Viranchi Shah, Bharat Bhai, Mehul Bhai, and all other my committee members and colleagues. My other office bearer, especially Dr. George Patani and Dr. Mehul Shah, our very active state board chairmen, vice chairmen, and member of a various committee, our consultant, advisor, and our staff at the head office as well as Delhi office, who rose to the occasion and managed the show in the extremely exemplary manner. No stone was left unturned in supporting our member by making timely representation and intervention at the center as well as the different state level. We have proved to the nation that by close and regular coordination between industry association and ministry, the impossible could be achieved. In this total pandemic period, our morning to evening program was like that. A phone call from the DOP. We are calling to the DCGI. We are calling to the Home Health Ministry. After completing that, we have a coordination between the Sudarshan Jain, IPA, Anand Krishnan, OPPI, and other association. So practically it was a program like that. Once in a day we used to talk, and we were trying to do a maximum help to industry as well as a smallest problem like a local collector is not allowing to operate the factory. We are simply calling at 11:30 to the DOP and the DCGI. They have a control room immediately in the morning. There is a little, I have a benefit of there was not a language barrier. My previous secretary as well as today's secretary, both were understanding Gujarati very well. So simply he used to say, અરે તમે કહો ને શું પ્રોબ્લેમ છે, પ્રોબ્લેમ તમારો સોલ્વ થઈ જશે. અને in another 1 or 2 hours, we are receiving the phone call. Please go and see that if you have any problem. So this was what I mean to say. Means I have gone with all my seniors to the Delhi since my affiliation with the IDM is very long. So to Delhi to meet the secretary, HAL, this, that. So that time, certain protocol, this, that, oh, you have to go to the secretary, speak this, speak that. So when I have taken the charge, I have altogether a reverse experience. So nice cooperation from the ministry, department, everybody. Thank you very much. With regular interaction with the Department of Pharmaceutical, various FDA officials and a state government, the DCGI and is a dedicated team, the CDSCO, the police department, official of AIOCD, and the rest, we achieved a great feat. The capacity utilization in our factory rose from a March 25 to 30% during March 2020 to 60 to 80% during a May-June 2020. In fact, some companies touch 100% capacity. We manage this by increasing the availability of a raw material, packing material, and requisite manpower, not to forget the supply chain, distribution chain. IDMA was once again in the prominence as the voice of the national sector, and I thank all the members for their support and cooperation. You all would pleased to know that this was a learning experience for us, how the government official could respond quickly to address the resolve issue in such emergency. I do not want to go into the achievement during my tenure as a president in the last year. It is that work speak and it is all in the public domain, data available. But I firmly believe that somebody asked me, what is your success? Then I say, when you leave the chair with the satisfaction that incumbent team is capable to achieve even a higher laurel of IDMA. And I'm 100% with the confidence there under the leadership of the Viranchi Bhai and my other team is fulfill IDMA's dream. and they will take IDMA to the another level. That give me an immense satisfaction that future of IDMA is indeed in the able hand. I take this opportunity to thank all the esteemed speaker, panelists, and moderator of this 2 days long event and wish you all happy deliberation. I congratulate all the various award winners. You deserve this award for your outstanding innovation and remarkable works. I thank all the participants for coming here and making this event a grand success. I also thank the Diamond Jubilee Organizing Committee for organizing such an excellent program with eminent speaker, panelists, and lab. Lastly, I thank our Secretary General, Mr. Dara Patel at the Bombay office, and Mr. Madan at Delhi, and my secretariat, who has worked day and night for all the purpose, and for their support and coordination. I look forward towards meeting and interacting with you all after a period of 2 years. Thank you very much.
Thank you very much, Mahesh Bhai, for that wonderful address and for thanking all of us. So, Mehul, there will be no vote of thanks now. Well, we now have a man to whom everybody looks up to. He is a PhD, an entrepreneur, and a pharmacist. He was the first member to be elected to the position of Senior Vice President in IDMA. He took over as the National President for the year 22-23 in January 22. A PhD in Business Administration, MBA in B.Pharm, a gold medalist. He is also the Chairman of the Pharma and Healthcare Task Force, Gujarat Chamber of Commerce and Industry. Member of Department of Pharmaceuticals Committee on Reducing Compliance Burden in Pharma, Ministry of Chemical and Fertilizers. A well-known entrepreneur and a pharmacist, he is the promoter and director of Saga Laboratories. He has very aptly given Idma its goals and objectives, which are right, that is RITE, regulatory reforms, innovation, team building, and entrepreneurship. Ladies and gentlemen, I would like you to welcome with a round of applause our National President, Dr. Viranchi Shah. Viranchi Bhai, please come.
Thank you, Daraji. Respected Dr. Bansu Kail Pandavia, Honorable Minister for Health and Family Welfare, Chemicals and Fertilizers. Madam S. Aparna, Secretary, Department of Pharma, Government of India. Dr. Mandeep Bhandari, Joint Secretary, Ministry of Health and Family Welfare, Government of India. Dr. V.G. Somani, the Drug Controller General of India. My colleagues from IDMA, Shri Pankaj Bhai Patel, the eminent entrepreneur, friends from IPA and OPPI, Mr. Sahil Munjal from Pharmexil, invitees, friends from the industry, ladies and gentlemen. First of all, I'm grateful to all of you for being here today. And I'll just take a few minutes to, we all make a big difference to the world, and we know that, but we have not, made an effort to quantify it. There was a study that was published by Oxford University Press, and they studied the yearly lost lives. There's the premature deaths that occur, and how drugs play an important role in improving the longevity. And this study was published in 2013, and it studied the impact between 1980 and 2030. And the study so reveals that $1 spent after drugs and pharmaceuticals actually translates into $12 of increased GDP for an economy. So that's the impact that is created for spending $1 on drugs and pharmaceuticals. It also stated that the pharmaceuticals add a lot of productive life to the people. And I think that is one of the motto of our industry. We want to add smiles to the faces of people. We want to add years to their life and life to the years they live. So this is a comprehensive effort that India has been doing. We know the numbers, we are number 3, and all these things are in the public domain. But we also understand that we play a major role in bringing this change to the world, in increasing the life expectancy. And in that context, this industry is very important. We are today celebrating the 60 years, the Diamond Jubilee, and diamond actually signifies excellence, sparkle, and prestige. And this institute today exuberates all the three, excellence, sparkle, and prestige, to India, and we have today become a strategic industry for India. Though it's a moment of nostalgia, looking back with pride what we did, but it's also a moment for all of us to look forward. What we can do in the next 10 years, what we can do in the next 25 years to make this industry from number 3 to number 1. And what are the things as an industry we can take a very wonderful handhold from the regulators and the governments to go forward. The Honorable Prime Minister has set up a goal of reaching a 5 trillion economy by 25-26. And I think Indian pharmaceutical industry has a big role to play in that. The Forum of Pharmaceutical Associations, we all understand, and we have set up a target of reaching from 50 billion to 130 billion by 2030 for the Indian pharmaceutical industry. And a lot of things are going positive, and we wish that we reach the target of 130 billion by 2030 and probably by up to 500 billion by 2047 as we have on the India 2047 forum. So a lot of things are going positive. What we are trying to do in the next 2 days, we have a 360-degree debate on all the functions that, all the important aspects of this industry. We are talking about the API and the Atmanirbhar Bharat. We are talking about disruptions. We are also talking about the formulation industry and the future for the next 10 years. We are talking about the finance and how to use private equity to fuel the growth. We are talking about innovation and research. We have a full platter of things that could give you food for thought. And when you go home, I'm sure some of these thoughts will help you to go further in your journey of life, in your journey of entrepreneurship. At the last, I would like to acknowledge the role of the various presidents and their committees that IDMA has had in the last 60 years for their role in making IDMA what it is today. And also would like to appreciate the role of the government, the regulators, the healthcare providers, doctors and nurses and paramedics, ancillary industries, academic institutes, and all those who have helped make this Indian pharmaceutical industry so vibrant. So I hope for the next 2 days, you will have a lot of new ideas to take home. Wish you a happy engagement. Thank you so much.
Thank you, Dr. Viranchi. Friends, before we go further, we would like to wish a very happy new year to all our friends, our brothers and sisters, our members from Tamil Nadu. A very, very happy new year to all of you. May I now call upon our former National President, Mr. Deepnath Roy Chaudhary, to please introduce our guest of honor, Dr. Venugopal Somani, Drugs Control General of India. Please come up.
Good morning. A pleasant task, though Dr. Somani doesn't need any introduction as such, but we have to comply with formalities. Dr. V.G. Somani is the Drugs Controller General India since July 2019. Dr. Somani did his M.Pharm and PhD in Pharmaceutical Sciences from Nagpur University, India. Earlier, he worked as Joint Drugs Controller India in CDSCO, heading the divisions of regulation of medical devices and in vitro diagnostics, stem cells and blood products, and new drugs. He has also worked as Joint Drugs Controller India, heading the division of biologics, clinical trials, new drugs, and cosmetics enforcements for several years. Dr. Somani has worked in various capacities, in various zonal offices in Mumbai, Ahmedabad, Kolkata, Delhi, and has also officiated as Drugs Controller General India from November 2011 to February 2012. Dr. Somani has been actively involved in various national and international forums for policy making, training, selections, and providing expert opinion for better regulatory processes. Ladies and gentlemen, I have great pleasure in presenting to you Dr. V.G. Somani, the extremely knowledgeable regulator-in-chief of the pharmacy of the world. Dr. Somani, the floor is yours.
Good morning, everybody. Respected Honorable Health Minister Sri Mansukh Mandviya ji, respectable S. Aparna ji, Secretary, Department of Pharma, respectable Mandip Bhandari ji, Bharat Bhai, Tara Patel ji, Mahesh Doshi ji, Viranchi Bhai, and Mehul Shah, and many other respectable people which I can see, starting from Pankaj Bhai, B.N. Singh, Goda ji, Sudarshan ji, and this moment seems to be not only a celebration of 60 years of IDMA's foundation and work they have done, starting from making the industry, making the patent law which makes this industry flourish and make a pharmacy of the world. Also, their contribution into the field of economics and academics. You have the books and the journals like Indian Drugs, where many of the students wants to publish their papers. You publish the IDMA bulletins, which gives a lot of latest things about what is going on in the tax, what is going on in the schemes, what is going on in the regulations, what are various notifications which are affecting the industries. So this event is also to celebrate how the IDMA has grown for 60 years and also to celebrate passing on the baton from Mahesh Doshi to Viranchi Bhai. This, and not only that, and also to celebrate this, must be the first time that we have a, as Viranchi Bhai has told, a minister who is heading both the department, chemical and fertilizers, as well as health ministry. So this is an extremely useful combination coupled with what we are going to do in future. All the programs which have been assigned in this program, in this particular, they are so nicely crafted that what will be the future direction after Corona for coming 10 years, whether be it a formal, because the panel discussion you see, many stalwarts and dignitaries are there with regards to formulation, with regards to API, with regards to managing the finances and how to look forward for the innovations. So this is what I feel is one of the greatest moment, and in addition to that, सबसे बड़ी बात तो ये है कि हम एक दूसरे को पहली बार देख पा रहे हैं. अभी तक के तो सब वर्चुअली देखते थे. Though we were in touch every day during the Corona times, but that touch was with a little bit of worry, with little bit of to organize something कि यहाँ कुछ हो रहा है, वहाँ कुछ हो रहा है, ये करना है, वो करना है, ये raw material कम है, वो कम है, production कम हो रहा है. All those things were there. So, thank you very much all the organizer IDMA for honoring and calling us for this program. And it is a further honor to see that not only the IDMA people, I can see almost all industry people. The OPPI people are here, IPA people are here, FOP people are here, CP people are here. Almost entire industries, a spectrum is sitting here. Now with regards to what we have done and what regulators and industries and customers and consumer associations have done during the last corona pandemic, all of you have witnessed an extremely high level of synergy, energy, dynamism, new innovations into the methodologies to interact with each other. पहले कैसा होता था कि एक बैरियर होती थी, किसी को मिलना है बड़ी मुश्किल बात होती थी. But this adversity has brought an opportunity. It was so easy to meet even ministers. Because of the adversity, the Department of Pharma NPPA was available at every time during the corona times, because उस समय industry बंद हो गई थी, काम करने वाले भाग रहे थे, ट्रांसपोर्टेशन में जगह जगह रुकावट आ रही थी, चाइना से इंपोर्ट आना थोड़ा सा या इधर उधर से इंपोर्ट आना क्वेश्चनेबल हो गया था. Everything was, in a trouble. To get back, and that would have created havoc, not only for the COVID medicines, but it could have created havoc for the daily medicines like insulin or blood products or other kinds of things. But India ensured, combinedly, along with the industry's commitment, if industry had not been there, government could not have been in a position to do anything. Industry stood by the government and government stood by the industry. And that's why we were able to I remember 20th March 2020, there was not a single corona testing kit available in our country. There was not a single medicine available in our country. There was no talk of vaccine. And forget about the liposomal amphotericin Bs and all those things. Those were not the issues at that time. Taking the challenge from that level, today we have more than 509 testing kits available in our country, which are being either manufactured, 50% of which are manufactured in India and 50% are imported in India. And we are not only fulfilling our demand, we are exporting to the world also. As far as vaccines are concerned, it's a miracle. We are vaccine surplus. We have fulfilled our demand. We are ready to fulfill others' demand also, and to develop the vaccines in the scales in a manner which industry has shown their capabilities, huge capacities in a very short period of time. The support, financial support, regulatory support given by the government, and also the support for actually hand-holding during how to make the changes into the processes, which can shorten the research and development time, which can also increase the production capacities and yield so as to fulfill the needs of the hours. This has been, the contribution of the industry in that has been unprecedented. We also ensured from the government side, our regulators forget for some time that they are regulators and officers. They become an equal partner for development of this cause. And that gave us opportunity to deeply understand the industry. And in that, the role of IDMA and various other associations also has been very crucial. We have developed the new methodologies. Now we have become all digital. All our subject expert committees, all our application processes, all our interactions, most of it happening online and in a digital manner and a secure manner. The things which were happening informally, now we are going to turn it formal. And that formal will be the new normal. The blessings of and the deep understanding of our Honorable Minister, because when He was in the Department of Pharma, Chemical and Fertilizers. He used to take almost every week meeting of what is happening with regards to the supplies of the health sector. And since then, he has been continuously ensuring that Indian supply chain, Indian production, not only for its own cause and for global cause, doesn't fall short. This IDMA's particular function is to celebrate that, to maintain that momentum of acceleration. And during this moment of acceleration, we as a regulator, I tell you, we have been in contact with WHO almost every week. We have been in contact with all regulators of the world through ICMRA, ICDRA, to ICH platform and also through various platforms. कि वैक्सीन्स को किस लेवल पे अप्रूव करना है, कब कंपैरेटिव ट्रायल को अप्रूवल देना है, कौन सा कंपैरेटर लेना है, what to do with remdesivir. This was not a singular decision taken by the Indian regulator per se. It was taken in consonance with what is the regulatory standards internationally. And we want to, because we have been recognized as a pharmacy of the world, but we want to become a quality, well-managed pharmacy of the world. Entire world should recognize us, our innovation potentials, and we have that. Because I see the applications, we get the applications of the investigational new drugs. Earlier, there used to be hardly 5-10 applications. At present, there are 23 applications in the pipeline for the investigational new drug. And this is a great achievement of our country. And you will see in coming 5 years, the story has already started. The new drugs which will hit the world and make a difference to the world will be coming from India, and that will make the difference. Thank you very much once again.
Thank you, Dr. Somani, for your brilliant address and encouraging the industry. And we must tell you that the industry is known as a pharmacy of the world only because of officials like you who support us at every stage. Thank you very much. May I request Mr. Bharat Shah to kindly present a memento to Dr. Somani. So we now have Dr. Mandeep Bhandari, the Joint Secretary, Ministry of Health, a friend of IDMA. Whenever we have wanted to see him, he has always had an open door policy. And may I request Mr. S.M. Mudda to please introduce Dr. Mandeep Bhandari. Thank you.
Good morning to all. It is my pleasure to introduce Dr. Mandeep Bhandari, our guest of honor. Mr. Bhandari is a medical doctor by qualification, university gold medalist from Punjab University, and a recipient of Jammu and Kashmir State Award for Best Meritorious Services in 2017. He joined the IAS service in 2001 and was allotted Jammu and Kashmir cadre. He served as in various positions such as Deputy Commissioner, Jammu and Leh, Secretary to Government of Health and Medical Education, and Deputy Commissioner of Jammu. At present, his brief duties include Drugs and Cosmetic Act, strengthening of state regulatory systems, Central Drug Control Organization, Indian Pharmacopoeia Commission, National Institute of Biologics, Food Safety and Standards Act, the whole gamut of drug and pharma industry. As I said, he is the recipient of the Jammu and Kashmir State Award for Meritorious Services. I welcome Dr. Bhandari to address the gathering. Thank you.
Honorable Minister for Health and Family Welfare, Chemicals and Fertilizers, Shri Mansukh Mandavia ji, most respected Secretary, Department of Pharmaceuticals, Ma'am S. Aparna ji, Drugs Controller General of India, Dr. V.G. Somani, Mr. Dara Patel, Mr. Bharat Shah, Mr. Mahesh Doshi ji, Dr. Viranchi Shah, Mr. Mehul Shah, captains of the industry, and all the stalwarts whom we are witnessing in today's huge gathering for celebrating IDMA's 60 years. Thank you very much for allowing us to be a part of this wonderful celebration. First of all, I extend my hearty pleasure as well as best wishes to this very esteemed organization, which is now 1,000+ members, and which has, over the last 60 years, really built up a resilience for manufacturing quality drugs, and not only meeting the requirements of this nation, but also globally contributing to the veritable name which India has got as pharmacy of the world. Today, I'm a part of the third such event of IDMA over the last, I think, 4 years. And this is the largest ever gathering which I have witnessed since then. And we are meeting, of course, after more than 2 years. With COVID-19 eating up our last 2 years. It has posed challenges, but at the same time, it has brought out the strength and the resilience of our industry. We've all seen how our responses as a nation have been in the last 2 years, which the whole globe is witness to. I remember in Feb 2020, when the imminence of this COVID-19 was looming large over us, and we were expected to source for the entire country very crucial medical equipment like PPE kits, N95 masks, and above all, ventilators at that point in time. When we went to the market, we found that we didn't have a single manufacturer of PPE in the country. We hardly had a couple of manufacturers for N95 masks. And when we collected figures from across the states, there were cumulative 15,000 to 16,000 ventilators across all the hospitals in the country. The expectation was huge. The requirements worked out were massive. And it was expected that we need to source it from anywhere to everywhere, which we can find source from. That is the point in time we discovered that there was no availability globally because the countries had imposed restrictions on their exports, looking at the scenario which was staring them, which they were looking at right as a writing in the wall. And that is when the industry came forth. Over next 3 months, precisely because we were meeting not only on daily basis, but it was a matter when we were trying to discover things on hourly basis. Government had taken up a position, setting up empowered groups to ensure that this country doesn't suffer. And industry was there to support this endeavor of fight against COVID right from the beginning. In next 2 months, we had almost 1,100 manufacturers of PPE from the point when we had none in the country. We had more than 100 manufacturers of N95 masks. And within next 1 year, we could supply to the country additionally 55,000 ventilators against 16,000 which we had over all these years since independence. So that is the kind of effort which the industry made. And this, when I'm talking about, that was a small vertical of the medical products industry, that is the medical devices. When the Deltas and Omicrons came, when we had all those nomenclatures of waves and surges coming to us, it is this industry which held high. We needed remdesivir in the quantities which were hitherto unknown. We required liposomal amphotericin B. All those dreaded diseases, they were coming forth, one after the other, like waves post-COVID. And industry was up to it. There was so much of support from the government. There was so much of follow-up, monitoring, need assessment, whatever gap filling was required, whatever regulatory support was required, and above all, the leadership in the form of our Honorable Minister and the Honorable Prime Minister for every endeavor of the industry to take it forward. IDMA has proved its mettle, it has proved its strength during the hour of the need, and we just hope that we are seeing the back of this dreaded disease. We have the story of vaccine before us. Dr. Somani has brought it out in details. In such a short span of time, we today have 14 vaccine candidates which have been approved. The country is a global exporter of vaccines after instilling more than 185 crore doses in the country. It is huge, it is mammoth, it is hitherto unknown. So this is all because it was whole of government approach, it was whole of societal approach. It was industry, it was society, it was government, it was regulator, which were shaping up together, which were coming close together, trying to bridge every single gap and to ensure that the people of this country don't suffer. And all accolades to you gentlemen and ladies who are sitting here who have contributed this immensely. Thank you so much. IDMA, when we see as a 1,000-member body, in fact 1,000-member plus body, it has been contributing its bit in all sectors, including Swachhata. When I am informed that Indian Pharma Swachhata Champion Award, it was the first recipient for the same. It's again a very big first to this association. It has acted as a bridge between the government and the industry and has been always available at every beck and call. The kind of communication which was required during these tough times, the association has been up to it. Government, on its part, has been trying to handhold through regulatory support, through the pharmaceutical support. I remember that Ma'am Aparna used to hold a meeting every day at 9:30 a.m. And our Honorable Minister used to be monitoring that from very, very close quarters. When Sir was looking after Department of Pharmaceuticals at that point in time, he used to give us calls asking us that what is the quantum of a particular drug available? Which company or which molecule have you been able to order, or are there any issues in terms of getting or sourcing any product? That is the kind of coordination and support which the whole of government approach was getting followed as a part of its policy at that point in time. There was faster access and availability, which was ensured through the regulatory work. When I look back, in 2019, we had issued the new drugs and clinical trial rules. And these were the ones which really came good to us in 2020 when the pandemic struck. The regulator could use those clauses for fast-tracking the approvals, for abbreviating the processes, at the same time ensuring that the quality, safety, and efficacy of the drugs don't get compromised. There was parallel testing of the vaccines, which was allowed both at the manufacturer's level and at the level of the central drug lab. This was again a process which was required to fast-track the whole process. Dr. Somani has brought out in detail, though I had requested him not to cover up the entire scenario and leave something for us also to talk, which he seldom listens to. Of course, regulator shouldn't be listening to government. He should be doing what he feels based on that data, which he has been doing. Well, it's a real pleasure to be a part of this very august gathering and to be talking to the captains of the industry. You are the future of this country. You are the sunrise sector. And this is what the country is looking up to all of you. On our part, under the able guidance and the directions of the Honorable Minister, we have been working on various verticals in improving ease of doing business, in ensuring Atmanirbhar Bharat, in reducing compliance burden, and now we are very closely looking at the processes of reducing, or I should say, the decriminalization of our acts also. And a lot of work is going on, but of course, it's work in progress, and we continuously need your feedback, your guidance, your support to ensure that we continue to work as a single continuum. I'll end with this couplet, which veritably shows the kind of effort which industry has made when we were all groping in the dark, but when we had something as a task, as uphill, which we witnessed during the COVID. हम भी दरिया हैं, हमें अपना हुनर मालूम है. हम भी दरिया हैं, हमें अपना हुनर मालूम है. जिस तरफ भी चल पड़ेंगे, रास्ता हो जाएगा. That is the effort which all of us have made as a nation, and let's continue to do that. Thank you so much.
Thank you very much, sir. That was very inspirational. May I now request Mr. Mahesh Doshi to please present a memento to Dr. Bhandari on our behalf. We are now very eagerly looking forward to listening to our Secretary, Madam Aparna, Secretary DOP. And may I request Mr. Mahesh Doshi to please come up and introduce her.
It is my proud privilege to introduce a dynamic lady, our Secretary DOP, Madam Aparna ji. Madam S. Aparna is currently a Secretary to the Government of India, Department of Pharmaceuticals, since 1st October 2020. Madam is a member of the Indian IAS for the past 3 decades. She has a wide range of experience in the national, subnational, and a local government. Her principal area of experience have been public finance, development policy and planning, and urban governance. Madam Subramani has served on the board of a director on so many public sector company, practically more than 15 public sector committee, operating in energy, industrial infrastructure and financial services. Madam Aparna served as the executive director on the board of the World Bank group representing Bangladesh, Bhutan, India and Sri Lanka for 3 years from 17 to August 2020, and then immediately she became our secretary. Madam S. Aparna holds a postgraduate degree in geology and MPhil in energy and environment from India, and a master in business administration from Melbourne, Australia. Her priority for the pharma medical devices are to empower the industry to be a more competitive, globally increase drug security and resilience, and contribute SDG 03 through making available affordable medicine and medical devices of a high quality of meeting patients' need. Madam understand the 5 languages, that's a Gujarati, Tamil, Telugu, French, Hindi, and English. I told you specific this thing because you can convert yourself in any of the language. She's a fluent, and I think personal language, if you will use, that will create a more intimacy and a closeness. So now I invite Madam to say a few words for the today's function.
Thank you, Mahesh Bhai. Good morning. It's almost noon. Good morning and namaskar to everybody. Our most respected and honorable Minister for Health and Family Welfare, Minister also for Chemicals and Fertilizers, in which the Department of Pharmaceutical lies, dignitaries on the dais, President Viranchi Bhai, immediate past President Shri Mahesh Doshi, Shri Bharat Bhai, Shri Mehul Shah, Shri Dara Bhai. I have to speak to him in Gujarati. He doesn't believe that I can speak Gujarati. Our official colleagues, Dr. Bhandari and Dr. Somani. In the audience, there are even greater stalwarts and leaders. I acknowledge their presence. It is very good to see also all stakeholders present here, including the state drug controllers, members from sister organizations representing pharmaceuticals. It is a great pleasure to be here with you on this very happy occasion of the 60th anniversary of the IDMA. It is a milestone for any organization, and I believe that this organization has proven its worth, its contribution, and its importance and relevance to nation building over the last 60 years. I wish all of you even greater laurels on this occasion. I also take this occasion to extend my wishes on the auspicious occasion of Dr. Bhimrao Ambedkar Jayanti. This is also an extremely important landmark in modern India. It is also an auspicious occasion for many communities in this country. So, Iniya Puttandu Varthagal, Madam from Tamil, jo yahan pe Punjabi hain, lakh lakh vadaiyan, Baisakhi di, and Shubho Poila Baishak to all of you who are here from East India. It is a happy occasion for us to be celebrating such an event as the Diamond Jubilee. It is a time also to introspect what have we achieved in these 60 years and what lies ahead. As you know, the Honorable Prime Minister of India has announced that India will work towards its Amrit Utsav, that is the next 25 years. This is the time that we need to strategize, plan, and work towards achieving that potential. I took over as secretary in the pharmaceuticals department about 16, 17 months ago, and I'm quite proud to be associated with the sector for a couple of reasons. One is, I find that this is not a sector that has only an economic value. It is a societal sector. It is a sector, an industry which has got social relevance. And that is perhaps what motivates each one of us who is in the industry or in the policy making. It is important because, as has been pointed out by other speakers ahead of me, that this contributes to human wellness, it contributes to society, it contributes to longevity, lowered mortality and mortality, and general well-being of mankind as a whole. It is also, that may also be one of the reasons that it is a highly regulated sector. So apart from all the challenges that any manufacturing sector may be facing, in the pharmaceutical sector, there is an additional responsibility of compliance with various regulations relating to quality, relating to access, and relating to affordability. These are not to be seen as mere hindrances, but facilitations that will enable the pharmaceutical industry to actually fulfill its role in the larger frame of things. And I'm extremely happy to note that the industry here in India, and Honorable Minister will also bear me out, has been very forward-looking when it comes to collaborating on ensuring that regulations are reasonable and are well implemented by the sector. And I do hope that we will continue to see that kind of a positive attitude. The role of associations such as IDMA and others who are present here, notably IPA and OPPI and FOPI, in acting as a bridge between the government and the regulators on one side and the industry on the other side is extremely important in this context. And I did hear most of the speakers before me in a very self-congratulatory mode for the work that had been done in the last 2 years. And I would also like to add my acknowledgement, recognition, and congratulations to the industry for the way that the industry stepped up during these 2 last quite difficult years in our history. It is true that there were extremely challenging periods when we were not having access to transportation, logistics, raw materials, labor, sometimes even capital inputs. But it was at this time that the industry showed its mettle and stepped up to ensure that there was not a single day's disruption in the overall smooth movement and supply of medicines and medical devices, in fact, throughout the country. Even more importantly, and something that the Honorable Prime Minister has also very proudly mentioned at some of the international forum, the industry continued to service almost 200 countries in supplying medicines and medical supplies during this entire period. This is something that we can be proud of. We can look back with a sense of satisfaction. But I do also believe that the last 2 years have shown that this is a sector where there is a greater public attention, there is a greater public scrutiny for the very reasons that I have mentioned, its relevance for general well-being, health and wellness of society as a whole. And this is something that we should take not as a challenge, but as an opportunity that goads us to do even better in the future. I would like to highlight 3 trends or 3 opportunities that are available to the sector, because this is an event today where we not only think about what we have achieved in the past, but we also think about what we need to do in the future. The 3 issues that I would like to address, number 1, is the accepted principle of drug security. Drug security was always accepted as an important driver for the pharmaceutical sector. This is an accepted, articulated principle now, and it is now the collective responsibility of policymakers and industry to work towards that end. And to that objective, industry should, and I hope will, look at gaps in our value chain, areas of vulnerability, and try to build back those capacities that we may have lost for various reasons over the last 2 or 3 decades. I refer specifically to our self-reliance in certain raw materials and inputs, not only APIs, but also certain consumables, excipients that we found we were wanting in as we were meeting the challenges of the last 2 years. So my request to IDMA and indeed to industry will be to address strategies and plans that will enable us to build a reasonable and acceptable level of drug security on a sustainable basis. The second area of attention that I would like to bring to your notice is the growing importance of innovation. India has and will continue to be a global leader in the generic space. It is well known that we are a huge market leader in this. We supply almost 20 to 22% of generics globally. We are the third largest in terms of market size. These are excellent achievements to have made. I believe in the days going forward, in the years to come, there will be a greater role for innovation and research in ensuring the growth and development of the pharmaceutical sector. I would like IDMA also to start building a strategy in the industry on how we can exploit this opportunity. I may point out that innovation does not necessarily mean costlier drugs. Innovation should pursue patient centricity. So the affordability of our innovation products is going to continue to have importance, particularly in our society and in fact, in a large number of developing countries that we can serve from our industry. For this purpose, we have in the government extended unprecedented support under the leadership of the Honorable Prime Minister and our Honorable Minister of almost $4 billion, about 28,000 crore rupees, in the form of PLIs, production-linked incentives that address drug security, increased domestic manufacturing capacity, and promote innovative products and product diversification. So if industry uses this resource which is available, this budgetary or fiscal support that is available intelligently, we can leverage it into a much larger impact in terms of improving our innovative capacity in the Indian pharmaceutical industry. I may also mention that the department has also finalized a draft policy based on huge inputs from industry led by Shri Pankaj Bhai Patel to catalyze R&D and innovation in pharma and medtech sector. This looks in a large extent on collaboration across industry, between private sector and public research institutions. And in that context, I would like to again bring to the notice of the IDMA members and office bearers that research is not the arena only of very large pharma companies. Even mid-sized companies and in fact even smaller companies can collaborate in research to improve their products, improve the therapeutic outcomes, to improve the efficiency of their processes with public research institutions. And we offer 7 NIPERs, National Institutes of Pharmaceutical Education and Research, to collaborate with industry in a way that can maximize the competencies of both private industry as well as NIPERs. And we hope to be able to build entrepreneurship centers, incubation centers, and technology transfer centers in these NIPERs with the help of industry as a collaborative effort. One more area of increasing innovation in the pharmaceutical space is continuous upskilling of our professionals and our technical people. For this reason, we have also now started providing online courses, executive courses for in-service training and upskilling of our professionals, which I believe will be extremely important to get into that innovative mindset, which is necessary that it should permeate the sector if we are to achieve any progress in this. The third area that I would like to highlight is in terms of manufacturing competitiveness. So I spoke of drug security, I spoke of innovation and research, and the third area that is going to be important in the years to come, in my humble opinion, is going to be manufacturing technology. We have a way of doing things, and we have been doing things in a particular way over the last 3 to 4 decades. Of course, there are incremental improvements from time to time. But if you look at the global scenario, there is a great move towards continuous flow technology. as more and more concerns are raised on AMR and other things, there will be more focus on green manufacturing. Advanced companies, advanced economies which had earlier outsourced manufacturing to emerging economies are now using automation and robotics to improve the efficiencies of their production processes. We would lose the cost advantage if that were not adopted in India. So I believe the entire gamut of manufacturing technology offers great opportunities which have to be captured not only by large pharmaceuticals but also mid-sized and small pharmaceutical companies in our country. And to help the SMEs improve their technology and provide better quality assurance for their products, we have also recently, with the approval of Honorable Minister, issued the guidelines for the Pharmaceutical Technology Upgradation Scheme, where we hope to help some SMEs to upgrade their technology for better quality management and meeting Schedule M or WHO standards, etc. So these are the three areas that I feel are areas where you may like to focus on in the years to come as you build your strategies. I would also like to end with two challenges that I see in the future, which again are, can be converted into opportunities if we think in the right direction. And one is the changing profile of the pharmaceutical products. There is a greater growth in biopharmaceuticals, biologics, that we have already seen. We are seeing that there will be greater use of gene and cell therapy in the years to come. I'm not even talking about decades, but in the years to come. Already we have seen that the mRNA vaccine has revolutionized the vaccine ecosystem. And you would see this is happening in CRISPR, and there are developments in DNA manipulation, which will have impact on the kind of products that will be used in therapeutic processes. And therefore, I feel that there is a need for us to introspect on which are the areas where we need to build competences. And in that context, I would like to acknowledge presence of wellness experts also here. There are two areas where India has got an advantage. One is in holistic wellness, where there is a need to bring wellness industry along together with pharmaceutical industry. And the second is in natural product. I think from 20th, we have an innovation summit of the Ministry of Ayush. There is a need to build convergence and complementarity between chemical and biological products and natural products, which can be converted into phytopharmaceuticals. There is also a huge scope in marine therapeutics. So I feel that these are challenges that we should try to capitalize on in the years to come. That was one. And the second one is a global challenge. After several years of globalization, in the aftermath of the pandemic, we are seeing now a reverse trend of deglobalization. Every country is trying to bring domestic manufacturing, not only in pharmaceuticals, but in many products. Every country wants to reduce its dependence and increase its resilience. That is a challenge. But that challenge can be converted into an opportunity by smart strategizing, and I do hope that IDMA will find the strength and the resources and the competencies to identify opportunities in both these areas. I would like to end by again mentioning my tremendous appreciation for the kind of work that has been done in the last 2 years, for the kind of support that we have seen whenever there was a national need, for the kind of competencies, capacities that industry brought forward whenever it was required. I still remember the second wave. Honorable Minister had mandated us to ensure the availability of certain drugs. And there were industry captains with a total maybe net worth of several tens of billions of dollars who were sitting in a room virtually every second day to ensure that we are able to ramp up manufacturing. When we did not have liposomal amphotericin B that Mandeep mentioned, starting from 2 companies, we ended up with something like 15 companies that can produce amphotericin or liposomal amphotericin B. So was the case when we needed paracetamol in the last wave. So every time, industry has shown not only its capacity, but its will and its dedication to the nation. So I will end with where I began, that this is an industry not only with an economic role. Of course, the pharmaceutical industry provides $17 billion of trade surplus in a year. It is a huge economic contribution to the country, but it also has a societal purpose, a societal role, a societal responsibility. I do hope that IDMA members will continue to pursue these twin goals of growth as well as well-being and ensure that we equip ourselves to prepare for the future. Thank you so much and my best wishes.
Thank you very much, Madam, for that wonderful address that has charged all of us, and we promise you not to let you and the ministry down. We'll continue to do our best to meet the goals that you have set for us. Mahesh Bhai was asking me before introducing you that what is S, Aparna, what does S stand for? I didn't want to find it out because I know S stands for super. Ladies and gentlemen, a big hand for the super Aparna, our great guide, our great supporter. Thank you very much, Madam. May I request our President Viranchi Shah to please present a memento to Madam Aparna. So we want to acknowledge the presence of some of our stalwarts here. Some will be done later on. Madam spoke about wellness and fitness. We have a wellness and fitness guru sitting there, Mr. Mickey Mehta. He gave us a number of seminars in the pandemic period. May I request Yogin Majumdar to please present a bouquet to Mickey Mehta. Mickey here, please. Thank you. We have our industry captain, Mr. Pankaj Patel. May I request George Patani, where are you, George? To please present a bouquet to Mr. Pankaj Patel. Get some more. There he is. We have Mr. Uday Bhaskar, the Secretary General of the Director General of Pharmexil. Uday ji. Okay. Who will give it? Manish Bhai, can you please run across? Thank you so much. The most energetic former president. We have S. Sridhar, our very dear friend, the Chief of Pfizer and the President of OPPI. Deepna ji, may I request you to present flowers to. We also have KG Anand Krishnan, the Director General of OPPI. Deepna ji, can you please present flowers to KG? May I request Mr. Munjal to present flowers to Sudarshan Jain, our very dear friend. We work very closely, the Secretary General of IPA. We have Mr. Sahil Munjal, who is the Chairman of Pharmexil. May I request Mr. P.C. Godha to please present flowers to him. We have Madam Jyoti Sardesai, the Chief of FDA Goa. May I request Mrs. Mehul Shah to please present flowers to her. We have Dr. Gahane, the signing authority in Maharashtra FDA, the Joint Commissioner. May I request Mr. Dinesh Patel, Dr. Dinesh Patel to please present flowers to Gahane. Wo kamno manas hai, Dinesh bhai. So thank you very much, and there'll be more dignitaries who will be honored later on. May I request George Patani and Dr. Gopakumar to come up and get the Idma annual publication released at the hands of our Honorable Minister and Madam and the other dignitaries, please. Friends, as they say in Hindi, इंतजार की घड़ी आ गई है. We have our chief guest, our very popular Minister of Health and Family Welfare and Chemical and Fertilizer, Dr. Mansukh Mandavia, and I will kindly request our President, Dr. Viranchi Shah, to kindly introduce him.
थैंक यू दारा जी. मित्रों, महाभारत के युद्ध के बाद एक प्रश्न खड़ा हुआ था भीम और अर्जुन के बीच कि कौन बड़ा योद्धा है, कौन बड़ा लीडर है. और जैसे ये होता है, श्री कृष्ण जी के पास गया कि कौन बड़ा लीडर होता है, कौन राइट लीडर होता है. उस ज़माने में राजा थे, कौन अच्छा राजा होता है, कौन अच्छा लीडर होता है. और बहुत बड़े संवाद के बाद दो चीज़ें बाहर आई. आप अगर किसी लीडर के पास जाते हो, किसी योद्धा के पास जाते हो, किसी राजा के पास जाते हो, क्या आप सप्रेस्ड या भयभीत अपने आप को पाते हो या एम्पावर्ड पाते हो? क्या आपको पॉजिटिव एनर्जी मिलती है या नेगेटिव एनर्जी मिलती है? तो पहला, अगर आपको पॉजिटिव एनर्जी मिलती है तो वाकई में बहुत अच्छा लीडर है. दूसरा क्वेश्चन आया कि राजा जो है उसके पास जब प्रश्न आता है तो हर एक प्रश्न के अलग अलग पहलू होते हैं. जैसे हमारा एक नोटिफिकेशन आ गया, सोमानी साहब ने सुबह साइन करके डाल दिया इंटरनेट पे, और हम सब सोचने लगे अब क्या करना है इसका. सब राजा के पास गए. 5 लोगों की कंपनी है, उसका एक पर्सपेक्टिव अलग होता है वो नोटिफिकेशन के लिए. 50 लोगों की साइज़ की कंपनी है, उसका भी एक अलग पर्सपेक्टिव होता है. 500 लोगों की कंपनी है, उसका एक अलग पर्सपेक्टिव होता है. और 50,000 लोगों की कंपनी, पंकज भाई बैठे हैं, उनका अपना एक पर्सपेक्टिव होता है. और अपने व्यू से सबके पर्सपेक्टिव सही होते हैं. फार्मास्यूटिकल इंडस्ट्री का पर्सपेक्टिव अलग होता है, शायद डॉक्टर्स का पर्सपेक्टिव उसके लिए अलग होगा, कंज्यूमर का पर्सपेक्टिव अलग होगा, रेगुलेटर का भी एक पर्सपेक्टिव अलग होगा. तो क्या वो लीडर, वो राजा, वो योद्धा वो समझ सकता है और इसमें से एक प्रैक्टिकल सॉल्यूशन निकाल के सबको साथ आगे ले जा सकता है? तो श्री कृष्ण भगवान ने दो जवाब दिए कि अगर आप ये 2 चीज़ कर सकते हो तो आप एक अच्छे लीडर हो. और मेरे ख्याल से ये सनातन सत्य है और इस सत्य को सार्थक हमारे मनसुख भाई ने किया हुआ है. मेरा सौभाग्य रहा है कि मैं उनको करीब से जान पाया हूँ. उनका जो कार्य पद्धति है वो मैंने करीब से देखी है और मैंने ये 2 चीज़ें देखी है उसमें. उन्होंने कोई भी प्रॉब्लम को प्रॉब्लम की तरह नहीं देखा है उसका सॉल्यूशन क्या लाया जाए, कैसे लाया जाए, और सबको साथ में लेकर उसको कैसे पॉजिटिव वे में उसको मैनेज किया जाए। और आप अगर प्रॉब्लम लेके जाते हो तो कभी नेगेटिव एनर्जी नहीं आती है। इज़ ऑलवेज वेलकमिंग है, आइए क्या प्रॉब्लम है आपका बताइए, सुनने के लिए तैयार है, एक्शन लेने के लिए तत्पर है। तो एक ऐसे ये व्यक्ति है कि जिनकी जो जर्नी है वो पालीताना से पार्लियामेंट में तक गई है, और पालीताना के एक छोटे से गांव में, अनोल गांव है उनका, वहाँ उनका जन्म हुआ। बहुत ही एवरेज फैमिली, फार्मर का उनका फैमिली है, फार्मिंग उनका फैमिली बिजनेस है, फैमिली प्रोफेशन है, और वहाँ से लेके फार्मिंग से फार्मेसी तक पहुँच गए। और इस पूरी जर्नी में उन्होंने काफ़ी सारे माइलस्टोन खड़े किए। जैसे ये चलने के बहुत शौकीन है, उनके पास अगर मैं उनके घर अगर किसी काम के लिए गया, उनके पास 15 मिनट है, तो वो मुझे बोलेंगे तू ऐसा कर, मेरे साथ चल, और तेरा जो भी प्रॉब्लम हो चलते चलते मुझे सुना। ही इज़ वेरी फॉन्ड ऑफ वॉकिंग। इन्होंने 2 बहुत बड़ी पदयात्राएं की। एक 123 किलोमीटर की पदयात्रा की जिसमें बेटी बचाओ बेटी पढ़ाओ के लिए उन्होंने की, एक लैंडमार्क पदयात्रा थी। एक 127 किलोमीटर्स की पदयात्रा की जिसमें व्यसन हटाओ पे उन्होंने फोकस किया। ये इन्होंने वैक्सीनेशन में बहुत बड़ा काम किया। हम जानते हैं कि आज 186 करोड़ डोजेज इंडिया ने एडमिनिस्टर किए हैं। शायद इतना बड़ा वैक्सीनेशन कैंपेन। हाल ही में एक सर्वे हुआ था, भारत के जो 100 सबसे पावरफुल लोग हैं, और पावर में इसलिए बता रहा हूँ, नेगेटिव सेंस में नहीं है, ये पॉजिटिव सेंस में इनमें पावर है। पावर टू चेंज द थिंग्स, जो स्टेटस है उसको जहाँ चेंज करना है, पॉजिटिव वे में चेंज करना है। ऐसे जो 100 लोग हैं उसमें से मनसुख भाई स्टैंड्स 25th इन इंडिया, और मेरे हिसाब से शायद उससे कहीं ना कहीं सर्वे वालों की कहीं गलती हुई होगी। पर्सनली मैं उनको जानता हूँ, बहुत डिसिप्लिन है, उनका अपना एक वे ऑफ वर्किंग है। रात को वो कल का पूरा काम फाइनलाइज कर लेते हैं, क्या करना है, क्या अचीव करना है, क्या डिलीवर करना है। बहुत ही डिसिप्लिन है। आज सुबह भी मुझे थोड़ा दौड़ाया था। ही इज़ वेरी हेल्थ कॉन्शियस, काम में बहुत डिसिप्लिन है, पूरा परिवार बहुत डिसिप्लिन है। और हमें सौभाग्य है कि ऐसे डायनेमिक लीडर हमको मिले हैं। तो मैं रिक्वेस्ट करूंगा मनसुख भाई से कि आप जरा संबोधित करें इस सेशन को। थैंक यू।
इंडियन ड्रग्स मैन्युफैक्चरर्स एसोसिएशन के डायमंड जुबिली सेलिब्रेशन अवसर पर हमारे बीच में उपस्थित और इडमा के नवनियुक्त अध्यक्ष विरांची शाह जी, हमारे विभाग के सेक्रेटरी एस अपर्णा जी, हमारे जॉइंट सेक्रेटरी मनदीप भंडारी जी, हमारे ड्रग्स कंट्रोलर जनरल वीजी सोमानी जी, महेश दोशी जी, भरत शाह जी, मेहुल शाह जी, पंकज भाई, सभी उपस्थित भाइयों एवं बहनों, पिछले 2 वर्ष से मिलना होता था तो वर्चुअली मिलना होता था। जब विरांची भाई ने मुझे कहा कि 600-700 से अधिक संख्या उपस्थित रहेगी, तो मैंने सोचा कि सचमुच रहेगी। तो उन्होंने कहा कि कोविड क्राइसिस के बाद पहली बार सभी को फिजिकल मिलने का अवसर मिल रहा है, इसलिए अवश्य आएंगे। आप इतनी संख्या में उपस्थित रहे हैं। देश आज़ादी का अमृत महोत्सव मना रहा है और इडमा एक फार्मा मैन्युफैक्चरिंग एसोसिएशन अपनी स्थापना का 60वां साल मना रहा है। ये सहयोग है और यही ऐसे सहयोग है हमें मिलने का अवसर देता है। ऐसे ही कार्यक्रम से यहाँ सरकार भी है, इंडस्ट्रीज भी है, इंडस्ट्रीज एसोसिएशन भी है, सरकार के ऑफिसर्स भी है, आपस में संवाद होता है, आपस में विचार विमर्श होता है। ऐसे कार्यक्रम के माध्यम से ब्रेनस्टॉर्मिंग होता है जिसके आधार पर इंडस्ट्रीज और नेशन का भविष्य सुनिश्चित होता है। और प्रधानमंत्री जी ने सही कहा है कि देश को आगे बढ़ना है तो क्या केवल सरकार सोचेगी, सरकार ही सब कुछ करेगी, सरकार की एक तरफ से ही एफर्ट होगा, शायद परिणाम मिलेगा, लेकिन समय लगेगा और पूर्ण परिणाम मिलने में दिक्कत होगी। जब सारा देश नेशन बिल्डिंग में अपना कंट्रीब्यूशन करता है, सब लोग साथ में एक डग आगे रखते हैं, 130 करोड़ की जनता एक साथ में एक डग आगे बढ़ते हैं तो देश 130 करोड़ डग आगे बढ़ जाते हैं। सामूहिक तौर पर आगे बढ़ने का ये तरीका, ये रास्ता मोदी जी ने हमें दिया है और इसलिए आवर गवर्नमेंट इज प्रो पुअर्स, प्रो फार्मर्स बट इंडस्ट्रीज फ्रेंडली गवर्नमेंट। हमारी सरकार गरीबों के प्रति, किसानों के प्रति समर्पित है, लेकिन इंडस्ट्रीज फ्रेंडली गवर्नमेंट है। हम जानते हैं देश के विकास में इंडस्ट्रीज का एक महत्वपूर्ण रोल है, देश को आत्मनिर्भर करने के लिए इंडस्ट्रीज का एक महत्वपूर्ण रोल है और फार्मा इंडस्ट्रीज हमारे देश में पहले से ही आगे बढ़ी हुई इंडस्ट्रीज है। इंडस्ट्रियलाइजेशन हो रहा था, ऐसी स्थिति में फार्मा इंडस्ट्रीज ने लीड किया और देश इंडस्ट्रियल डेवलपमेंट में आगे बढ़ते गए और आज हमारी फार्मा इंडस्ट्रीज फार्मा ऑफ द वर्ल्ड के रूप में हम दुनिया में जहां भी जाते हैं, एज ए गवर्नमेंट, एज ए सिटीजन, एज ए इंडस्ट्रियलिस्ट, एज ए फार्मा इंडस्ट्रियलिस्ट, जब आप दुनिया में जाते हैं तो लोग गौरव से कहते हैं कि इंडिया फार्मा ऑफ द वर्ल्ड। आज अमेरिका 3 पिल लोग लेते हैं तो एक इंडिया में बनी हुई जेनरिक पिल होती है। आज अब सारी दुनिया 5 पिल लेती है तो एक इंडिया में बनी हुई गोली होती है। ये हमारे लिए सौभाग्य है और ये तब हो पाया है जब सरकार ने भी एफर्ट किया होगा और इंडस्ट्रीज ने भी एफर्ट किया होगा, सबने साथ में मिलकर प्रयास किया होगा, तब हम यहाँ पहुँचे हैं। और यहाँ एक अच्छी बात हुई कि देश 25 साल के बाद अपनी आज़ादी का 100 साल पूरा करेगा और 100 साल में हमारा लक्ष्य क्या है, हम कहाँ जाना चाहिए और उसके लिए क्या करना चाहिए। प्रधानमंत्री जी की सोच रही है, वो दूरगामी दृष्टि से सोचते हैं 10 साल के बाद हमें कहाँ जाना है और एक कहाँ जाना है, ये जब आप डिसीजन करते हैं, गोल तय करते हैं, 25 साल के बाद कहाँ जाना है, गोल जब आप तय करते हैं, तब उसके लिए क्या रिफॉर्म करना चाहिए, किस तरह से हम जाएंगे। केवल हम लक्ष्य ले लेंगे यहाँ जाना है तो नहीं जाएंगे, हमें 5वें मंजिले पे जाना है, सीढ़ी चाहिए। स्टेप सीढ़ी नहीं होगी तो 5वें मंजिले जाने की बात तो कर सकते हैं। ऐसी बात भूतकाल में हमें 21 की सदी के बारे में सुना था। 21 की सदी आ रही है, 21 की सदी आ रही है, उसके अनुरूप हमें एक्शन प्लान तैयार किया क्या। बात ऐसी हो जाती है समय के अनुसार हम एक्शन नहीं करते हैं तो हमें जाना है मुंबई से अहमदाबाद और ट्रेन तो अपने टाइम पे आती है। 21 की सदी तो टाइम पे आ गई, सुबह में 10 बजे की ट्रेन होती है तो 10 बजे प्लेटफॉर्म पर आ जाती है और 10 बजे पर ट्रेन प्लेटफॉर्म पर आ जाती है और हम नहीं पहुंचते तो ट्रेन तो अपने समय पे निकल जाती है। इसलिए हमें आगे बढ़ना है और आगे बढ़ने के लिए सरकार ने कार्य योजना बनाई। यहाँ अपर्णा जी आपको बता रही थी हमें क्या करना चाहिए, सरकार की साइड से क्या करना चाहिए, कौन से रिफॉर्म की आवश्यकता है। हम ड्रग्स एंड कॉस्मेटिक एक्ट में बदल कर रहे हैं, ईज ऑफ डूइंग बिजनेस में हम आगे बढ़ रहे हैं और हम जानते हैं ईज ऑफ डूइंग बिजनेस ओनली हम इलेक्ट्रॉनिक व्यवस्था कर दे, इतने तक हम सीमित नहीं रखना चाहते हैं, और इससे सारा इशू सोल्व नहीं होना होता है। हम समझते हैं कि धरती पर लास्ट से लास्ट जब आप इंडस्ट्रीज लगाते हैं तो आपको पहले लैंड चाहिए, लैंड के बाद आपको वहाँ इंफ्रास्ट्रक्चर खड़ा करना है, ये उस सब के लिए आपको परमिशन चाहिए। परमिशन मिलने के बाद इंफ्रास्ट्रक्चर, आपकी फैक्ट्री खड़ी होने के बाद नंबर ऑफ टाइप के लाइसेंस लेने की आवश्यकता होती है, एनओसी लेने की आवश्यकता होती है। ये सारी सीक्वेंस में आपको क्या क्या दिक्कत होती है उसके ऊपर हम लोगों ने डिटेल स्टडी किया है। हम चाहते हैं कि आने वाले दिनों में कई ऐसे विषय है उसमें हम सेल्फ सर्टिफिकेशन पर जाए। हम इंडस्ट्रीज पर भरोसा करने वाले लोग हैं, हम भरोसा करने चाहते हैं। और दोस्तों, ये गवर्नमेंट है, ये सरकार है जिसका मुखिया रेड फोर्ट से बोलते हैं कि वेल्थ क्रिएटर का सम्मान करो। वेल्थ क्रिएटर का सम्मान इसलिए आवश्यक है क्योंकि वेल्थ क्रिएटर देश की इकोनॉमी में, देश के रोजगार निर्माण में अपनी महत्वपूर्ण भूमिका रखता है। और इसलिए आचार्य चाणक्य ने एक बहुत अच्छी बात कही थी, कोई राज्य को समृद्ध होना है तो ये राज्य में रहने वाले लोग, राज्य में रहने वाले महाजन, महाजन मीन्स इंडस्ट्रीज बिजनेसमैन, इंडस्ट्रियलिस्ट, महाजन को राज्याश्रय देना चाहिए। सेकंड सेंटेंस में लिखा कि महाजन को राज्याश्रय देने से क्या फायदा होगा। आप जब इंडस्ट्रीज को प्रोत्साहित करेंगे, बिकॉज फायदा ये होगा, माई सेल्फ इज बेस्ट पॉलिटिशियन, इट्स मीनिंग इज नॉट दैट माई सेल्फ इज बेस्ट इंडस्ट्रियलिस्ट। संपत्ति का सर्जन करना एक आर्ट होती है, कला होती है, ये सब में नहीं होती है। मैं एक अच्छा पॉलिटिशियन हो सकता हूं, लेकिन कोई गारंटी नहीं है कि मैं एक अच्छा इंडस्ट्रियलिस्ट भी हूं। जिसमें इंडस्ट्रीज, जिसमें संपत्ति का सर्जन करने की आर्ट है, कला है, उसको प्रोत्साहित करने से दो फायदा होता है। एक, रोजगार का निर्माण होता है, दूसरा सरकार की तिजोरी में टैक्स देते हैं। सरकार की तिजोरी में हम गरीब से टैक्स नहीं ले सकते, हम किसान से टैक्स नहीं ले सकते, सरकार की तिजोरी में टैक्स कौन डालेगा? तो जो संपत्ति का सर्जन करेंगे उस सरकार की तिजोरी में टैक्स डालेंगे। और चाणक्य ने तब लास्ट में कहा कि तब जाके राज्य कल्याणकारी राज्य बनेगा। ये समय में भी गरीब और किसान, आज से 2000 साल पहले भी गरीब और किसान से टैक्स नहीं लिया जाता था। ये बात आज से 2000 साल पहले जो चाणक्य ने कही थी, वही पथ पर मोदी जी के नेतृत्व में हमारी सरकार आगे बढ़ रही है। दोस्तों, हम चाहते हैं कि इंडस्ट्रीज में ईज ऑफ डूइंग बिजनेस बने, कंप्लायंस बर्डन कम हो। और जब हम कोई कानून करते हैं, कोई रूल्स बनाते हैं, कोई रेगुलेशन बनाते हैं, कोई पॉलिसी फॉर्म करते हैं, तो हमारी पहली प्राथमिकता होती है हम स्टेक होल्डर कंसल्टेशन करते हैं। और उसके औपचारिकता नहीं, उसके ऊपर एक्शनेबल पॉइंट आइडेंटिफाई करते हैं। इस बार बजट के बाद आपने देखा होगा, वो आप में से भी कई लोग जुड़े होंगे, वेबिनार के माध्यम से इंडस्ट्रीज के सामने हमने बजट रखा। ये बजट में क्या क्या प्रावधान किया है, उसकी क्या इफेक्ट होगी, और उसके लिए जब हम रूल्स, रेगुलेशन और इम्प्लीमेंटेशन करेंगे, तब इम्प्लीमेंटेशन करने में क्या क्या चीज़ें हमें ध्यान में रखनी चाहिए, जिसके आधार पर हम बेस्ट इम्प्लीमेंटेशन कर पाए। केवल हमने ऑफिस में बैठ के ये निर्णय नहीं किया बजट का इम्प्लीमेंटेशन का, लेकिन वेबिनार के माध्यम से हमने स्टेक होल्डर से, इंडस्ट्रीज से कंसल्टेशन किया, इंडस्ट्रीज से बातचीत की, और उसमें से जो एक्शनेबल पॉइंट निकले हैं, एक्शनेबल पॉइंट के आधार पर हम बजट का इम्प्लीमेंटेशन करेंगे। क्योंकि बजट देश के लिए है, देश की इकोनॉमी के लिए है, इंडस्ट्रीज के लिए है, और जिसके लिए है, जिसको हमें देना है, उसका विचार हम नहीं लेंगे, उसका कंट्रीब्यूशन नहीं होगा, तो शायद बजट में अनाउंसमेंट तो हो जाएगा, बजट में फाइनेंस एलोकेशन भी हो जाएगा, लेकिन हमारी अपेक्षा के अनुसार उसमें से आउटपुट नहीं मिलेगा। और इसलिए हमने जो जो एक्शन लिया है, वो एक्शन में रिफ्लेक्ट होता है हमें, हमारी इंडस्ट्रीज कैसे सर्वाइव हो, हमारी इंडस्ट्रीज कैसे आगे बढ़े, और हम कैसे, आप अभी पिछले 1 महीने में, 1.5 महीने में 2 फ्री ट्रेड एग्रीमेंट हुआ। एक यूएई के साथ हुआ, एक ऑस्ट्रेलिया के साथ हुआ, उसमें फार्मा सेक्टर की क्या भूमिका होती है रहेगी, उसके पर जब इस विचार पर डिस्कशन चल रहा था तो हम सारे पहलू को देख लेते हैं। आज यूरोपियन यूनियन, यूएस एफडी जिस मेडिसिन को अप्रूव करती है उसके लिए कई कंट्री अपना डोर ओपन कर रही है। फ्री ट्रेड एग्रीमेंट में हम ये भी विषय को डालते हैं जैसे कि आने वाले दिनों में हमारी इंडस्ट्रीज दुनिया में स्मूथली ट्रेड कर सके, उसको दिक्कत ना हो, इंस्पेक्शन राज्य से हो, दूर हो। हम कम से कम कंप्लायंस बर्डन करना चाहते हैं, कंप्लायंस बर्डन रिमूव करना चाहते हैं। और आने वाले दिनों में आत्मनिर्भर भारत के तहत हमने हेल्थ सेक्टर को कभी, और इंडिया की तो तासीर रही है, हमने कभी हेल्थ सेक्टर को केवल बिजनेस की दृष्टि से नहीं देखा है, नहीं इंडस्ट्रीज की दृष्टि से देखा है, नहीं कमाई की दृष्टि से देखा है। हम तो वसुधैव कुटुंबकम की धारणा के साथ काम करने वाले लोग हैं। हम सारी दुनिया, सारी विश्व को एक कुटुंब मानते हैं और हेल्थ की दृष्टि से हमने दुनिया को कायम मदद की है। आप लोग जब दुनिया में अपनी मेडिसिन एक्सपोर्ट करते हैं तब दुनिया की सेवा कर रहे हैं। ये भाव मेरे इंडस्ट्रियलिस्ट में हो और मैंने वो रिफ्लेक्ट होते हुए देखा है। क्योंकि हमने जो केवल इंडस्ट्रीज ही मानी होती ना, केवल बिजनेस ही माना होता, केवल ट्रेड ही माना होता, तो मैंने देखा है उस वक्त में ये व्यवस्था देख रहा था जब फर्स्ट लॉकडाउन लगा था, फर्स्ट वेव दुनिया में कोविड का चल रहा था। किसी को पता नहीं था दुनिया में कि ऐसी बड़ी महामारी सडन आ जाएगी। दुनिया के पास मेडिसिन नहीं थी, देश में लॉकडाउन था। ऐसी स्थिति में दुनिया मोदी जी को कॉल करती थी कि हमें मेडिसिन दो। सभी इंडस्ट्रीज को लॉकडाउन पास दिया, इंडस्ट्रीज को इंडिया में चालू रखा, इंडिया की रिक्वायरमेंट पूरी हुई और 125 से अधिक कंट्री में हमने मेडिसिन सप्लाई की। उस वक्त पर डे 5 से 7 प्लेन इंडिया में केवल मेडिसिन लेने के लिए आते थे और हम दुनिया को मेडिसिन सप्लाई करते थे। और उसमें मैं इंडस्ट्रीज को अभिनंदन इसलिए देना चाहता हूँ, और केवल ट्रेड नहीं है, केवल बिजनेस नहीं है, हमने दुनिया की मजबूर परिस्थिति का लाभ नहीं उठाया। हमारी इंडस्ट्रीज ने उससे ज़्यादा पैसा नहीं लिया, इतना ही नहीं, लेकिन उस वक्त कई कंट्री दूसरी कंट्री में अपना एक्सपोर्ट करते थे, लेकिन पुअर क्वालिटी होने से कई बार उसका माल वापस भेजा जाता था। मुझे गौरव है मेरी इंडस्ट्रीज पर, मेरे देश के इंडस्ट्रियलिस्ट पर। हिंदुस्तान की एक भी कंपनी का माल, एक भी कंपनी की मेडिसिन कोई कंट्री ने रिजेक्ट नहीं की। हम केवल उसको बिजनेस के साथ नहीं देखते हैं, हम दुनिया की सेवा फार्मेसी ऑफ द वर्ल्ड के द्वारा कर रहे हैं। हील बाय इंडिया, इंडिया के द्वारा स्वस्थ हो, और हील बाय इंडिया हम फार्मेसी के द्वारा भी करते हैं। हील बाय इंडिया, इंडिया के मैन पावर हमने कंसेप्ट लिया है। इंडिया में ब्रेन पावर और मैन पावर की कभी कमी नहीं थी। ये देश में एक क्षमता कायम से थी और है, लेकिन उसको पहचान के उसके पर काम करने की आवश्यकता थी। मुझे लगता है कि उसमें देरी हो गई। मोदी जी ने देश में डॉक्टर्स, देश के हमारे नर्सिस, हमारे पैरामेडिक स्टाफ, हमारे टेक्नीशियन, हमारे सब हेल्थ में काम करने वाले स्किल मैन पावर के द्वारा हम दुनिया की सेवा कर सकते हैं। जैसा हम फार्मेसी से कर रहे हैं, इस दिशा में भी हमने काम चालू किया है। इतना ही नहीं, आइए इंडिया में और स्वस्थ हो इंडिया में, हील इन इंडिया। आप भारत में आइए, जिसको आप मेडिकल टूरिज्म के नाम से बोलते हैं। दोस्तों, टूरिज्म बाद में है, उसकी स्वास्थ्य अच्छे बने और स्वस्थ होके वो वापस अपने कंट्री में लौटे। और कहाँ स्वस्थ हुए? वो इंडिया में हुए। आइए हील इंडिया के द्वारा हम तीसरी पहलू से हेल्थ सेक्टर में काम करना चाहते हैं। और इस सब सारे पहलू में काम करते वक्त हम चाहते हैं कि हम एक दूसरे को पूरक बन के कैसे काम करें। आपको अपॉर्चुनिटी मिले, इंडिया आत्मनिर्भर बने, आत्मनिर्भर भारत हेल्थ सेक्टर में कैसे बने, फार्मा सेक्टर में कैसे बने, सारे पहलू पर आज काम होना चालू हो गया है। जैसा PLI स्कीम, हमारी फॉर्मुलेशन इंडस्ट्रीज को दिक्कत ना हो, और कैसी ऐसा API है जिसमें हम 80% अबव इंपोर्ट पर डिपेंड करते हैं, ऐसे API को आइडेंटिफाई करके देश में ही उसका मैन्युफैक्चरिंग हो, उसके लिए PLI स्कीम के द्वारा हम काम करना शुरू किया। और मुझे खुशी है ये PLI स्कीम से 35 से अधिक प्रोडक्शन का मैन्युफैक्चरिंग अभी चालू हो चुका है, और आने वाले दिनों में और इंडस्ट्रीज के द्वारा PLI स्कीम का लाभ लेके मैन्युफैक्चरिंग चालू होगा। उसके बाद हमने सोचा कि अभी हमें दुनिया की मार्केट में हमें हमारा जोश से आगे बढ़ना है, हमें हमारा पग रखना है। विशेष रूप में क्या करना चाहिए? तो फिर 15,000 करोड़ की PLI 2 स्कीम के माध्यम से दुनिया में हम मैक्सिमम से मैक्सिमम हमारा एक्सपोर्ट बढ़ाए, और इसलिए हमारी कंपनी को अपॉर्चुनिटी मिले, उसमें क्या गैप रहता है उसको भी आइडेंटिफाई किया, उसमें MSME को भी अपॉर्चुनिटी मिले उसका भी ध्यान रखा गया। इस दृष्टि से कॉम्प्रिहेंसिव सोच के साथ हम आगे बढ़ रहे हैं। ऐसी स्थिति में आने वाले दिनों में 25 साल का लक्ष्य लेके हमें काम करना है। 25 साल में हमारी फार्मा इंडस्ट्रीज को हमें कहाँ लेके जाना है। मुझे विश्वास है आज के दिन में एक ऐसा एटमॉस्फेयर खड़ा हुआ है और एक ऐसा नेतृत्व है जिस नेतृत्व में इंडिया फार्मा सेक्टर में और गोल को अचीव कर सकते हैं। और मैं चाहता हूं कि ऐसे कार्यक्रम के माध्यम से कहाँ गैप रहा, मुझे पता है कि अगले 10 साल में इंडिया की फार्मा इंडस्ट्रीज के लिए क्या अपॉर्चुनिटी है, उसके लिए एक ब्रेनस्टॉर्मिंग सेशन शायद ये कार्यक्रम के बाद ही, इनॉग्रेशन सेशन के बाद ही है। ऐसे ब्रेनस्टॉर्मिंग सेशन से ही रास्ता तय होता है, ऐसे ब्रेनस्टॉर्मिंग सेशन से ही इंडस्ट्रियलिस्ट का क्वेश्चंस का आंसर मिलता है, ऐसे ब्रेनस्टॉर्मिंग सेशन से ही ग्लोबल सिनारियो क्या है और ग्लोबल सिनारियो में हम क्या कर सकते हैं उसके पर बातचीत होती है। मुझे विश्वास है कि हम अवश्य आने वाले दिनों में हमारे फार्मा सेक्टर को और एक स्टेप आगे ले जा सकेंगे। और आज के इस कार्यक्रम में विरांची भाई और आप सब लोगों ने मुझे और मेरे ऑफिसर्स को इनवाइट करके एक साझेदारी सुनिश्चित करने का अवसर दिया है, इसलिए मैं इडमा, उसकी टीम और आप सब लोगों को अभिनंदन देता हूँ। आज इडमा अपने 60वीं सालगिरह को आयोजित कर रहे हैं, सेलिब्रेट कर रहे हैं। उस अवसर पर आज 60 साल हुआ है, 100 साल और अनेक वर्ष तक ये ऑर्गेनाइजेशन काम करता रहे, एक दूसरे को पूरक बनते रहे, इंडस्ट्रियल कोऑर्डिनेशन करते रहे और आगे बढ़ते रहे। यही शुभेच्छाएं। धन्यवाद।
थैंक यू वेरी मच सर। आपने बहुत प्रोत्साहित किया पूरी इंडस्ट्री के कैप्टन्स को यहाँ पे, बहुत बहुत शुक्रिया। मे आई रिक्वेस्ट आवर प्रेसिडेंट एंड all our other dignitaries to please join the President in presenting this memento to Honorable Minister as a token of our love, affection and gratefulness to you, sir. Thank you. We have a very important formality today. As a lot of speakers have said, that IDMA is today what its presidents have done, our former presidents. And this is an excellent opportunity for us to honor them. We'll request Honorable Minister, sir, to please honor all our former presidents. Please. I'm just taking an order from whoever is sitting nearby. May I request Mr. Yogen Majmudar to please come on the dais and be honored at the hands of our minister. Mr. B.N. Singh. Mr. N.R. Munjal. Mr. Manish Doshi. Dr. Gopa Kumar Nair. Dr. Dinesh Patel. Mr. Anand Thakur. Anand bhai, please come on. Where's Neha? Mr. Deepnath Roy Chaudhary. Thank you, sir. Mr. C.I. Gandhi, Chandra bhai, please come. Mr. S.V. Viramani. May I request Dr. George Patani to come up and receive the award on behalf of Dr. Ibrahim Patani. May I request Aditi to please come up and receive the award on behalf of Mr. Suresh Kare. And our immediate past national president, Mr. Mahesh Doshi. We would also like to honor our veterans who have been working for a number of years without holding any office. They are very senior members of IDMA. And I would request Madhusudan Bhai, Madhusan Bhai, the founder of N-Cube Ethicals and the father of Mehul Shah, to please come up and receive the award. Mr. S.R. Vaidya. Mr. Vaidya. Dr. S.G. Deshpande. Mr. J.L. Sipai Malani is not able to come because he is indisposed, so we'll hand over to him later on. Dr. Nagaraj Rao. We would also like to thank Mr. Dr. Prakash Modi for being here with us and Mr. P.C. Goda. Please come up. Mr. Goda, please. These are the doyens of our industry and we would like to acknowledge them. May I request Pankaj Bhai to please come up?
See, during the pandemic time, Pankaj Bhai was our leader. After getting all negotiation conversation over, we used to call him also and ask him, Pankaj Bhai, have su karwano? So he is guided very well during that period to us. And for the IDM, any problem, every problem, we are approaching Pankaj Bhai. Pankaj Bhai, thank you.
Thank you very much, Minister Sir. May I now request our Honorary Secretary, Mr. Mehul Shah, to please propose a vote of thanks. Mehul is the promoter of N-Cube Ethicals, the Honorary Secretary of IDMA, a very humble but very firm individual, a well-known personality in the industry, in the world of finance, and how to enhance value. He is an expert in that. Over to you, Mehul Bhai.
Thank you very much, Darabhai. Good afternoon, everyone. I have to do a customary job and a little difficult job. I want to make it a little lighter, if I can. So, ladies and gentlemen, I hope you are doing well, keeping safe and in good health, with family at home and colleagues at work. It is my great honor today, Thursday, April 14, 2022, to convey gratitude on behalf of IDMA for the successful proceedings of the first half of the day. Today is a very auspicious day for many communities, including mine. Today is Mahavir Jayanti also. I extend gratitude to the Honorable Prime Minister of India, Shri Narendra Modi, for gracing the occasion with an inspirational message which you might have seen in the Economic Times yesterday. Sir, we are humbled to receive your blessings and assure you of our steadfast commitment in our seva for Sampurna Swasthya to the entire world with the supply of safe, efficacious and reliable medicines. I am heavenly thankful to the Chief Guest, Shri Dr. Mansukh Mandavia ji, Honorable Minister of Health and Family Welfare and Chemical and Fertilizers, Government of India, for his benevolent in-person presence today, sir. Sir, IDMA, its stakeholders, and the entire audience is indebted to have you amongst us. Your firm leadership is witnessed by the nation and world during the pandemic. And we are grateful to be under your direction to steer the development of the industry for the well-being of mankind by providing high quality and affordable medicines. Dear audience, we are delighted to hear Dr. V.G. Somani, Drug Controller General of India, Dr. Mandeep Kumar Bhandari ji, Joint Secretary, Ministry of Health and Family Welfare, Government of India, Madam Aparna ji, Secretary, Department of Pharmaceuticals, Government of India. Thank you, sirs and madam, for your really great and kind words and lots of insights and thought process by which we all can contribute for the larger purpose. I recognize the august presence of senior government officials amongst us today. Ms. Jyoti Sardesai, Director Goa FDA, Shri D.R. Gahane, Deputy Commissioner Maharashtra FDA, Shri A. Senkathir, Deputy Drug Controller West Zone, Shri Jayant Kumar, Deputy Drug Controller CDSCO Gujarat. Thank you very much, Madam and Sirs. Now I congratulate and thank Dr. Viranchi Shah, National President, Shri Mahesh Doshi, immediate past National President, Shri Bharat Shah, Chairman of the IDMA Diamond Jubilee Organizing Committee, under whose leadership we could put together this great show. And Shri Dara Patel ji, you can say with love I told him Dara Bhai, Secretary General for his astute stewardship to commence the event so successfully. We have insight-packed fireside conversations and panel discussions and entertainment program today and tomorrow. I request everyone to make best of the occasion. I assure you that if you really put proper thoughts and attention to what we are going to do in next 1 day or 1.5 days, 101%, at least one takeaway point you all will carry, which you will be able to implement in your life, and you will see great value. I also extend gratitude to our partners, sponsors, audience members for their patronage and presence today. When you go out of this and see those booths over there, these people are leaders in their respective areas. I suggest all of you to please interact with them and see what they are doing, because the world is changing, vendors are changing, suppliers are changing. Now, like we hear from all the government officials today, that we are no more in different sides, we are all on the same side. So similarly, these partners are also on our side. Hope that you will make best of the day today and tomorrow. May Almighty assure our pathways with abundant success. Now, on lighter note, I want to tell you, जैसे आज मंत्री जी ने कहा कि स्वास्थ्य, और विरांची भाई ने पहले कहा कि आज भी वो सुबह में अपना वो रेजिम नहीं भूले थे, आज भी उन्होंने अपने रूम में वो एक्सरसाइज करते थे. शायद आज हम बहुत कम लोग एक्सरसाइज करके आए होंगे. तो व्हाट इज़ द बेस्ट वे टू डू एक्सरसाइज बाय सिटिंग हियर? कैन एनीवन टेल मी? हाँ, सिटिंग हियर. व्हाट वी कैन डू? Clapping. So how many of you know that clapping leads to what? अगर आप clapping दिल से करेंगे तो it will increase your blood circulation in your brain and it will improve your absorption. अगर आप exercise करते हैं तो आपको पता होगा कि एक डॉक्टर कहते हैं कि jumping jack. So those who can do, if you do jumping jack, it covers almost all the organs of the body and this. So दोस्तों, clap खुल के and absorb दिल से. Thank you all very much.
There's a slight change in the program, ladies and gentlemen. Sure.
We all should give standing ovation to Mantri ji and all sitting on the dais. Please, ladies and gentlemen, with a huge round of applause, please.
तो परिषद में बोला ही लो. We are continuing. Thank you very much. Please be seated. As I was saying, there is a slight change in our program because of time constraint with Honorable Minister. We are going to have the fireside chat with Minister, and Parijat Ghosh, a senior partner of Bain & Company, our knowledge partners, will conduct the fireside chat. May I request the other dignitaries to please take your seat in the audience. So may I request all of you to please settle down. All right, so I'll introduce Mr. Parijat Ghosh. He is a partner based in Bain & Company, New Delhi office. He leads the firm's Asia Pacific results delivery practice and is also an expert in the healthcare and advanced manufacturing and services practices. He has almost 20 years of experience as a management consultant throughout India, the United States and Europe. Parijat advises clients across a number of sectors within the healthcare industry, including payers and services, hospitals, pharmaceuticals, and biotechnology. He holds deep expertise in growth strategy, sales and marketing, innovation, organization design, executive development, and strategy implementation. He also has substantial industry experience in automotive and building products. Prior to joining Bain & Company, Parijat was a partner and manager at 2 other global consulting firms. He has earned an MBA from IIM Ahmedabad, holds a graduate degree in BTech in Manufacturing, Science and Engineering from the Indian Institute of Technology, Kharagpur. So over to you, Parijat.
Thank you very much. Good afternoon to all of the delegates and welcome to IDMA's Diamond Jubilee celebrations of 60 years of Indian Pharma. On behalf of IDMA, I welcome all of the delegates and of course our Health Minister, Dr. Mandavia. IDMA में सबकी तरफ से आने के लिए बहुत स्वागत करता हूं मैं आपका और फिर शामिल होने के लिए बहुत धन्यवाद। ये प्रश्न और सवाल जो हम करेंगे अगले आधे घंटे में, इसमें से कई सवाल ऐसे हैं जो बाकी लोगों के दिमाग में भी है। हम लोगों ने क्वेश्चंस जो हैं बाकी लोगों से पूछा कि क्या क्या हम जानना चाहते हैं मंत्री जी से। तो सबसे पहले तो जो है वो कोविड से शुरुआत करेंगे मंत्री जी। इसमें हमने पूरी देश में कोविड वैक्सीन्स पहुंचाने में बहुत ही अच्छा काम किया है। इस रास्ते में लेकिन मुझे यकीन है कि कई सारे मुश्किलें भी आई होंगी जो ये आम आदमी को, आम नागरिक को पूरी तरह से अवगत नहीं है इन मुश्किलों के बारे में। तो ये वैक्सीन्स के खरीद में, इनके वितरण में, इनका टीकाकरण करने में देश के हर एक कोने में ये क्या क्या मुश्किलें आईं और हम किस तरह इसका सल्यूशन निकालें, इसके बारे में अगर आप ज़रा कुछ बताएं हमें।
आते हैं आवाज़? हाँ, आ गया डन। शायद आप लोगों ने वैक्सीन तो ले ली होगी, लेकिन ये वैक्सीन की जर्नी के संदर्भ में जब आपने मेरे से जानना चाहा है तो मैं बताऊं, ये इंडिया ही कर सकता है। और देश में पहली बार हुआ है, आप और मेरे लिए, देश के हर नागरिक के लिए गौरव का विषय है। पहले तो क्या होता था, वैक्सीन, कोई न्यू वैक्सीन रिसर्च होता है, दुनिया में लगती है, बाद में 10 साल 15 साल के बाद इंडिया में आती है या तो इंडिया में बनती है, बाद में देश में वैक्सीनेशन होता है। ऐसा क्रम सालों से चलता रहा, लेकिन एक टाइम पर एफर्ट होने से क्या नतीजा निकल सकता है, देश को कैसा फ़ायदा होता है, उसकी बात मैं जब आपके सामने रखना चाहता हूँ, तब मुझे पता है जब दुनिया में कोविड का केस देखने लगा था और मोदी जी ने मीटिंग बुलाई थी, और इस मीटिंग में मोदी जी ने कहा, साइंटिस्ट और एक्सपर्ट लोगों से ओपिनियन लिया, तो बात आई कि उसका सॉल्यूशन ये वैक्सीन में होंगे। मोदी जी ने कहा कि हमें वैक्सीन का रिसर्च करना चाहिए। प्रधानमंत्री जी ने साइंटिस्ट कम्युनिटी से बातचीत की, रिसर्च इंस्टीट्यूट से बातचीत की, फार्मा इंडस्ट्रीज से बातचीत की और कहा कि देश में वैक्सीन रिसर्च करना है और मैन्युफैक्चरिंग करना है, हम क्या मदद कर सकते हैं। दो चीज़ें उसमें आई थी। एक, रिसर्च करने के लिए फंड चाहिए। प्रधानमंत्री जी ने पहले तो 900 करोड़ रुपीस, 900 करोड़ रुपीस वैक्सीन रिसर्च के लिए फर्स्ट ऑफ ऑल आवंटित किया। दूसरा, रिसर्च कम्युनिटी ने और इंडस्ट्रीज ने कहा कि हम रिसर्च तो करते हैं, लेकिन इंडिया में रिसर्च करने के बाद उसका अप्रूवल का पीरियड समय 3 से 4 साल का है, और ये स्थिति में हम रिसर्च कर लेंगे, लेकिन इस टाइप की उसमें व्यवस्था है, उसमें पास होते होते हमें 3-4 साल लग जाएंगे। उस वक्त मोदी जी ने कहा कि हम उसको कैसे कम से कम कर सके, उसको कैसे रिलैक्स कर सके, जैसे क्वालिटी में भी बार्गेनिंग ना हो और अच्छी क्वालिटी का वैक्सीन को भी अप्रूवल मिले। केवल 9 महीने में इंडिया में इंडिजिनियस वैक्सीन का रिसर्च भी हो गया और उसको अप्रूवल भी मिल गए। ये हमारे लिए सबसे बड़ा अचीवमेंट है। दुनिया देखती रह गई कि क्या इंडिया, इतना बड़ा देश, ह्यूज डाइवर्सिटी, 1.3 बिलियन पॉपुलेशन, उसका वैक्सीन की स्थिति, वैक्सीनेशन की स्थिति क्या होगी, और इंडिया के आधार पर दुनिया में क्या होगा, कोविड कैसे फैलेंगे, कितने लोग का डेथ होगा, ये इंडिया में कितना होगा, उसके आधार पर वो दुनिया का असेसमेंट करते थे। आज स्थिति ये आई कि इंडिया में तो हो गया, दुनिया अभी कोविड के चक्कर में अभी कोविड सह रही है। इंडिया में यही एफर्ट से आज 18 एवो को 97.5% फर्स्ट डोज एडमिनिस्टर हो गया, दुनिया में सबसे ज़्यादा है। सेकंड डोज 86% लोगों को एडमिनिस्टर हुआ, ये दुनिया में सबसे ज़्यादा है। उससे ओमिक्रॉन की स्थिति में, जब ओमिक्रॉन आया तब देश में 80% से एवो लोग वैक्सीनेटेड थे, हम बच गए। आपका एक दूसरा क्वेश्चन उसमें शामिल है कि ये सब कैसे हुआ। ये छोटी बात नहीं है, बात करना, भाषण करना, यहाँ से मुझे बोल देना वैक्सीन मैन्युफैक्चरिंग, कोल्ड चेन, सप्लाई चेन। आपने कभी ये नहीं सुना होगा 90 से 120 90,000 से 1,20,000 वैक्सीनेशन सेंटर पर डे ओपन होते थे। आपने कभी ऐसा सुना कि एक वैक्सीनेशन सेंटर पर हम गए या तो कोई लोग गए लेकिन वहाँ वैक्सीनेटेड नहीं थे, वैक्सीनेटर नहीं थे? कभी नहीं हुआ। मतलब मैन पावर चाहिए। 10 लाख हमारे हेल्थ वर्कर्स लोगों ने कंटिन्यूस 1 साल तक काम किया, टाइम पर काम किया। ये इंडिया का अचीवमेंट है। मैं जब बता रहा हूँ दुनिया ये नहीं कर पा रही है, नहीं कर सकी है। दूसरा, केवल मैन पावर वहाँ खड़ा हो गया लेकिन टाइम पे सप्लाई भी पहुँचनी चाहिए। हम इस तरह से ट्रैकिंग व्यवस्था की थी और रेगुलरली हर वीक में एक बार मेरे लेवल पे रिव्यू होता था। उसके लिए एक परमानेंट सेटअप खड़ा किया था। डोज एक वाइल निकलती है, लास्ट माइल तक पहुंचने तक उसको ट्रेस होता है। आपने कभी ऐसा नहीं देखा कि वैक्सीनेशन चालू हो गया लेकिन वैक्सीन नहीं पहुंचा, हेल्थ वर्कर नहीं था, ऐसा भी कभी मीडिया में आपने नहीं देखा। और वैक्सीनेटर थे और वैक्सीन नहीं पहुंचा इसलिए वैक्सीन नहीं लगी, ऐसा भी आपने कभी मीडिया में नहीं सुना होगा। 2 चीज़। तीसरा, उसके लिए तीसरी आवश्यकता होती है सिरिंज और निडल। आपने कभी ये नहीं सुना होगा कि 1 लाख वैक्सीनेशन सेंटर पर डे चालू होते थे लेकिन कहाँ भी निडल नहीं थी इसलिए वहाँ वैक्सीनेशन रुका, कभी नहीं सुना होगा। सिरिंज नहीं थी इसलिए वहाँ वैक्सीनेशन रुका, कभी नहीं सुना था। ये सब प्री प्लानिंग से हम व्यवस्था करते थे। समय पे प्रोक्योरमेंट होना, समय पे सप्लाई करना, समय पे सप्लाई चेन को मेंटेन करना, उसके पर लाखों हेल्थ वर्कर्स और हेल्थ कर्मियों की टीम उसके पर लगी, तब जाके टाइमली मॉनिटरिंग नॉट ओनली फॉर अस बट ऑनरेबल प्राइम मिनिस्टर ने भी कंटिन्यूस उसका रिव्यू किया। और इंडिया की एक विशेषता ये भी है, यहाँ तो डाइवर्सिटी है और फेडरल गवर्नमेंट है। हमारी डेमोक्रेसी में स्टेट के पास भी कई पावर है, कई व्यवस्था है, तो स्टेट गवर्नमेंट के साथ कोऑर्डिनेशन ये भी महत्वपूर्ण विषय होता है। ये सभी को बैलेंस करते हुए हम आगे बढ़े। आपने देखा होगा कभी मोदी जी ने हमें गाइड किया था कि ये राजनीति करने का विषय नहीं है, राजनीति करने का अवसर बहुत कुछ मिलेगा, वहाँ जाके राजनीति करना, लेकिन कोविड क्राइसिस ये राजनीति का प्लेटफॉर्म नहीं बनना चाहिए। इसलिए हमने कई लोगों ने पॉलिटिकल ऑब्जर्वेशन किया। लोग, कई पॉलिटिकल पार्टी के लीडर कहते थे कि ये मोदी वैक्सीन है, ये बीजेपी वैक्सीन है, ये नहीं लगाना चाहिए, अच्छा होता तो मोदी क्यों न लगाता। तो मोदी जी ने कहा कि भाई जब सीक्वेंस में मेरी बारी आएगी, पहले हेल्थ वर्कर और उसके बाद फ्रंट लाइनर वर्कर्स, उसके बाद 60 एबव, तब ही मैं वैक्सीन लूँगा। जब मोदी जी की बारी आई, मोदी जी ने वैक्सीन लिया, उसमें डिसिप्लिन फॉलो करना बहुत आवश्यक होता है। मनसुख मांडविया हेल्थ मिनिस्टर है, लेकिन जब सीक्वेंस में मेरी बारी नहीं आती तब मुझे भी वैक्सीन लेने की अनुमति नहीं थी। डिसिप्लिन भी हमने फॉलो किया, हमने पॉलिटिक्स नहीं किया और डिसिप्लिन फॉलो किया। और सामने से पॉलिटिक्स हुआ तो भी हमने उसका पॉलिटिकल रिप्लाई नहीं दिया। कई लोगों ने कहा कि तो अच्छी वैक्सीन होती तो मोदी क्यों न ले लेते, मोदी जी ने ले लिया तो कि ये एज को क्यों नहीं देते, 25% फ्री मार्केट में देना चाहिए। तो मोदी जी ने कहा भाई 25% फ्री मार्केट में दे। सभी स्टेट की ओर से उस वक्त कहा गया कि वैक्सीन नहीं है तो इंपोर्ट करने की अनुमति हमें स्टेट को दे दो। कई स्टेट ने पॉलिटिकल रीजन से टेंडर फ्लोट कर दिया। बाहर दुनिया से वैक्सीन मिलती ही थी तो भारत सरकार लेके ना आए, लेकिन पॉलिटिक्स हुआ, बहुत पॉलिटिक्स अलग अलग स्टेट में अलग अलग पॉलिटिकल पार्टियों के द्वारा हुआ। लेकिन जो हम इस तरह से पॉलिटिक्स करने में पड़े होते तो हम एक काम चूक जाते और टाइम पर देश के नागरिकों को वैक्सीन नहीं लगा सकते। और वैक्सीन नहीं लगा होता तो ओमिक्रॉन वेरिएंट आया दुनिया में। ओमिक्रॉन से जब सेकंड वेव में लोग मरे थे और लोगों का मृत्यु हुआ था, ऐसे ही मृत्यु ओमिक्रॉन में भी दुनिया में हुआ, लेकिन इंडिया वैक्सीनेटेड हो गया था, इसलिए हम उसमें से बच गए, देश बच गया, ड्यू टू वैक्सीनेशन। और इसलिए समय समय पर काम करना, समय समय पर इनिशिएटिव लेना। देखो दुनिया में आपने देखा होगा, जब कोविड, लॉकडाउन, फर्स्ट वेव, ह्यूमर, ऐसी स्थिति में दुनिया के कई कंट्री में डॉक्टर ड्यूटी पर नहीं आते थे, नर्सेज ड्यूटी पर नहीं आती थी, लेकिन मोदी जी ने समय पर हेल्थ वर्कर का हौसला बढ़ाया, उसको थाली से, ताली से, प्लेन उड़ा के उसको सम्मानित किया कि आप देश की रक्षा कर रहे हैं, आप फ्रंट लाइनर है, आप हेल्थ वर्कर है, आपकी वजह से देश सुरक्षित हो रहा है। और इसलिए उसका भी हौसला बढ़ा। मैं गौरव के साथ कहता हूँ, और मैं डॉक्टर कम्युनिटी का आभारी हूँ, हेल्थ वर्कर का आभारी हूँ। कई डॉक्टर ने अपना जीवन गुमाया, स्वयं को खपा दिया, कई नर्सिस ने अपने स्वयं को खपा दिया, कई पैरामेडिक स्टाफ ने अपने स्वयं को खपा दिया, लेकिन अपनी ड्यूटी चालू रखी और देश को बचा लिया। इसलिए हेल्थ कम्युनिटी का भी हम आभारी हैं। और मोदी जी ने समय पे ये सब लोगों के साथ बातचीत की, उसका हौसला बढ़ाया, समय समय पे टाइम पे डिसीजन किया, और ये डिसीजन समय पे हो, उचित हो, जनता की भावना का प्रतिबिंब हो, स्टेट की भावना का प्रतिबिंब हो। नंबर ऑफ टाइम प्रधानमंत्री जी ने 2-2, 3-3 घंटे तक राज्य के मुख्यमंत्रियों के साथ मीटिंग किया, क्या करना चाहिए, कैसे करना चाहिए, क्या कर सकते हैं, उसके पर ब्रेनस्टॉर्मिंग हुआ। और उसमें जो अर्थ निकला, इस आधार पर कोविड क्राइसिस के सामने लड़ने का पाथ सुनिश्चित हुआ। इसलिए आज नहीं केवल इंडिया गौरव ले रहा है, लेकिन दुनिया में इंडिया की प्रशंसा हो रही है कि इंडिया ने बेस्ट कोविड मैनेजमेंट किया, और सबसे ज़्यादा दुनिया में वैक्सीनेशन इंडिया में हुआ। 186 करोड़ डोज एडमिनिस्टर आज के दिन में हो चुका है, और भी डोज लग रहे हैं। हम 200 मिलियन डोज एडमिनिस्टर करने वाली कंट्री आने वाले दिनों में बनेगी। ये हमारा अचीवमेंट होगा, और इस दिशा से, इस टाइप के वर्क से ये देश आज कोविड के सामने लड़ रहा है, और हम सफल हो रहे हैं।
शुक्रिया। वैक्सीन से दूसरा आगे एपीआई की बात करते हैं। भारत के पास अभी चाइना +1 सप्लाई चेन का लाभ उठाने का एक बहुत सुनहरा अवसर है। ये वर्तमान में भारत काफ़ी सारे महत्वपूर्ण एपीआई, स्टार्टिंग मटेरियल्स चाइना से आयात करता है, इंपोर्ट करते हैं। आत्मनिर्भर भारत, पीएलआई स्कीम्स, ड्रग पार्क्स, बल्क ड्रग पार्क्स, इन सारे सरकारी योजनाओं से आपका क्या राय है? भारत का कॉम्पिटिटिवनेस कैसे बढ़ सकता है? भारत कैसे एक एपीआई निर्यात के लिए एक मुख्य देश बन सकता है? इस विषय पर अगर आप टिप्पणी करना चाहें, और इसमें इंडस्ट्री और गवर्नमेंट कैसे एक साथ काम कर सकते हैं?
एब्सोल्यूट। ग्लोबलाइजेशन के समय में हम कुछ इंपोर्ट नहीं करें और सब ही इंडिया में बना दे, ऐसा तो नहीं होता है। लेकिन जो क्रिटिकल रिक्वायरमेंट है इंडिया की, क्रिटिकल रिक्वायरमेंट पर हम किसी के ऊपर डिपेंडेंट नहीं होना चाहिए, ये सुनिश्चित करना। आज हम एपीआई इंपोर्ट भी करते हैं, एपीआई एक्सपोर्ट भी करते हैं। उसमें से क्रिटिकल एपीआई इंडिया में ही बने, इसलिए पीएलआई 1 और पीएलआई स्कीम लाए, और आप लोगों को पता है, और उसमें कई लोगों ने पार्टिसिपेंट किया। और देश में केएसएम की स्टार्टिंग मटेरियल, एपीआई, उसका मैन्युफैक्चरिंग चालू भी हो चुका है, और आने वाले दिनों में उसको और बढ़ाना है। तीसरा, उसमें गवर्नमेंट का एफर्ट कैसे होना चाहिए। एपीआई इंडस्ट्रीज देश में बड़े, फर्मेंटेशन बेस्ड एपीआई देश में मैन्युफैक्चर्स हो, उसके लिए हमने कई बार स्टेक होल्डर कंसल्टेशन किया, क्या क्या दिक्कत है, क्या करना चाहिए। पोल्यूशन कंट्रोल बोर्ड का कई रूल्स है, कई रेगुलेशन है, उसके साथ हम कैसे काम करना चाहिए। उसमें से मिनिमम डिस्चार्ज हो, मिनिमम पोल्यूशन हो, और पोल्यूशन का सॉल्यूशन ही हम निकालें, और मैन्युफैक्चरिंग भी बढ़े, क्योंकि इंडिया इज ए ग्लोबल एनवायरनमेंट सिग्नेटरी कंट्रीज। तो हमें दोनों चीज़ों को ध्यान में रखना है, एनवायरनमेंट को भी इफेक्ट ना हो और देश में एपीआई मैन्युफैक्चरिंग भी हो। ये दोनों के बीच में तालमेल करने के लिए क्या करना चाहिए, उसके पर हम तेज़ी से काम कर रहे हैं। और आपने देखा होगा नंबर ऑफ टाइम इंडस्ट्रीज एसोसिएशन से हम कंसल्टेशन करते हैं और एक कंसल्टेशन के आधार पर जो बिंदु निकलते हैं उसका सॉल्यूशन के लिए हम इंडस्ट्रीज पर नहीं छोड़ते, हम ही लग जाते हैं। पोल्यूशन एनवायरनमेंट मिनिस्ट्री के साथ मीटिंग करना, आपको साथ में लेके, इंडस्ट्रीज को साथ में लेके हम एनवायरनमेंट इंडस्ट्रीज के साथ बैठ जाते हैं कि भाई ये इशू है, इसलिए मेरी ये इंडस्ट्रीज पर नेगेटिव इफेक्ट आ रही है, इसलिए मेरी ये फॉर्मुलेशन इंडस्ट्रीज पर नेगेटिव इफेक्ट आ रही है और इसलिए हम एक क्षेत्र में आत्मनिर्भर नहीं हो पा रहे हैं। और उसमें आत्मनिर्भर नहीं होंगे तो जब क्रिटिकल स्थिति आए, आपने अभी ग्लोबल क्राइसिस आप देख रहे हैं, यूक्रेन रशिया का युद्ध चल रहा है, दुनिया में स्थिति बदलती है, उसकी इफेक्ट हमारी कंट्री में भी होती है। तो कम से कम कैसे हो, इसलिए फार्मा सेक्टर, हेल्थ सेक्टर, क्योंकि देश में कोई मेडिसिन बननी बंद हो जाए और कभी ऐसी स्थिति आ जाए कि बाहर से नहीं मिल रही है, तो ये छोटा कंट्री तो है नहीं, 1 करोड़ 2 करोड़ 5 करोड़ पॉपुलेशन का कंट्री तो है नहीं, ये तो बड़ी कंट्री है। बड़ी कंट्री 1.3 बिलियन पॉपुलेशन, हम किसी के भरोसे पे नहीं रह सकते हैं। और हमारे लिए अपॉर्चुनिटी ये है कि हमारे पास स्किल मैन पावर की कमी है ही नहीं, हम नहीं कर सकते हैं ऐसा नहीं है। एनवायरनमेंट कभी नहीं मिला तो नहीं हो सका, एक बात है। मुझे पता है आज हम पेनिसिलिन के एपीआई पर आत्मनिर्भर नहीं रहे। मैं पढ़ता था प्राइमरी सेकेंडरी स्कूल में, तब हम पढ़ते थे कि पेनिसिलिन का प्लांट कहाँ है, तो हम उसमें पूर्तता करते थे कि पिंपरी में पेनिसिलिन का प्लांट, भारत का सबसे बड़ा पेनिसिलिन बनाने का प्लांट है। पेनिसिलिन हम बनाते ही थे, लेकिन जब 19 के समय में, यानी कि 30 साल पहले दुनिया ने सोचा कि सारे विश्व के लोगों का जीवन धोरण अप करना है और प्राइमरी रिक्वायरमेंट सब देश के आम नागरिक को मिले, इसके लिए क्या करना चाहिए, तो उस वक्त WTO के रूप में वर्ल्ड ट्रेड का नया रूप आया, डंकेल दरखास्त आई, कई टाइप के इंटरनेशनल एग्रीमेंट हुए और उसमें हम भी सिग्नेटरीज है। तो उस वक्त विश्व को कंपटीशन में ला दिया और विश्व कंपटीशन करे और उसमें जो सस्ता बनाए वो एक्सपोर्ट करे और सस्ता माल नागरिक को मिले, दुनिया को मिले और लोगों का जीवन धोरण अप हो, इस धारणा थी। लेकिन कई कंट्री ने अपना रिसोर्सेज एक साइड में डाइवर्ट कर दिया, कई टाइप के कंसेशन दे दिए, इंसेंटिव दे दिए और बल्क प्रोडक्शन में आ गए। ऐसी स्थिति में हमारी जैसी कंट्री कमिटमेंट के साथ खड़ी रही और खड़ी रहने से हमारी इंडस्ट्रीज सर्वाइव नहीं कर पाए। पेनिसिलिन यहाँ से 20% कम रेट में मिलने लगा एपीआई, तो क्यों यहाँ से वो 20% महंगा एपीआई खरीदे, वो सस्ता ही लाए। तो हमारी इंडस्ट्रीज उस वक्त मरी, हमारी इंडस्ट्रीज सर्वाइव नहीं कर पाई। उसके बाद पिछले 5-7 वर्ष से दुनिया ने फिर से सोचा कि ऐसा करने से कभी दिक्कत होती है तो हम जहाँ से लाते हैं और वहाँ से नहीं मिलेगा तो हमारी हालत क्या होगी। तो फिर आत्मनिर्भर भारत का स्लोगन मोदी जी ने दिया इंडिया में। वैसे कई कंट्री ने इस विषय पर, सेल्फ रिलायंस पर आगे बढ़ने लगे। तो आने वाले दिनों में हम हमारी क्रिटिकल रिक्वायरमेंट पर किसी पर डिपेंडेंट ना रहे, नॉट ओनली फॉर फार्मा सेक्टर बट नंबर ऑफ टाइप ऑफ अदर सेक्टर, जो हमारे डिफेंस हमारे क्रिटिकल रिक्वायरमेंट है। वो विपरीत परिस्थिति में कौन क्या मदद करेगा नहीं करेगा, हमें बुलेट से लेके रॉकेट तक इंडिया में ही मैन्युफैक्चरिंग कैसे हो, अच्छी तरह से हम डिफेंस सेक्टर में सेल्फ रिलायंस की दिशा में आगे बढ़ रहे हैं, आत्मनिर्भरता की दिशा में आगे बढ़ रहे हैं। वैसे ही फार्मा में हमने 53 एपीआई आइडेंटिफाई किया था, 35 एपीआई से अधिक एपीआई का मैन्युफैक्चरिंग स्टार्ट हो गया। आने वाले दिनों में और एपीआई का, फर्मेंटेशन बेस्ड एपीआई कई कंपनियों ने पार्टिसिपेट नहीं किया है। आप वेबसाइट में जाके एक बार देख भी लीजिए, आप भी बना सकते हैं तो आप भी बना सकते हो। हम चाहते हैं कि उसमें इंडस्ट्रीज और सरकार की भागीदारी हो क्या रिफॉर्म करने की आवश्यकता है, रूल्स रेगुलेशन में क्या बदलाव करने की आवश्यकता है, जैसे आप इंडस्ट्रीज को इस्टेब्लिश कर सके, कौन सी स्कीम होनी चाहिए। आपके कहने से ही पीएलआई स्कीम आई है, असेसमेंट करके कितना वाइबिलिटी गैप फंडिंग है हमें पूर्तता करनी चाहिए, हमने कर दिया। ऐसा करके आने वाले दिनों में हमें हमारी फार्मा इंडस्ट्रीज को आगे बढ़ाना है। हमारा फार्मेसी ऑफ द वर्ल्ड का जो टाइटल है ना, उसको और स्ट्रॉन्ग बनाना है, और इसलिए इंडस्ट्रीज ऑलवेज विथ गवर्नमेंट, ऑलवेज विथ इंडस्ट्रीज।
शुक्रिया। आपने फार्मेसी ऑफ द वर्ल्ड की बात कही। फॉर्मुलेशंस का अगर बात करें, फॉर्मुलेशन सेक्टर में इंडिया डेफिनेटली बहुत ही मजबूत है। इस मजबूती को और कैसे बढ़ाया जा सकता है? को पहले जो वार्तालाप हुआ उसमें भी कहा गया कि किस तरह के ड्रग्स आने वाले हैं वो भी बदलने वाला है, बायोफार्मा आने वाला है, नए ड्रग्स आने वाले हैं। इंडियन इंडस्ट्री को अपना कॉम्पिटिटिवनेस बरकरार रखने के लिए, इसके लिए आप 2-3 क्या सुझाव देंगे?
मेरा मानना है कि समय समय पर बहुत सी मेडिसिन की पेटेंट खत्म होती है, और मुझे लगता है कि इंडिया लो कॉस्ट मेडिसिन, जेनरिक मेडिसिन मैन्युफैक्चरिंग कर सकते हैं। इतने लो कॉस्ट में दुनिया नहीं कर पाएगी, कभी नहीं कर पाएगी, और इसलिए जेनरिक मेडिसिन का मैन्युफैक्चरिंग देश में और बढ़े। उसके साथ ये लो हैंगिंग फ्रूट है, हम जानते ही ये मैन्युफैक्चरिंग फॉर्मुलेशन प्लांट हमारे पास है ही। पेटेंट से बाहर आ रही सभी मेडिसिन का ट्रैकिंग करके समय पे हम मार्केट में आ जाए, ये हमारे लिए एक अपॉर्चुनिटी है। दूसरा, हम सोच रहे हैं कि हम रिसर्च में कैसे आगे बढ़े। रिसर्च में रिसर्च फेलो जो इंस्टीट्यूट रिसर्च करती है, गवर्नमेंट इंस्टीट्यूट हो या प्राइवेट इंस्टीट्यूट हो, प्राइवेट इंस्टीट्यूट को रिसर्च के लिए कैसे इंसेंटिव मिले। रिसर्च होता है, वो ज़रूरी नहीं है कि आपने कोई रिसर्च चालू किया और सरकार ने आपको मदद किया और वो मटेरियलाइज हुआ ही, वो कॉमर्शलाइज हुआ ही, या तो रिसर्च पूरा हुआ ही, ऐसा होता नहीं है। 10 में से 1 रिसर्च सक्सेस हो जाता है, 2 रिसर्च सक्सेस हो जाता है, बाकी ना भी होता है, लेकिन भी उसको मदद करना है हमें। प्राइवेट इंडस्ट्रीज़ को रिसर्च के लिए आने वाले दिनों में हमें स्कीम लेके आ रहे हैं, पॉलिसी लेके आ रहे हैं, जो हमें रिसर्च को प्रोत्साहित करेंगे, जो पेटेंट होगी, और पेटेंटेड ड्रग से भी हम हमारी इकोनॉमी को बढ़ाए, हमारी इंडस्ट्रीज़ को बढ़ाए। एक मेरा ये भी मकसद है। दूसरा, जो गवर्नमेंट इंस्टीट्यूट है वहाँ रिसर्च करने वाले रिसर्च फेलो है, साइंटिस्ट है, उसकी पार्टनरशिप रिसर्च में कैसे आए। स्टार्टअप के द्वारा कोई इनोवेशन हो, मेडिकल डिवाइस में इनोवेशन हो, रिसर्च में इनोवेशन हो, उसका कमर्शलाइजेशन करने में इंडस्ट्रीज की उसकी पार्टनरशिप कैसे बने और उसको हम कैसे प्रायोरिटी दें, ये सारे विषय को लेके हम आगे बढ़ रहे हैं। इसलिए 2 ऑप्शन, एक जेनरिक मैन्युफैक्चरिंग को बढ़ाना, पीएलआई स्कीम का उपयोग करके बल्क प्रोडक्शन करना और दुनिया के मार्केट को कैप्चर करना। सेकंड, इंडिजिनियस रिसर्च, पेटेंट और पेटेंटेड ड्रग्स इंडिया में ही मैन्युफैक्चर्स हो, इनोवेशन और रिसर्च का कमर्शलाइजेशन। हमारा रिसर्च का कमर्शलाइजेशन दुनिया ने तो बहुत किया, हमारे रिसर्च फेलो दुनिया में चले जाते हैं, रिसर्च करते हैं, ये इंडिया में ही कमर्शलाइज कैसे हो, ये प्रायोरिटी सेक्टर हमारा आने वाले दिनों के लिए है। मुझे विश्वास है कि इंडस्ट्रीज़ और गवर्नमेंट के एफर्ट से हम उसमें सक्सेस रहेंगे।
बहुत बहुत बढ़िया। आपने इनोवेशन का बात किया, इनोवेशन के साथ साथ हम किस तरह क्वालिटी को भी बढ़ावा दे सकते हैं इंडिया में। और जब पूरी देश के नागरिकों के बारे में बात करते हैं तो आज भी काफ़ी हद तक आउट ऑफ पॉकेट जो है वो पेमेंट होता है। आयुष्मान भारत एक बहुत अच्छा कदम है, लेकिन अब उसमें और भी उसके बजट में और भी बढ़ना बाकी है। तो ये क्वालिटी पे और आम नागरिक को फाइनेंशियल सपोर्ट देने के लिए, हेल्थ केयर के लिए फाइनेंशियल सपोर्ट देने के लिए, इन दोनों विषय पे आप क्या सोचते हैं?
आपका ये बहुत अच्छा क्वेश्चन है कि हेल्थ केयर को एक्सेसिबल और अफोर्डेबल कैसे बनाए।
बिल्कुल
बहुत आवश्यक है। हेल्थ एक्सेसिबल भी होनी चाहिए और हेल्थ केयर अफोर्डेबल भी होनी चाहिए। इसलिए जो भारत सरकार ने एफर्ट लिया है, बजट भी प्रतिवर्ष बढ़ रहा है। देश में टर्सरी केयर के लिए 22 एम्स आज के दिन में इस्टेब्लिश्ड हो रही है, उसमें से कई एम्स बन भी चुकी है, जो देश में टर्सरी केयर के लिए हर स्टेट में उपलब्ध हो जाए, इस दिशा में काम आज ऑलरेडी चल रहा है। सेकंड, उसको एक्सेसिबल कैसे करें। कल परसों 16 तारीख है, 16 तारीख से आज तक देश में 1,17,000 हेल्थ एंड वेलनेस सेंटर ओपन हो चुके हैं। हेल्थ एंड वेलनेस सेंटर मतलब प्राइमरी हेल्थ सेंटर को अपग्रेड करके उसको हेल्थ एंड वेलनेस सेंटर भारत सरकार के सहयोग से राज्यों ने बनाया है। ये हेल्थ एंड वेलनेस सेंटर को टेलीमेडिसिन से जोड़ के 1,00,000 हेल्थ एंड वेलनेस सेंटर को टेलीमेडिसिन से 16 तारीख को हम जोड़ रहे हैं। और टेलीमेडिसिन से जोड़ के हम एक गांव के दूर सुदूर गांव से हेल्थ एंड वेलनेस सेंटर पर कोई गरीब पेशेंट आता है, उसके पॉकेट में ज़्यादा पैसा नहीं होता है। MBBS डॉक्टर उसको चेक करते हैं और MBBS डॉक्टर को ऐसा लगे, आयुष डॉक्टर को उसको ऐसा लगे कि मुझे और अधिक उसको डायग्नोसिस की आवश्यकता है, स्पेशलिस्ट डॉक्टर का सुझाव की आवश्यकता है, तो तुरंत ही वहाँ से संजीवनी प्लेटफॉर्म का यूज करके टेली कंसल्टेशन के माध्यम से हब के साथ जुड़ जाएंगे। हब कौन होगा? मेडिकल कॉलेज हब होगी। और स्पोक कौन होगा? हेल्थ एंड वेलनेस सेंटर स्पोक होगा। एम्स हब होगी, नेशनल इम्पोर्टेंस इंस्टीट्यूट हब होगी। और उससे डायरेक्ट ए पेशेंट को वहाँ से ही मार्गदर्शन मिल जाएगा, एक्सपर्ट डॉक्टर का ओपिनियन मिल जाएगा। फॉर एग्जाम्पल, दिल्ली एम्स का एक सब सेंटर कैंसर के लिए जज्जर बना है, जो दिल्ली से 60-70 किलोमीटर हरियाणा में है। मैं एक दिन इस जज्जर सेंटर की मुलाकात के लिए जा रहा था। रास्ते में मैंने बोर्ड देखा, हेल्थ एंड वेलनेस सेंटर हरियाणा गवर्नमेंट की ओर से, तो मैंने मेरे ड्राइवर को कहा गाड़ी उसमें ले। उन्होंने गाड़ी ले लिया। वहाँ हेल्थ एंड वेलनेस सेंटर को पता नहीं था कि यहाँ हेल्थ मिनिस्टर आए हैं और आना है, ऐसा मैंने कोई सूचित भी नहीं किया था। लेकिन मुझे खुशी हुई, वहाँ के डॉक्टर के साइड में एक पेशेंट बैठा था। पेशेंट को कुछ एब्डोमिनल पेन था, उसके बारे में डॉक्टर उससे बात कर रहा था और तुरंत ही उसको सेटिस्फेक्शन नहीं हुआ, तो PGI चंडीगढ़ हरियाणा गवर्नमेंट ने हब के रूप में तय किया है। वहाँ स्पेशलिस्ट डॉक्टर बैठे रहते हैं। तुरंत ही उन्होंने वहाँ से संजीवनी पोर्टल से सीधा हब के साथ ज्वाइन किया। वहाँ के स्पेशलिस्ट डॉक्टर ने डॉक्टर के साथ हेल्थ एंड वेलनेस सेंटर के डॉक्टर ने बातचीत की। स्पेशलिस्ट डॉक्टर ने चाहा कि मैं पेशेंट से बात करना चाहता हूँ, बगल में पेशेंट बैठा था, उसके साथ भी उसकी बातचीत हुई और कहा कि मैं 7 दिन की मेडिसिन उसको लिख दो और उसके बाद फिर से आके आपको दिखाए और उस वक्त फिर से जुड़ जाना। देखो, एक स्पेशलिस्ट हॉस्पिटल और स्पेशलिस्ट डॉक्टर की सुविधा हेल्थ एंड वेलनेस सेंटर के द्वारा एक गरीब पेशेंट को मिल गई। ये भारत का मोदी गवर्नमेंट का हेल्थ एक्सेस का मॉडल है। उसको मेडिसिन मिले, सस्ती मेडिसिन मिले। 8,000 से अधिक देश में जन औषधि स्टोर चल रहा है। ये जन औषधि स्टोर जेनरिक मेडिसिन का प्रचार कर रहा है। और जब मैंने आज से 5 साल पहले जन औषधि स्टोर का अभियान चलाया, तब कई लोग मुझे कहते थे कि एक गवर्नमेंट स्टोर है ना, नहीं चलेगा, गवर्नमेंट स्टोर में क्वालिटी कैसी रहेगी। आज यही जन औषधि स्टोर 8,000 से अधिक जन औषधि स्टोर पर क्वालिटी और अफोर्डेबल जेनरिक मेडिसिन मिलती है। पर डे 20 लाख लोग जन औषधि स्टोर की मुलाकात लेते हैं। यहाँ मेरे सेक्रेटरी अपर्णा जी बैठी थी, उन्होंने कहा कि मंत्री जी, मैंने सभी ऑफिसर को डायरेक्शन दे के रखा है कि जब आप टूर करो, प्रवास करो, तो कंपलसरी जन औषधि केंद्र की मुलाकात लो। तो उन्होंने मुझे कहा कि मैं 2 जन औषधि स्टोर की मुलाकात के लिए जा रही हूँ। और ड्रग्स कंट्रोलर हर स्टेट में स्वाभाविक तौर पर सामान्यतः सैंपल लेते रहते हैं फार्मेसी पर। जनरलतः कई कारण होते हैं सैंपल्स फेल होने का, कई बार टेम्परेचर मेंटेन नहीं हुआ तो भी सैंपल फेल हो जाता है, कई रीज़न होते हैं, तो सभी अलग अलग रीज़न से, लेकिन 2% नियरेस्ट सैंपल फेल होते हैं। लेकिन जन औषधि स्टोर पर 1% से बिलो सैंपल फेल होते हैं। उससे कमिटमेंट ये जाता है कि सरकार भी क्वालिटी और अफोर्डेबल मेडिसिन अपने रूट से, अपने चैनल से सप्लाई कर सकती है। आपने एक बिंदु रखा कि उसमें पॉकेट खर्च कैसे बचेगा। आपने देखा होगा हमने स्टेंट की प्राइस कैप की, नीप इम्प्लांट्स की प्राइस कैप की, कैंसर मेडिसिन की प्राइस भी हमने कैप की, मतलब ट्रेड मार्जिन फिक्स किया। ये सब रास्ते से देश के गरीब लोगों को सस्ती दवाएं मिले, उसके जेब में पैसा बचे, कम खर्च हो और उसको स्वास्थ्य सुविधा मिले। इस दिशा में मोदी गवर्नमेंट बहुत सकारात्मक कदम उठा रही है। देश के नागरिकों को मोदी जी ने एक अच्छी बात कही थी कि कोई देश के गरीब परिवार किसी को बिना दवा मिलने से मृत्यु की नौबत नहीं आनी चाहिए। इसलिए जो भी करने की आवश्यकता है ये सब करने की दिशा में हम इनिशिएटिव ले रहे हैं।
एक आखिरी सवाल मंत्री जी, आपने कहा ये आउट ऑफ पॉकेट के बारे में भी, इसी से जुड़ा हुआ एक बात, भारत का स्वास्थ्य बजट जो है वो लगभग 1.3% है जीडीपी का। कोविड के टाइम पे ये बढ़ा भी था काफ़ी ज़रूरतों के कारण। अगर हम दूसरे विकासशील देश को देखते हैं, मानते हैं, तो वो ये थोड़ा कम है। ये गवर्नमेंट ने भी ये कहा है कि ये आगे 2.5% बढ़ना चाहिए। तो ये इस विषय पे ये आप क्या सोच है कि कब तक आप सोच रहे हैं कि ये हो पाएगा और इसका किस तरह से इसका इस्तेमाल होगा?
हेल्थ बजट बढ़ाना ये हमारा प्रायोरिटी सेक्टर भी है और हम हेल्थ बजट डे बाय डे बढ़ा भी रहे हैं। हेल्थ बजट को कॉम्प्रिहेंसिव देखना चाहिए। लोगों को अच्छा फूड मिला, हेल्थ से रिलेटेड है। अच्छी सैनिटाइजेशन मिला, ये हेल्थ से रिलेटेड है। उसको शुद्ध पानी मिला, वो हेल्थ से रिलेटेड है। ये सभी सेक्टर में बजट बढ़ रहा है और हर कंट्री का अपना अपना मॉडल होता है। हम स्टेप बाय बजट बढ़ा रहे हैं, नई मेडिकल कॉलेज ओपन कर रहे हैं, हम टर्सरी केयर के लिए एम्स ओपन कर रहे हैं, हम हेल्थ एंड वेलनेस सेंटर ओपन कर रहे हैं और हम हमारा हेल्थ सेक्टर का बजट भी बढ़ा रहे हैं। लेकिन उसमें एक कंट्री का, एक बार एक सज्जन मुझे मिले थे तो उन्होंने जो आपने कही यही बात कही कि वो जो कंट्री में आते थे वहाँ 4.5% बजट, उसका जीडीपी का 5% नियरेस्ट था और हमारा बजट इतना है हेल्थ में और आपका इतना है। उन्होंने कंपैरिजन भी किया तो मैंने उसको क्वेश्चंस पूछा कि आपके यहाँ टीथ निकालना है तो कितना खर्च होता है, तो उन्होंने कहा $100। मैंने कहा हमारे यहाँ 100 रुपये में निकल जाता है। तो ये भी एक पहलू है। इंडिया में हेल्थ केयर एफोर्डेबल है, लेकिन भी हेल्थ केयर पर खर्च बढ़े और हमारी हेल्थ पॉलिसी 2017 में बनी, उसमें कहा है कि हम 2.5% हमारा जीडीपी का हेल्थ बजट को ले जाएंगे और इस दिशा में हम लोग काम कर रहे हैं।
शुक्रिया, थैंक यू वेरी मच फिर से मंत्री जी यहाँ आने के लिए। धन्यवाद।
थैंक यू।
Thank you very much, Minister sir. It was very, very interesting. सर, एक दरख्वास्त थी आपसे। आपने एक बहुत बढ़िया इंटरव्यू दिया था इंडिया नाउ में और आपने शुभ लाभ के लिए कहा था कि हम कैसे वो फॉलो करते हैं। आई थिंक इट विल बी वेरी इंटरेस्टिंग फॉर एवरीबॉडी सर। एक दो शब्द इनके लिए बोल दीजिए, वो शुभ लाभ ना नमस्ते। समथिंग वेरी इंटरेस्टिंग लेडीज एंड जेंटलमैन।
ये विषय इंटरव्यू में ये था कि हमने कोविड मैनेजमेंट कैसे किया। तो जब कोविड मैनेजमेंट की बात आई तो दुनिया को ऐसा था कि ये देश में पर डे कमा के पर डे खाने वाले कई लोग हैं जिसको शाम की चिंता होती है, और लॉकडाउन तो 1.5 महीने तक चला, तो मुझे कंट्री के हेल्थ मिनिस्टर पूछ रहे थे कि उसका क्या हुआ होगा। तो मैंने कहा कि भाई ये हिंदुस्तान है, इंडिया है, और हम हमारे गेट पर लिखते हैं, हम सब लोग अपने घर में दिवाली फेस्टिवल हो, कोई शुभ प्रसंग हो, लग्न हो, तो लिखते हैं लाभ शुभ। मैंने कहा हम केवल लाभ की बात करने वाले लोग नहीं हैं, लाभ की बात तो होती ही है, और सारी दुनिया स्व के लिए तो कुछ करती ही है, कि हम अपने लिए कुछ करें, स्वाभाविक है, करना भी चाहिए, नहीं करना ऐसा नहीं। लेकिन मैंने कहा कि हम लाभ के साथ शुभ की भावना भी हमारी ट्रेडिशन है, हम लाभ के साथ लिखते हैं शुभ। शुभ या मतलब मेरा कल्याण हो, लेकिन दूसरे का भी कल्याण होना चाहिए, और इसलिए ही हमने 150 कंट्री को मेडिसिन पहुंचाई, हमने हमारा कल्याण किया, देश का ख्याल रखा, देश की रिक्वायरमेंट को पूरी की, दुनिया को हमने मेडिसिन भी पहुंचाई, और दुनिया को हमने वैक्सीन भी पहुंचाई, और अभी भी पहुंचा रहे हैं, ये शुभ की बात है। दूसरा, जब इतने बड़े कंट्री में लॉकडाउन था, मोदी जी ने फ्री रेशन देना चालू किया, गरीब लोगों के अकाउंट में पैसा डालना चालू किया, ये सब तो किया, सरकार की ओर से जो हो पाया हो तो हुआ ही, लेकिन ये शुभ की भावना वहाँ रिफ्लेक्ट होती है। आप इंडस्ट्री चला रहे हैं, तो आपने भी सोचा कि हमारे कोई एम्प्लॉइज, आपके यहाँ काम करने वाले छोटे से छोटे व्यक्ति भी वो भूखे नहीं सोए हैं ना, ऐसा ख्याल आप सब लोगों ने भी रखा, ये शुभ की भावना है। और पड़ोसी ने, अपने घर के बगल में रहने वाले, चाहे वो झोपड़ी में रहने वाले लोग कोई भूखे नहीं सोए हैं ना, ऐसा पड़ोसी ने भी ध्यान रखा। एनजीओ भी काम में लगी, हर पड़ोसी अपने पड़ोस में कोई भूखे नहीं सोते हैं ना, उसका ख्याल रखा। इंडस्ट्रीज ने अपनी ओर से ख्याल रखा, महाजनों ने अपनी ओर से ख्याल रखा, सरकार ने अपनी ओर से ख्याल रखा, और हिंदुस्तान 1.5 महीने तक लॉकडाउन में रहा, और ये लॉकडाउन के दरमियान शक्ति अर्जित कर ली कि हमें कैसे लड़ना है, और लड़ने का सारा संसाधन जुटा लिया, और दुनिया में बेस्ट कोविड मैनेजमेंट और वैक्सीनेशन करके दुनिया हमसे एक एग्जाम्पल के रूप में देखने लगी। ये अचीवमेंट, ये लाभ शुभ का है, ये हमारा नेचर है।
वंडरफुल सर, थैंक यू, थैंक यू। May I request our president to come up on the DS? सर आप अगर यहाँ पे रहेंगे 1-2 मिनट, वी वांट टू गिव अवे अ वेरी इंपॉर्टेंट अवार्ड, और ये पहली बार आईडीए में सर ये अवार्ड दे रही है इनोवेशन के लिए। सो मे आई रिक्वेस्ट यू टू हैंड ओवर, गिव मी द। And the first award goes to Zydus Life Sciences for their outstanding innovation in the year 2021, DNA vaccine ZyCoV-D. And may I request Pankaj Bhai to please come up along with Dr. Deven Parmar. Next award goes to, I need some representative from Aptar because they have sponsored this award, sir. Please come up. So this is known as the IDMA Aptar Innovation Award, and the second award goes to Swati Spentos Private Limited for your outstanding innovation in the year 2021, pentosan polysulfate sodium intravesical installation. Is anybody from there? Thank you very much, sir. So can we break for lunch now? So friends, we'll break for lunch. The VIP lunch is behind the stage, and for the rest of us, it's on my left. Yeah. So we'll assemble here at 2 o'clock for the first very interesting panel discussion. Please do your networking in the meantime and see that we are all here by 2 o'clock. Thank you very much.
Today is an important day for our organization. Our research facility, manufacturing unit, and the management office needed to be in close proximity. After months of looking, we might be able to decide where and how our business will take its next big leap. I'd heard enough about Palava, developed by the Lodha, and why it is the perfect city for us to set up our business. But I wanted to see it for myself. We started from a hotel in Andheri and drove towards Palava. Within an hour, the landscape changed and the air cleared up, and soon enough a very different skyline appeared on the horizon. As we entered the gates of Palava,
Please take your seats. We are starting a very, very interesting session. As the minister himself said, this is going to be an excellent session with three of the great stalwarts our industry has given. Where is it? Oh, here. Okay, sorry. Chalo. Right, so if you've all settled down, we will call the expert in the life sciences sector, Mr. Utkarsh Palnitkar, a very dear friend of IDMA and all the leading pharma associations. Utkarsh, may I request you to please come up? So, ladies and gentlemen, Utkarsh Palnitkar, most of you would have seen him during our Golden Jubilee 10 years ago, conducting several sessions, and he's back here in action for us. An experienced and proven advisory services professional with over 30 years of experience in strategic planning, policy development, and program management across multiple sectors. Consistent achievement of market leadership and pioneered new practices and products. Some of his few selected career accomplishments I want to share with you. India entry strategy for some of the largest global life sciences companies encompassing pharmaceuticals, biotechnology, and services. He pioneered investment promotion across sectors, projects, and geographies, led engagements related to investment promotions such as Vibrant Gujarat for multiple years, secured market leadership for the product. He set up and led the life science practice at Ernst & Young and then at KPMG to build market leadership, national leader for life sciences for more than 15 years. He developed and led the government practice for Ernst & Young as well as KPMG, developed and led several other leadership teams in KPMG, and he has been a chair and member of several committees of the Government of India and the industry. Currently, he is the founder of Arna Corporate Advisors since 2018, and they specialize in Indo-US joint ventures. He is an advanced management program graduate from Harvard Business School, FCA, Institute of Chartered Accountants of India, a BCom from Bombay University. He has done leadership skills for top managers from the Indian School of Business and leadership and corporate renewal of the Indian School of Business. With these few words, I would like to welcome Utkarsh. He will handle the session, the pharma industry pivoting for tomorrow. So Utkarsh, over to you. And you want me to invite the speakers and then you will introduce them briefly. But still, I think there will be some new things we would like to learn about these captains, right? So please invite them. Okay, come, please.
Thanks, Dara. I thought, Dara, you would have learnt a lesson when you called me for the Golden Jubilee, and you have me here again, so I deeply admire your judgment. It's wonderful to be with you here today. I'm at a loss of words to introduce such a stellar panel. Suffice to say, the three people who would sit on the dais, you would see about 3 lakh, and I calculated it this morning, 3,33,597 crores in market capitalization. I think these gentlemen need no further introduction beyond that. Let me please invite on stage Mr. Dilip Sanghvi. Shri Pankaj Patel. And of course, my fellow Hyderabadi Satish Reddy. So it's wonderful to be with you to celebrate 60 glorious years of IDMA. IDMA has nurtured a partnership not only amongst its members, but all stakeholders, including the government. But what really distinguishes IDMA from the multitude of other trade associations is really the pervasive spirit of camaraderie, which is so very, very evident today around this room as well. In these 60 years, IDMA has, and the Indian pharmaceutical industry, if you see, it's a reflection of the history of the Indian pharma industry. A lot has been said in the morning about the wonderful job that the industry has done, and I will not repeat and get into that. The topic for our panel this afternoon is the pharma industry pivoting for tomorrow. At IDMA's Golden Jubilee, 10 years ago, the panel deliberated on the future of Pharma Inc. The future which we discussed then is here today. The industry has notched several wins in the last 10 years and further strengthened its position. As I was preparing for this session this afternoon, I stumbled upon my notes from the last 10 years, which I had fortunately retained, and I found that the topics that we discussed then relating to innovation and its support, government regulations, pricing pressures, academia industry partnerships, and the like, remain as relevant today as they were 10 years ago. So while it's apparent that a number of things have changed in the last 10 years, some, like the ageless and ever-youthful Dara Patel, have remained the same. The American film producer Samuel Goldwyn said that never make forecasts, especially about the future. We were courageous 10 years ago to take a peek into the future and imagine what lay ahead of us. We are courageous again this afternoon, and especially after such a hearty lunch, to look at what the future beholds and what we can make of it. To enable us to do that, we have an outstanding panel of tall leaders, and we are going to leverage the advantage or the vantage point that they have to see what lies before us. So before we venture into pivoting to the future, it'll be useful to look at what the future beholds for us. Will we be doing more of the same? Or are there distinct signs of changes in the market and therefore operating models as well? This industry in particular has to confront the proverbial Red Queen effect, which, as you all know, is that you have to run twice as fast to remain at the same place. To help us understand what lies ahead and to start this conversation, may I please request Dilip Bhai to paint for us a picture of what he sees on the horizon in terms of avenues of growth and indeed the direction that the industry is likely to take.
Well, thank you, I think. Can you hear me?
I was strongly instructed, don't touch the mics, they're working.
Oh, they're working. It's working. Okay. No, thank you for asking this question, because I kind of go to sleep with this question, and when I wake up, it's hardly answered. So I think world around us is changing so rapidly. Technology is changing so rapidly in terms of our ability to manage the business. Also, I think the change of technology is leading to the way in which we do business changing rapidly. Regulatory environment around us is changing. Also, if I see internationally, then increasingly larger percentage of research investment is going into smaller and smaller diseases. So in all of this, where as Indian companies, we will find an opportunity to grow, because our challenges are a little bit different, because our country is in a different stage of economic growth and development. Our healthcare coefficients are very different from Western markets. So I think ability to look at opportunity from our vantage point. Your question was, I think, whether we want to do more of what we've done. So I'm sure that we have to do a lot of more of what we've done in the past. But also I think we had this panel headed by Pankaj Bhai looking at regulatory changes so that we can foster and create innovation hub in India, so that instead of only becoming successful in generics, how do we also become successful in new products? I see government focusing on medical devices because I think many diseases would be treated more effectively with devices and components. So I think changes are so rapid and so what you call pervasive across all sectors. I would believe that the younger companies which are coming up will have far greater opportunity to make an impact in our future than what all of us had because we started 30 years back. So I think great opportunity for us as a country and also for our industry.
Thank you, Dilip bhai. You know, taking on from what you said of avenues of growth, for the last decade or so, you know, the regulated markets, US especially, have been a pillar for the Indian pharmaceutical industry. Pankaj bhai, but over the years, you know, you've seen the competition increase, you've seen a consolidation of buyers, and you've seen, you know, price erosion also taking place. In such circumstances, if we want to sustain and grow that market, what do you think we need to do differently as an industry?
So, I think, Utkarsh bhai, the question itself has an answer, that we need to do something different than what we have been doing up till now. Now, what that difference could be would depend on companies to think and evolve, but it could be low-hanging fruits of 505(b)(2) or small innovations, or could be breakthrough innovations. It could also be that more complex drug delivery systems, drug and device combinations, and these kind of products which one need to think to do it. Broadly, if I say that when we look at the opportunity ahead of us, since morning we are hearing that some number which is $130 billion. Currently, our growth rate is about 6%. Our expectation of growth has to be almost double of that if we want to reach the 130 billion number. Now, if that has to be reached, it means that we need to do much more than what we have done up till now. And I think we need to move from a volume-based business to a value-based business. And that's going to become very, very important thing for all of us to really think through and come out. Now, every company may think it differently to do different initiatives, but I think that is ultimately will ensure not only what we see and projected as 130 billion as number, but also to address your question is only that can happen. Thank you.
Right. Thank you. What we've been seeing, especially in the last few months, is almost the rediscovery of the domestic markets. You know, the numbers are looking good, the profitability is looking good, and many companies, you know, who were focused on the US and regulated markets to a large degree have again started turning their attention back to India. Whilst the opportunity is certainly there, and every basis point growth in GDP, you see the market growing, but it comes with its own challenges. So what do you think the strategy should be to make most of the domestic market, Satish?
I mean, there's no simple solution to what it could be for the Indian market.
But clearly, again, that's the way you described it. It's an example of how our company also, which was very focused on the U.S. market, lost sight of the Indian market, and we slipped in the ranks. And then, if you see the last, say, 3 years, we have jumped ranks very rapidly. And we've also stated it openly, saying that that we are very focused on growth in the Indian market, and then we're going there. So I can only talk about, say, in terms of our company in relation to where the industry is going. So obviously, if you see the Indian market, it's always had its inherent strengths, because in terms of being able to introduce the products at affordable prices, large market, change in the disease patterns, in terms of how it was in the past, more towards chronic, lifestyle diseases and things like that. So that's something which always, gave a huge opportunity. But if you see, in the recent times, there are a lot of disruptions. Technology, like Dilip Bhai had talked about, it's also caused a kind of a disruption in the Indian market. So things will change. It won't be the same. So while most of our companies may have strong brands and all that, so there's changes happening. There's changes happening in the distribution chain. If you see technology, how it's disrupted all the way from pharmacies to how we manufacture the products, how we even develop products, that itself has quite a big change. But also it presents tremendous opportunities. In terms of improving access, that itself is a huge thing. So if you piece each one of these parts of the value chain, everywhere there's an opportunity, and that's where we feel very bullish about.
Pankaj Bhai, if I might push you a little further on this. When you've seen a consolidation of the buyers in the US, logically it makes sense that why haven't we seen a consolidation of the producers on the other side? Because you are targeting the same markets. You can rationalize marketing budgets. You can rationalize products. Let's hark back. Even if you don't talk of a full-blooded M&A or merger. Look, if we look at the example of Novartis and GSK, where they swapped their products and focused on areas where they felt their strengths. Why do you think, or do you think this is something that is worth pursuing?
So yeah, if you're thinking logically, that could be one of the options. But I think the biggest challenge is overlap.
Right.
Among the companies, there is significant level of overlap between the company's product. That's our biggest challenge in doing such things. And of course, US laws are different. So what we are discussing, I don't think it's practically possible under the US law to do that.
Right.
Because they will be anti-competitive. So it may not be the right thing to do from that angle as well. So though it's a logical idea, but I don't think it is a wise idea for business to think through.
Right. Dilip Bhai, continuing on the theme of growth, one measure is to widen the pond if we can't deepen it with more products. And, with the strength of the Indian pharmaceutical industry, almost every geography has been tapped. Japan and China in recent times, Japan more, has still been a conundrum. How will we crack the Japanese market?
No, when I succeed, I will tell you. But it's a complex market.
Right.
Pankaj Bhai will agree with me that it's not a market where you can make money easily. And but it's an attractive market. So for us, I think the challenge is how do we continue to learn more about the market and continue to invest while we become successful. So I think our expectation is that Illumia, the product that we've launched ourselves in Japan, will help us gain a certain amount of familiarity with the market. It may not help us become big in Japan, but it will help us understand the market a little bit better. And I think Pankaj Bhai spoke about innovation, and also Satish talks about product mix. So I think when you're investing in research, having ability to distribute the product yourself in major geographies is an important enabler because then you can amortize the investment of research on a larger geography. So I think as we become more international in terms of size and in terms of complexion of our business, having direct presence, maybe initially sustaining cost,
Right.
also may be justified because that cost will pay for itself multiple times when you're able to leverage your familiarity of market with your successful launches. So, but as I told you, as we learn more, I think I can share with you.
Absolutely. Pankaj, about 10 years ago, the next big thing was biopharmaceuticals. You have a slew of products that have been already registered in India. Many thought that this is going to be the next big avenue of growth for Indian pharma companies. A lot of Indian pharma companies today, if you may say so, have biotech branches on an essentially pharma tree, right? So everybody has added biotech to their business. Again, but the revenues and export revenues, especially from biopharmaceuticals, are still very modest.
So I think we are at the beginning of that journey. So looking at the overall opportunity of biopharma is big, but it's all price driven and not volume driven. Yeah. And all of us have learned volume game and not price game or value game. So I think the whole issue is around that. Now the markets which can offer reasonably higher price, they have created sort of artificial barriers to entry. And those barriers are such that unless you have deep pockets, it's impossible to get in. And there is no guaranteed success thereafter. So as a result, it has remained mostly India and emerging market focus for the Indian companies. However, what I see is that more and more drugs are coming from that origin. If we have to continue doing and growing the business with new products, ability to do this is important. Also, it is important that initially, like we were making some very basic formulations and making products, moved into more specialized control release products or drug delivery release products, and went into much higher level drug device combinations and whatnot. But then that happened because we had basic learning. Today, our companies are learning how biologics can be produced, what kind of regulatory process is involved in that, how do you measure the quality of that. All that capability industry has almost generated now in our country. I think the next big thing is going to be either a biobetter or a novel biologicals. My opinion personally is that the biologicals could be more exciting because the cost which market offers you when you sell is much higher. The biggest challenge is India the market for that? Answer is no. Because the largest selling product in India, if you take, would have hardly 500 crore rupees sale, and our largest selling product in US is $20 billion. Now, if you look at that scale, we would never have resources as what one can have it in US. So unless there is a policy intervention to find ways, how do we create Indian market more attractive, ability of Indian entrepreneurs to do significant new research will be always compromised and not possible. Some of us might be having resources to go in other markets and do it, yes, but other players would find so difficult because even if I do innovation, the revenues I earn are not enough to continue investing in research.
One of the challenges really, Pankaj Bhai, has been when you're talking about revenues is perhaps the inability of the government to distinguish ability to pay with pricing controls. And if you were to separate the ability to pay from, person like Satish and person like me, we pay the same price for a drug because of price control. Do you think, can we distinguish that and create separate freeways or pathways for sales?
I don't think it's possible to do so. It's a bright idea, but I don't think it is practical to implement.
Right. Coming back to biosimilars, do you think partnerships are the way ahead? Would that be a way to, in terms of regulated markets?
So, our industry has very typical characteristic. Every pharma company in this country or outside this country have always competed and collaborated together. So there are partnerships and also competition.
Right.
So that partnership is given as far as our industry is concerned. If you see globally, every company has partnered with somebody else at times. And then again, they have competed also at the same time. So I think industry has learned how to compete at the same time, remain a very good, successful partner on a particular target, particular segment, particular areas. So I think partnership is definitely the way forward.
Thanks. Satish, DRL, if you look at, has still a significant, I think if I'm right, between 15 to 17% of your revenues coming from API sales. API, at least certain segments of it, have been making a comeback with decent margins. Tell us about, continuing and focusing on APIs as an avenue of growth in revenues.
I would say it's one of the avenues.
Absolutely.
Obviously, it's in the limelight because of what happened during the COVID times, especially with China and a lot of our customers wanting to de-risk. That's why they've come back here. But I think it's a larger game in the long run, because if you see the predominance which Indian API had at one point of time, we have lost it, quite some time back. And a lot of it had to do with policies. It had to do with, the raw materials and, a host of factors. China factor being the prime one, of course. The scale and the economies of scale that they've built, the cost at which they could do, we could not compete. For us to regain that lost glory, it's going to be impossible to get to that stage. But at least in terms of being the right alternative, I think there's a lot of scope, especially at this point of time, because the PLI schemes have started coming in. But I think there's much more to be done, because when it comes to, especially investments, right, there's also one step forward which on the infrastructure, the government also has to pitch in industrial parks and all that, which is a big recommendation that we've made, because industry can't do it on its own.
Sure. Since you touched upon China, and these days any conversation with pharmaceuticals, you talk of a China +1. Now, does China, when you say +1, is it definitely only India, or are we being a little complacent about competition? Just let's take the example of our neighbor Bangladesh and what it's done in the last few years. Mind you, Bangladesh still has LDC conditions working for it till 2033. And very rapidly it could do. So in this scenario, do you think, or take Vietnam for industrial products, which got a lot more investments what we thought will come to it. So again, in terms of competition, where do you see competition coming from, either any of three, if you could?
No, in the sense that we've been in the API business, the CDMOs and all these businesses for a very long time.
Right.
So in terms of the capabilities that you build, it's also the credibility that you build with your customers. It's tremendous at this point of time, and customers won't switch easily. At least the people who are very cognizant of the value part of it, they're not going to switch easily. And again, even the regulatory part of it, it is not an easy game for everybody else to learn. But having said that, yes, there will be countries who will compete. But I think the scale at which we are now competing, and also the kind of capabilities and the competitive advantages that India has built up, we are in a good position at this point of time. The question is just needs that little more push from a couple of quarters to take it to the next step, because that it needs a sustained effort if you have to get back to what it is. Otherwise, that's why I talked about this policy. Right? This policy was being talked about since almost 2015. Only now we see it in implementation. When it was first announced, it took that much time because,
Sure. Dilip, the other dimension of looking at the future is the impact of digital, the impact of new technology, and ways of enhancing productivity and shoring up the bottom line. Your thoughts?
No, I think we, as an industry, have not leveraged digital in large number of areas that we could have leveraged. And there is an opportunity. We can use this for improving our marketing effectiveness. We can use it for improving our manufacturing efficiency, costs. We could look at many things that we are currently not done. I see, at least since last 2 years, companies making serious effort as well as investment, so that our ability to leverage digital capabilities in analytics, in terms of machine learning, or things which will help us in terms of decision support systems, I think will help us become more effective. My own sense is that globally also, the impact that digital technology was expected to make in innovation has only partially been realized.
Right.
But in business and in operations, I think the value that the industry has created in terms of benefit is significant. Also, I think the ability to connect directly to consumers, to help them use this understanding and knowledge to have a better quality of life. I think these are great opportunities for us to learn from and improve.
Yeah, please.
Oh, I think the COVID times also taught all of us within the industry to accelerate. It was something that all of us faced, because especially when our medical reps could not meet with the doctors, there were digital ways of using it. And that led to more and more initiatives across the company, everywhere, whether it was operations, like Dilip Bhai said, or whether it was in the sales and marketing. All across the company, I think people have speeded up, which is a good thing. And even the various initiatives that's been happening across this industry when it concerns digital, they've gone on to a very different scale.
Right.
All of this is good for the industry. All of this is extremely good for the industry, because it certainly disrupts.
Another thing, Satish, since you've touched upon digital and medical representatives, you've seen the growth of e-pharmacies. And they've started growing, and at some point, still at this point of time, they have a modest number, but that number is likely to grow. You've seen the investments in e-pharmacies as well. At some point of time, there will be consolidation in e-pharmacies, and the real big question is, when do the Amazons and Reliance Retails of the world enter e-pharmacies? In that scenario, do you see e-pharmacies as a complementary channel or a threat in terms of consolidation of buying power?
No, it is the transitionary phase, let me put it that way, because it was bound to happen. Reliance, by the way, is already in e-pharmacies with the netmeds.
Yeah.
And
so is Tata through 1mg.
So is Tata through 1mg, and there'll be more people who have already built up scale. So, this is here to stay, not that we can wish it away, because it certainly brings in certain efficiencies. But I think as an industry, and I think even from the policymakers, they also have to look at the regulation part of it very closely. There are discussions going on that. To also streamline it so that it does not lead to unethical practices, which is something we would be very wary of, because in the interest of the patient.
Absolutely.
Right, because that's something we have to be careful.
Yeah. Pankaj Bhai, a subject close to your heart, innovation. In the last few years, we've seen a very creditable increase in the innovation pipeline, whether it's the large companies. What's even more encouraging is the number of young companies who are focused in innovation, whether it's Bangalore, Hyderabad, Pune, and take whether it's Bugwork, Zomator, they're receiving funding as well. But we've not seen large companies partner. These companies lack managerial bandwidth, lack the capacities. Two parts of this question. One, you've not seen partnerships between Indian companies and these younger companies. And two, if you total the entire arsenal of innovative products, when do you think we'll start realizing revenues from innovation?
So I think first question, I think I will address the first one. So yes, there are companies who are now initiating. Right. I don't think for large companies to get into a very early stage into this innovation may not be a great idea. But at an advanced stage, when major investment in clinical studies and expertise is required, that's the time large companies can actually come and play an important role, because not only funding but also providing a kind of expertise in that area would be there. Most of these companies are currently either preclinical or touching phase 1, that kind of situation which I am aware of. So I think it's future, but definitely there are going to be opportunity, and of course all of us sitting here and our colleagues, other colleagues, also are looking that with an open mind. Question is that at what stage to enter? Right. Unless you have maybe early phase 2 data with a proof of concept, it's very difficult for large companies to really get into that, because they themselves have their own program and they need to really focus on that.
Sure. No, just to add on to what Pankaj Bhai said, that's very important, because I think when it comes to innovation, we are also in the evolutionary phase, right? So companies like us have been in it for the last almost close to 30 years now,
Right,
still
right.
don't have success, but we're still going at it. I mean, you know, everybody here is investing heavily into this. The thing is, especially when it comes to clinical trials, that's where the big cost is. So
Correct.
we also have a model by which we'll out-license, because we can't take it through fully at this point of time. In that scenario, you know, especially for us to also put one more foot into, you know, trying to help the startups, I think it's a bit too early. However, having said that, I think what especially we worked with Pankaj Bhai in the committee that he headed was also to recommend how do we shape this whole innovation ecosystem in this country. You know, so that even when it comes to startups, because there's a lot of government funding behind it, you know, through various programs of DBT, DST and all that. So if there's a way to channelize all that, if there's a way to also create the ecosystem so that there's also more discoveries coming in from academics, you know, there's a lot of work which needs to be done so that you can shape that whole ecosystem. Plus also government pitching in with funds.
So to be a little provocative, when you talked about government funding, if you total the R&D expenditure in India, it's still largely in the public sector. You look at the number of laboratories that exist in the government system. CSIR has 40 odd, DBT has its own, and then you have a multitude. Isn't it Sumantra Ghoshal, Satish, if you remember, he said that radical change can't come in incremental steps. So you need radical changes. Dilip bhai, can we then start looking at selectively maybe privatization of some of these government laboratories or larger partnerships? Some of them are, in the midst of issuing PhD degrees, some of them in the quest of knowledge and truth, and a lot of capital is lying locked there. Can we utilize it more productively?
No, I think clearly there is a huge investment already done, and government continues to make in these labs. And I think there are ongoing discussions about how to leverage these investments and annual spend on producing better outcome and better return.
Right.
But also I think we need to be cognizant on one issue, is that however large our investment is, but when we look at this in context of NIH and others,
right.
international investments, it's still small. And I think to expect that the government labs will produce innovation. So NIH doesn't produce innovation, but their innovation is used by the industry for developing new products. So I think, how do you build an ecosystem in India which will say, what are our challenges? Pankaj bhai, me, Satish, all of us are also focused on our EBITDA, our profitability, and our return.
Sure.
Now, in the US, we are competing with companies who have no desire to produce profit. They continue to invest hundreds of millions of dollars every year, and they keep on raising new money. So I think unless and until the financing model changes and stock markets become sophisticated enough to recognize the value which is getting created, it will be a challenge to invest in, because we invest part of what we earn into research. These companies raise money to invest in research. So there is a big difference in the way these companies are getting funded. So I think there will be, it's an evolutionary stage.
Sure. I have about 40 more questions and we could carry on till the entire evening, but I know so do you. With a view to, before I throw the floor open for questions from all of you, my three final questions, and if I could again begin with you, Dilip bhai. The Indian industry has done phenomenally well. Like a rocket, everything holding it back, it's reached a lofty orbit. But we don't want to just be in that orbit, right? Our ambitions are much more. We want to go ahead. For that, a rocket has to fly at the speed of 25,000 miles an hour. It does that by using what are called as booster rockets or booster engines. To your mind, what does the Indian pharma industry, using the same analogy, what booster rockets or engines are required for us to truly forge ahead?
So clearly, we have generics in India, emerging markets, and in other countries. We need to do well in innovation, and I think all three of us have been talking about that.
Right.
And what we need is 1, 2, 3 successful Indian products globally, either marketed by us or licensed to somebody else. And I see that many of our products are in phase 2. One of our product is in phase 3. Pankaj Bhai has also similar things. Satish also. So hopefully one of them will come to market and help. And I think that my own sense is one success will lead to more investment and more successes.
Right. Thank you. Pankaj Bhai, you are looked upon as many of the young budding entrepreneurs would like to sit where you are today and achieve the same level of success. But with one caveat, they want to do it in half the time that it took you. So what message would you send to such entrepreneurs?
There are no shortcuts in this industry. You have to have patience and do good science.
Right.
If you do good science and have patience to continue doing good science, you will hit the success. But without good science, accepting overnight success may not be a great idea for you. You might get success, but it may not be sustainable.
Sure.
So that's the way I see it. I just to add to what innovation thing is, I believe that, you know, today in the morning we heard that now there are about 28 molecules which are in a different stage of clinical development in India. The issue, and then like companies are like, we have 2 NCs already approved in India. One of the NC, both the NCs now under US clinical studies in phase 2 and phase 3. And I believe that that itself tells us that it's there. But the question would be, today everybody say, we are all talking about it.
Sure.
We have not demonstrated and successfully proved to the world that we can do it. But the day one company, Indian company will get success in the Western market, the whole capital is going to run to India. Because there's a lot of talent sitting here. All of them are capable of doing the same thing which my company, Dilip Bhai company, or Satish's company can do. So I'm pretty sure that the capital will come here, things will happen in India. I think what we need in India is to do something about the talent. The talent is still missing. We do have large pharmacy graduates. We have large number of people who understand the galenical production and development, all these formulation development. We still have to get the good medicinal chemist. We need to get good translational pharmacologist and things like that. And I think India need to do this. So if the national labs have to do something, has to produce this material.
Right.
If they produce that material, I'm sure people are here to grab them and create really things. So that is what I believe is missing in India. But I'm waiting for the day when one of the Indian companies is successful in the developed market and everything will become a history. And I think all of us are going to jump into that bandwagon and make things happen. So I'm very bullish about it.
Fantastic. Two questions quickly. What Pankaj Bhai talked about is talent. And Satish, you've been the chairman of the Skill Development Council. What's been your experience thus far? And in your mind, 10 years from now, IDMA will celebrate its platinum jubilee. What would have changed besides the moderator?
No, I think, see, on the Skill Council part, it's more an issue of today, right? So because if you see a large number of graduates coming in and joining our companies, they don't have the requisite skills required in the industry because the curriculum is very different. They don't have much of practical experience and all that. So there is a certain standards which were set by the Skill Development Council, and then companies are able to certify.
Right.
Right. So at least you're able to to know where you stand in terms of skills and to take it forward. So at least for the existing part of it, I mean, it was serving the existing needs and also probably to help the growth of the industry. That was one part of it. Sorry, I missed the
What will
second part.
change 10 years from now?
What will change 10 years from now? So I think I reflect what both Pankaj Bhai and Dilip Bhai have said. Because I think all of us are looking, to this day, when if you have seen my father's book, it's titled The Unfinished Agenda.
Right. Absolutely.
So the agenda will,
Right,
somewhere get to the
right,
finish.
right.
If at least one of these products,
Right.
Developed by any of our companies, in India, reaches its milestone of, being the molecule in the market.
Right.
That's what we're looking for.
On that happy thought, I'd love to open the floor open to questions. Quick ground rules. Please keep your questions brief so we can take as many questions as we can. Please raise your hand so the mic can come towards you, and please no follow-up questions, please. We have one question here. Mehul has a question. Obviously, the person where the mic reaches first wins. So it's that lady who will decide. Ladies.
Question to Dilip Bhai. Dilip Bhai, IDMA, we have more than 1,000 members, and almost all the members are below 1,000 crore turnover. And so question to you is that what 2 or 3 things 50 crore company to do so that in next 5 to 7 years they can become 500 crore company? And what 500 crore company should think to become 5,000 crore company?
No, I think it's a interesting question to ask, difficult to answer.
Well said.
But if I look at my life and my own experience, I think I have always focused on unsolved problems. Now, if you solve a problem which remains unsolved, your ability to leverage that for success is far higher than trying to solve a problem which others have already solved. Then you have to struggle. So I think there are markets which have challenge in terms of entry, but inside the room is not crowded. And then there are markets which are easy to enter, but inside the room it is very crowded. So we have to decide which kind of business we want to do. General approach I see is that people want to get into easy to enter markets, but then they have struggle moving from one end of the room to the other. So general suggestion would be try and get into some business which is give you a relative ease of growth. Because all these companies will have different businesses, different opportunities. So I hope this will help.
Sure, thank you. We have another question here. Yes, sir.
Thanks, Utkarsh. Chakravarti from Hyderabad. I'm sorry, the question will be around 20 seconds. Heads up to all the captains of Pharma.
We can't hear you very clearly. Yeah, better.
Well, unfortunately, the common perception outside this hall, outside the pharma industry, everyone is making so much of money. Pharma industry is really looting is a little lean word, but that's a perception. But having observed the pharma industry for all the 20 years closely, even domestic market, the prices are not stable, the policy is not stable. I'm sorry, all the policymakers are here. And also generic market exports used to be a golden goose. Now it is on attrition. Rather, it is coming to almost a plateau because maybe...
So I'm sorry to butt in. What is your question?
Question is, pharma industry has huge challenges, domestic and export also. But how much we are all struggling, the outside people are not knowing actually. How you convey the message to the common public also.
So you've got, it's the trade associations up here. Do we have another question before we? What? The very last question, yes.
So this question is to all of you. The domestic pharma industry has emerged to the by and large 2 lakh crore by the year end, and still we have been hoping for the great progress of the domestic industry. But what is your anticipation for next 10 years? How do you see the CAGR of domestic pharmaceutical industry, the branded domestic pharmaceutical industry?
My gosh.
So I think it's again same response to you. Forecasting, if I knew, I would not have been sitting here. So please understand that very clearly. Anything to forecast future is very dangerous and difficult, and I would not dare to do so, because situation will change and things can change. COVID came and market went down. COVID went away, markets are looking okay. But last month the growth of the market looking. So this seesaw will continue. Question would be to grow, the market to grow overall, it's unless people have money. If the economy grows, if the GDP grows, people will have money to spend. because most of the market is out of the pocket today. Now, as government is planning to do more, maybe the market will expand, and because of that as well, because as healthcare spend goes up, pharmaceutical industry will also be benefited out of it. But if I have to just guess, maybe average 10 to 12% should be possible.
Would you like to add to that, Dilip?
I think all macroeconomic factors are in favor of growth. With increasing economic prosperity and increasing life expectancy, I see increasing usage of pharmaceutical, because if you see even in our families, in first 40-45 years of life, we hardly consume any drugs. Now typically in the morning I take 4 tablets, in the evening I take 4 tablets, which for first 45 years I wasn't a customer for the industry. So as life expectancy is increasing, drug usage will increase. So India will continue to have a larger consumption, and I expect pharma industry to grow a few percentage point higher than the overall GDP increase.
Since we spoke about the future, let me conclude this session with what Mother Teresa said. Yesterday is gone. The future is yet to come. We have today with us. Let us begin. Please join me in congratulating such a stellar panel. Thank you.
Thank you very much, Utkarsh. You've done a wonderful job, and thank you very much, Dilip Sanghvi ji, Mr. Pankaj Patel, and Satish Reddy ji. If you can kindly remain on the stage, we'll just present a small memento for you. May I request our President to please come up and present the memento to Utkarsh Palnetkar. May I request Mr. Mahesh Doshi to come up and present a memento to Dilip Sanghvi. I'll request Mehul Bhai to please come up and present the bouquet to Mr. Pankaj Patel. And I'll request Dr. George Patani to present a memento to Dr. Satish Reddy. So thank you very much, and a big round of applause to all of them. So we now have a very important award to be given away, and this is known as the N.I. Gandhi IDMA Chief Mentor Award. And we've been giving this to our past presidents. I'll tell Mrs. Gandhi. Yeah. So these awards are given to former presidents who have contributed not only during their years, but also throughout, mentoring us, guiding us, involving themselves. So we would like to commence these awards, and I'd like to request our president to be present on the dais. May I request Mr. S.V. Viramani, Founder, Chairman and Managing Director of Forts Laboratories Private Limited, to please step up on the dais, along with Madam Viramani. No, not now. May I request Kunal Gandhi, Mrs. Mehal Gandhi, and your daughter-in-law also to please come up on the dais. So I'd like to read the citation. A first-class chemistry graduate and master's in business administration. He was a national president of Indian Drug Manufacturers Association for a record 3 years. Ladies and gentlemen, you should know that IDMA's tenure for presidents is only 2 years. But certain presidents, because they did extremely well and there was some continuity required, so we requested them to continue for 1 more year. And that's why I call them the 3-year club members. It started with Mr. N.H. Israni. Then we had Mr. N.R. Munjal. Then we had Mr. Viramani. And then we had Mr. Deepnath Roy Chaudhary. But now that we have a senior vice president already in waiting, I doubt whether Dr. Viranchi Shah will get a 3rd year. But this was on the lighter side. He created the anthem for Idma, the one which you saw today. That was Mr. Viramani's brainchild. As a national president of IDMA, he increased our membership to more than 1,000 members, formed new expert committees for industry-academia interaction, contract manufacturing and NDPS, worked with the Government of India on streamlining FDCs, establishment of new FSSAI guidelines, stability in pricing and technology upgradation scheme for SMEs. We presented a white paper on journey towards Pharma Vision 2020 and beyond to the Government of India. IDMA, in collaboration with NSF UK, created an advanced program in pharmaceutical quality management. He led the pharma delegation to China and Japan. Under his leadership, Forts won the IDMA Quality Excellence Award 10 times. Forts is also a recipient of Outstanding Export Performance Awards. Forts is ranked among the top 50 pharma companies in India. He has been associated with Indian pharma industry for over 50 years. Pharmexil, he is the chairman of Tamil Nadu Pharmaceutical Sciences Welfare Trust, life member of Indian Pharmaceutical Association, and president of Indian Pharmaceutical Congress Association for the year 2016. May I now request our president and our immediate past president, along with Kunal and Mrs. N.I. Gandhi, to please present this very prestigious IDMA N.I. Gandhi Chief Mentor Award to Mr. S.V. Viramani. As you all know, behind every successful man, there is a much more successful woman. And it is my privilege to present this lovely bouquet of flowers to Madam Radha Viramani, with the permission of the President, of course. So I'll request the dignitaries to remain standing, and we have another award. This award is also being given to a extremely capable former national president. And that is Mr. Deepnath Roy Chaudhary, Managing Director of Strassenberg Pharmaceutical. May I request Mrs. Roy Chaudhary to please join us on the dais. So let me tell you about achievements of Mr. Deepnath Roy Chaudhary. A rank holder in higher secondary and graduation examinations, Deepnath Roy Chaudhary was awarded the National Scholarship and National Talent Search Scholarship also. Managing Director, Strassenberg Pharmaceuticals Limited, a pharmaceutical formulation and manufacturing and marketing company across the country they are established. Promoter Director of Cans and Closures, a leading manufacturer of PET packaging products, that is PET, catering to Coca-Cola chain and the pharma industry. He was instrumental in launching the largest stem cell banking network in the APEC region, Cord Life in India, in collaboration with Strassenberg. An active Rotarian for the last 28 years, Deepnath Roy Chaudhary has been involved in various projects assisting and uplifting the underprivileged sections of our society. In Idma, he has been an active member of the Indian Drug Manufacturers Association for many, many years and has served the association in various capacities. He was the national president for 3 years, 2017, 18, and 19. A man on the move, he made innumerable trips to Delhi, thereby increasing interaction with government authorities, visited all the major state boards, thereby building stronger bonds between headquarters and state boards. Due to his quick grasp of issues and articulate communication, he has been able to convince government authorities in promptly resolving various issues. And ever since he laid down office, he's been extremely involved in IDMA's activities and is just a phone call away whenever we need his guidance, or even today when we need him to join us to visit Delhi. So thank you very much, Mr. Deepnath Roy Chaudhary, for whatever you've done with us. And may I request the President and Mahesh Bhai to please present this award to Deepnath Roy Chaudhary. And as you all know, Calcutta is a very far-off place, whether from Delhi or Mumbai. And Mrs. Roy Chaudhary has been very kind to lend Deepnath Roy Chaudhary to us for more than 3 years, and for which we are thankful to you, madam, for all the support you have given him. I'm very sorry I overlooked the fact that Mr. Viramani should have given a little response. So, sir, may I request you to come up immediately after Deepnath Roy Chaudhary. Deepnath ji, would you like to say a few words, please? Yeah, please.
I am indeed honored and privileged by this recognition, and I accept it in all humility. I owe this recognition to each one of my colleagues and seniors in IDMA and the Indian pharmaceutical industry. It is a nice feeling that one could be of some service to the association and the Indian pharma industry at large. To summarize the takeaway from this wonderful, fulfilling IDMA journey so far, I would like to quote the great son of India, Gurudev Tagore. I have received much more from the people than I have given them. Thank you all for your support and affection. May all of you have a happy and healthy 2022. May God bless us all.
May I request you, Mr. Viramani, to please... Mr. Viramani is also a very active Rotarian, and I think once he finishes his term with PharmExcel, he will become the district governor of Rotary.
National President of IDMA, members of IDMA and dignitaries and friends. I feel very honored to receive this award. And, I love IDMA, and I have been in the pharma industry for 50 years and associated with IDMA at least for more than 35 years. And over 30 years, I have witnessed the evolution of the Indian pharmaceutical industry, emergence of many SMEs, and the challenges we face through COVID now. And government, now the thing is, the government support is to industry is one of the best ever. And when we have been increasing recognition we are getting to IDMA by government, industry, it gladdens my heart, especially when the Honorable Prime Minister says that India is a pharmacy of the world and the Indian pharmaceutical industry is an asset to the entire world. It elevates my pride and our image. I will continue to support IDMA in my lifetime, the Indian pharmaceutical industry, and the emergence of young leaders in the IDMA augurs well for IDMA. They are already discussing, our current president is already discussing about what our stalwarts have been discussing about digitalization, innovation, and export, so many international business, and free trade agreements, so many things are being discussed now, and IDMA is most active than ever. I am sure we will definitely go successfully to the next 75th year of IDMA. Thank you very much.
So we now have another very interesting panel discussion happening. Private equity fueling growth in pharma SMEs. And we have Mr. Ramesh Damani, member BSE and chairman DMART, who will be moderating the panel. May I request you, sir, to please come up on the dais. Mr. Damani is a well-known personality in the pharma industry. And sir, we remember you were there with us in our Golden Jubilee celebrations also. So whilst everybody knows you, I always like to hear my voice. So I will introduce you very briefly, sir, with your permission. A member of the Bombay Stock Exchange, a graduate of HR College, Mumbai, he did his MBA from California State University, Northridge. He is currently the chairman of Avenue Supermarts Limited, DMart. Prior to joining Avenue Supermarkets, he was and remains managing director of Ramesh S. Damani Finance Private Limited. They are members of BSE. He also serves on the boards of VIP Industries Limited and Aptech Limited, and independent director. He has hosted several shows on CNBC TV 18 and is a frequent commentator on financial issues on various business channels. So, sir, I request you now to conduct the panel discussion with the panelists. Thank you very much, sir. Great meeting you.
Thank you. Good afternoon. Charles Revson, the man who founded the beauty empire of Revlon, was once asked what he did. And he said, well, in the factories we make cosmetics, but in the store we sell hope. Much like the members of IDMA who are selling not a cocktail of chemicals or various combinations, but selling potent prescriptions of hope and health for and to the world. So on your diamond anniversary, please let me wish you hearty congratulations and best wishes for the next 60. Congratulations, gentlemen, ladies. Not many people know that IDMA was founded in 1960, almost the same year as OPEC. NASSCOM, the other flagship industry association, was not founded until 1998. Software and pharma are the twin pillars that make us all proud as Indians. It proves that we are a nation of brains and intellect, and not just geologically lucky. 3% of the global population, as my fellow panelist, Dr. Verma said, fall sick on any given day. And COVID keeps underlining the necessity of good health and good healthcare infrastructure. Therefore, what are the challenges and what are the opportunities we face in keeping the world alive and healthy? Is it time, even for us in the drug industry, to take on our software boys? And how do we strive from being the third largest in the world by volume to becoming the largest? And most importantly for this panel, what will be the role and need of private equity in chasing this dream? To understand this question and answer more pointed questions, I'm joined by two extremely able sharpshooters, Amit Verma, Managing Partner of Quadria Capital, and Utpal Sheth, CEO of Red Enterprises. Gentlemen, please give them a round of applause to welcome them. Good afternoon again, gentlemen. Welcome to the panel. Thank you. Amit, let me just start with you. Investors have cash but lack ideas. Entrepreneurs have ideas but lack cash sometimes. Other than capital, what does a PE firm bring or should bring to the table?
First up, thank you very much for the kind invite, and it's an absolute honor to be here. All my life, I've been one of those prescribers. So it's very good to be on the other side of the table for the first time, to be able to enable drug manufacturing. I think private equity is a double-edged sword. Private equity pretends to be very smart with its capital, but there are very few times where I believe that private equity actually helps and enables. And let me give you a prime example. Value creation is probably the most abused word by every private equity individual. And there is this great belief that the PE guys are smarter and they will show up at your doorstep when I talk about entrepreneurs and pretend that we will change the world. I think from our perspective, PE provides discipline. PE provides initiative of thinking bigger. PE enables a pathway because PE is laser focused on exit. And for that exit to happen, some amount of value has to get created on the balance sheet. And it's not just about the balance sheet, it's about what we do with the business. And lastly, PE enables a global outlook. And it enables to get the best from all across the globe and bring it to that particular instance.
Thanks, Amit. Utpal, let me just bring you in on the conversation. Amit spoke about the role of PE, but you're a management expert also, and Peter Drucker once said that culture eats strategy for breakfast. How important is culture, particularly when you're talking to an audience of SMEs, creating a business from scratch up? What is the importance of that, and what are the important key factors that are important in building a culture?
Thank you, Rameshji. And let me reiterate that it's a privilege to be here amongst all of you. Thank you for inviting me. And it's a privilege to be on this panel with two giants of this space. We are big believers of culture. We think that the world is driven more and more by intangibles rather than by tangibles. And culture is the foundation of those intangibles. We feel that culture embraces every component of business. It embraces the customers, it embraces the employees, it embraces how the employees deal with the customers. However, it goes beyond just business. It also goes to how you think about risk, how you think about capital allocation, how you think about longevity, how you think about the value drivers. So we feel that culture is very fundamental. And if I may add to the question that was asked to Amit, I think private equity investors like Amit bring in that recognition of those intangible factors which go into making up the culture of a company. They identify those well and help fine-tune it, help sharpen it, and help leverage it. So I feel that culture, along with private equity, is a good combination for most businesses and entrepreneurs.
Utpal, you talked about some intangibles, but let me bring you to the more tangible world, both of you to the more tangible world. I know a common investment that both of you have is a company called Concord Biotech. How did you approach it? You were the first early investor, Utpal, into that company. In terms of culture, in terms of understanding private equity, what did you bring to the table and why was Concord special to you?
Okay. Before I answer that, Rameshi, I will just make a small distinction. Given that I represent Rare Enterprises, we are not private equity investors.
Right.
We are a proprietary asset management firm and therefore have a time horizon which is longer than most private equity guys.
You're not laser focused on the exit.
Yes. We are not laser focused on the exit. What are we laser focused on? We are laser focused on terminal value. And therefore, we invested in Concord sometime in 2006. It's been 16 years and we are not looking for an exit.
Amit's shaking in his boots. What are you doing? No, but what attracted you? Let's get to that part.
So, here was a gentleman who had given the technology, who had come up with the technology to make, I think, one of the statins and sold that technology to Teva. So,
the Israeli giant.
The inherent skill set was established. Now here he was, he was an expert on fermentation technology. However, he was not going for the high volume, low value products. He was going for high value, low volume products. And within that, he was focusing on immunosuppressants. He was the least cost producer of immunosuppressants worldwide. And we loved the focus on immunosuppressants because we felt that in the pharma space, we've always valued businesses catering to chronic diseases much more than businesses valued which are catering to acute diseases. Here, not only was he addressing a chronic disease, but it was a non-switchable chronic. In the sense, once you start with one particular immunosuppressants, it is very difficult to even switch the brand. So non-switchable immunosuppressants catering to lifetime consumption of that medicine and being the world leader in terms of the least cost player was a very attractive proposition, and hence we invested in that.
Amit, let me come back to you. PE firms always tell me they look for huge marketplaces, huge opportunities. And here Utpal's saying, I'm looking for a specialized market, dominating a corner. What is your thought on that?
So I think I come from a slightly different plane, and if I could use a few minutes to explain who we are and why we do the madness that I'm going to tell you. We are probably now the largest healthcare dedicated private equity investor in Asia. We have almost $2.9 billion of assets under management. And we only do Asia, and we only do healthcare. 40% of my portfolio is sitting in pharma. At the cost of sounding arrogant, our capital is slightly smarter because there is a certain amount of domain expertise that we bring to the table. There is enough capital sitting in this room. There's a lot of capital which is far smarter than me and my outfit. I think what we are able to do is speak the lingo, connect the dots, get the best opportunities from across the globe, and shamelessly borrow. That's what we do. I certainly believe, and post-COVID is the right time to have this discussion, that this room should pivot away from the volume game that we've been playing for so many years and get as specialized and as niche as you can. The volume game will continue to have pricing pressures, which we are seeing not just in the US, but also in the rest of the world and our domestic markets. But what you can't take away is when you get specialized. So coming back to your question, what did we see? A great entrepreneur utilizing fermentation technology, which is not chemicals, but it is a marriage of biology and chemistry, backed by a well-reputed asset manager which Utpal did not mention, are far smarter than we are. That's the reason they're not exiting. And more importantly, we thought we could enable them to grow bigger, faster, and quicker. That's it. So for us, the horizon for timeline and exit exists. That's a true fact. Unlike Utpal, that's not my capital. Unlike you, it's not my capital. I'm a custodian of somebody else's capital. But I think by hastening the process and bringing the process to a finite exit event brings honesty and rigor back into the company.
Right. But you also said, Amit, that in terms of healthcare, you believe that private capital is more important than public capital. Why would you think that?
Sir, I'm sitting here speaking to you post-COVID, where there is not a single nation in the world which can claim that they did a good job in COVID. Not a single one. There are examples of socialized medicine, public medicine, private medicine in the US. We all failed. As I sit here and I look at the Indian healthcare landscape, we in the public sector and the governments will never be able to spend enough healthcare dollars for this reality to change. The reason why I'm a big backer of private capital, because the government will succeed to a certain level. I would like public dollars or public rupees to be spent on rural infrastructure, prevention, and augmenting the primary healthcare centers, and not wasting money trying to put up tertiary quaternary care hospitals or enabling large public sector pharma companies. My firm belief is that specialized medicine, specialized healthcare will get delivered more efficiently by private, while things like prevention, vaccination, and public health should be delivered by the government.
Okay. Amit, you also said, which I use in the introduction, that on any given day, 3% of the global population, that's a great stat, 3% of the global population is not feeling well. That problem represents an opportunity for somebody. And where is the opportunity for our delegates out here?
So I think COVID, and now I'm speaking as a doctor, not as an investor. I spent 35 years of my life practicing as an intensive care medicine expert. And what I ended up realizing is that the whole system is flawed. It's flawed from a perspective that we are so busy treating people who are sick that we are not spending enough time, money, energy to prevent people falling sick. We will never have enough infrastructure. You will never create enough drugs to treat all the diseases in the world. You will never be able to do it at price points that we need. So at the end of the day, there are 4 pillars that will change the paradigm of healthcare. It's all about accessibility in our country, especially in rural and tier 3. It is all about awareness. So people will need to be made aware the same way we made, everybody now talks about RT-PCRs as if it's like, it's some technology that we were born with. It's a very sophisticated technology. We will have to make it affordable in India. So regardless of whatever we do, the price points have to be at a level that makes sense. And the word that we should be talking about in this room a lot is all about quality. Quality cannot be junked at the price of, because of price. We have to have now a focus on creating high quality, and this room is testimony to it, that we in the pharma industry are viewed as high quality producers. But now let's stay focused to start creating value. Get away from this volume.
Move into that specialized segment. But you're not necessarily a big advocate of Indian innovation.
I should be careful how I word it. Indian innovation is a bit of a challenge. And I think some of it is cultural, because we don't grow up in a very innovative ecosystem. Whether it's our education system, it's how we create companies, the scarcity of resources, initially financial and otherwise. So I think innovation can be done, but it will be done in very few pockets. I do believe that we are very good as a country at making something better when it's already good.
It's called the Jugaad economy, I think. You didn't want to use the word.
I'm actually not a believer in Jugaad. I honestly believe that we are much better than Jugaad.
Okay. Utpal,
Let me ask you, your boss, Rakesh, who was also supposed to be on the panel and couldn't make it because of ill health, amazingly, he's a great judge of talent. If any of these delegates were to approach you in the lift and give you the elevator pitch, what would you look for? What is the characteristics that you're looking for?
Sure. So, you know, Rakesh is a big believer of understanding the big opportunity, and I fine-tune it and polish it and call it mega trend. So we would like to see a company going after a really big opportunity, which is a structural opportunity, which is not a tactical opportunity. Secondly, we would like to see some leadership attributes there, either being the least cost player, or having having market share, or having a competitive edge or a moat, which will ensure that they can keep out delivering on others. And when we get this interface of megatrends and leadership, then that is a great combination for us to have. While that is a necessary condition, it is not a sufficient condition. The sufficient condition then comes to the management team. The culture and the mindset of the management team is what we try to assess. Initially, it is a judgment call, but over a period of time, it helps us fine-tune our exposures. For example, you've seen Rakesh ji buy Titan at a very different price point. But over the years, as his confidence in that management team and his conviction in the megatrend and the leadership both kept on rising, he kept on adding to that position.
Instead of selling, he's scaling up.
Yes. So I think this probability adjusted scaling up of our investment bets, or rather investment positions, is very important to us. But the starting point is the confluence of megatrends, leadership, culture, and mindset.
And you're able to judge this, or at least your boss was able to judge this in an elevator pitch? I mean, is it something that comes instinctively to you?
See, we've had our share of lemons. It's not that we don't make mistakes. We do make mistakes. However, the idea is when we make it right, we get it right, it's a big one. For example, we talked about the investment in Concord. We visited them in 2006, flew to Ahmedabad and met the promoter for the first time on that day. And by the evening, we had a term sheet signed. There is probably no other investor of
that quick on his feet.
Yeah.
If you could share, what was the size of that investment at that time? Do you remember?
It was about 30
crores or so?
Between 30 and 40 crores.
30 crores and 40 crores immediately. Speaking of investment, Amit, let me come back to you. I'm sure in 2020, Jan, you were a different investor than the one you're today. What has changed, and what has changed in the world of medicine also?
Actually, what's changed for me, we raised our fund in April of 2020, just as it was escaping from Wuhan. It was starting to show that this was not normal. This was something that we had not seen before. And actually, as I sit here in April of 2022, I am far more bullish, far more optimistic, and clearer that the world of medicine has changed fundamentally. And we investors, and in fact, anybody who's an entrepreneur in healthcare, will have to change. And let me give you some examples. For the first time, we saw something that was a new disease, and I'm deliberately calling it new disease because we didn't know how to treat it. In a record time of 18 months, we used mRNA technology, which had not been used before, large scale. We've created at least 10 vaccines that work. We've created monoclonal antibody cocktails that work. And now we are clearer on how to deal with public health policy. The pivot towards telemedicine, the pivot towards ease of distribution, supply chain issues, disruptions across the globe, whether it is shipping or otherwise, is personified, and it's become very clear. I know today that my portfolio companies, their profitability in 2022 is higher than what it was in 2020. And the key decision here was to get rid of all the flab. For the first time, I went back to all my portfolio companies and my team and said, this is a unique golden moment in history where everything that you thought is how medicine is practiced, how it should be done, how it has been done for hundreds of years, can be thrown out of the window and you can restart. Never ever in our lifetime did we get a white drawing board all over again and said, let's start. And that to me is something that we take away in this room by saying, how do we get more efficient? How can we change? And any paradigm that you thought that this cannot be done. Getting my doctors to see patients on telemedicine was a complete no-no. Now the doctors themselves were saying, yeah, I want to do telemedicine. I don't want to see a patient. So to me, this is what has changed. The problem that we have with humankind is that as soon as everything changes, we go back to our bad old habits, and that's where I think we need to hold our feet to fire and use this moment in history to become better.
To paraphrase, perhaps poorly, St. Francis of Assisi, he said, where there's despair, let there be daylight. I think you saw the daylight. But we have a Idma conference where there are a lot of young SMEs and SMEs. At what point can they start thinking of raising capital from Amit Verma? Is it 50 crores? Is it 500 crores?
I think the ecosystem for venture, so number one first, unlike developed markets, I just call it raising capital. I don't get into seed, angel, venture, private, buyout, because at the end of the day, we kind of all merge into each other at a certain number. To me, one can be ready to raise third-party capital, whether venture or private, anything north of 50 to 100 crores. Before that, it's a bit too small, and I don't think you will reach the right set of investors to bring you the kind of domain expertise and help that would enable you to grow. I think I would flip the question around. The question that should be in the room is, why do I need third-party capital? Why do you need private equity? And to me, you should raise third-party capital when three things happen. You have a certain scale or size. For now, let's pretend it's 100 crores of revenue. Number two, you have some sight of profitability. And number three, you should be raising or diluting equity because you are raising money to do something bigger and larger. Otherwise, it's a complete waste of time. Otherwise, you have some other idiot sitting at the board telling you what to do, which you already know.
Utpal, they raise the money, but are you, Amit has said that the next 10 years he sees a bull run in healthcare and pharma. What are your thoughts on that?
You know, I will second what Amit said about the disruption that is taking place. And this disruption is also being aided by the quantum of capital which is available to be deployed. We will probably see the largest M&As across sectors. We will see huge capital being deployed. We will see partnership between enterprise and capital of an unprecedented nature. We will see the ability to evolve business models or redraw business models completely. We will see the opportunity of disrupting supply chains, of disrupting consumer habits, and so on. So I feel that the opportunity scope is much larger and much wider. But at the same time, I feel that it is not going to be tapped by the people who've been doing it in all these years. Because this is, as Amit said, the world has changed. The rules have changed. The game has changed. So how well you adapt is going to be a key test. And this adaptability and learnability of management teams is also an essential part of the culture that we talked about earlier. We feel that the adaptable management teams will be able to make the most of this as compared to those who are less adaptable.
And most likely they aren't the incumbents, but they are the challengers.
I will not rule out the incumbents. I will not say that the incumbents cannot adapt.
But they better understand the need to adapt.
Yes, that is critical.
Can I just add one other comment to what Utpal just said? I do believe fundamentally, and especially in healthcare, the big will get bigger and the bigger will absolutely need to get better. What we've seen during the COVID turbulation is that a lot of the riffraff got eliminated. And the larger ones, thanks to mergers, consolidation, availability of good assets, have gotten bigger. I think for a country our size, having these kind of volumes no longer is enough, because if you have to deliver operating cost efficiencies at the back, you will have to have some scale or size before your supply chain starts to respect you. So we will see that consolidation take place, which we are already seeing in hospitals, and we will start to see it in pharma too.
Amit, as you said, let's wipe the slate clean. We've discussed COVID, we've discussed pharma. Let me just put you on a different tack. You're obviously very successful. You're a doctor also. I didn't realize that till I met you. You're a critical care doctor. You meet a lot of pharma companies. So I'm going to give you a question, which I hope can inspire your delegates out here. That of all the people in the pharma industry that you met or read about, living, dead, foreign, Indian, if you could invite any three over for dinner, who would they be and why?
Very unfair question in a room full of stalwarts. I'll try to do my best on this one. I think, let me break it up a bit. I could talk to you about who I feel fascinating and some good reasons, some bad reasons.
Right.
I think the whole Yusuf Hamid Sipla story to me, when I was growing up and was practicing as a doctor, the democratization of healthcare access, to me stands out as one of the things that changed the way medicine was practiced in the emerging markets. So to me, what Dr. Yusuf did is fundamental, phenomenal, and I would take him up in my list any day of meeting up and just chatting. I think the second individual who comes to mind, not for the right reasons, is John Martin at Gilead. I'm a big fan of what Gilead has done in innovation, the kind of products that they've done for your benefit. They've been the world leaders when it comes to hepatitis C drug treatment. But what I've never understood was how they economically ramped up their prices to such an extent that they were so focused on just making money, they lost sight of why they are in the business. And to date, Gilead continues to enjoy the reputation of a very successful, innovative drug maker, but at very high prices. So talking to him, he's no longer there, but talking to him would try and understand why, when you are that successful, why can't you think of the larger good? And to me, the third, from a technology and scientific intellectual stimulation, is Stephen Bancel at Moderna, of what they did by taking a bench treatment vaccine technology, mRNA, bringing it so quickly, commercializing it, and now when you read anything about them, they don't talk about COVID, that's already a has-been. They're already talking about how they will change the world by the next 10 vaccines that they will create. So to me, with Yusuf Hamid sir, it is the past, volume, what you do, Gilead, on what you should not be doing in medicine, at least not today, and then talking about scientific prowess going forward.
Just out of curiosity, so I understand the mRNA part, because it intrigues me. You said they solved COVID and moving on to the next 10 vaccines. So that technology can be used for flu, for polio, or for any other diseases that we have?
Not that simple. Basically, what we've been able to do so far is, when we started off in medicine, we were using chemicals to alter. So we were hitting, if you had a cold, I would give you 1,000-kilo bomb to take care of it. Then we got a bit smarter and we started to get into hormonal and targeted therapy. What this is doing is getting into and altering the way protein is synthesized in cells. So there are going to be specific diseases which are going to benefit. It's not going to be for all diseases.
Okay. Utpal, I asked him very specifically about pharma. I'll broaden it out for you, because Rare invests in pharma and steel and software. And you generally the point man for a lot of these investments. So in your long and illustrative career, can you name 3 entrepreneurs that have impressed you and why?
Okay. So
you can start with the guy on the left.
I'm no entrepreneur. Thanks, Amit.
Yeah, I would say the first person that I would talk about is one Mr. Jagannathan, who is the chairman and managing director of a company called Star Health Insurance. He started the company at the age of 61 or 62 after he retired as the United India chairman, and created a $7-8 billion company between then and now. He's 78 years old and he's still so focused, still so driven. He owns about 3% of the company, but even today, that company is closer to him than his own children. It's just phenomenal to see him.
Mr. Jagannathan of Star Health.
Yes.
Fabulous. Again, another of your investee companies.
Yes, one of our investee companies. The second would be Mr. Rafiq Malik. He's the...
Metro Shoes.
Yeah, he's the chairman of Metro Shoes. Again, somebody who's been so focused in doing only one thing and being the leader and being the best in that space of ensuring that the business model has evolved in such a way that he lasts multiple cycles. It's a 70-year-old business. And on top of that, the fact that when COVID hit, the way this company reacted to it, the mindset to think that this crisis is an opportunity, the mindset to say that I will come out of this opportunity so much stronger than all my peers that it's going to be my moat for the next 20, 30 years.
Really?
Yeah. So that would be the second company that I would talk of. The third company is probably unknown to almost all of you. It's called Inventurous Knowledge Solutions. The CEO...
BPO firm. KPO, BPO.
Yeah, it's a KPO firm. It's run by a guy called Sachin Gupta. But he started off doing revenue cycle management. But instead of the conventional revenue cycle management solutions provided on FTE basis, he started out doing it on a revenue share basis, percentage of the collection. And that one tweak is what has helped him build almost a $3 billion value company in the last 14, 15 years. And it's just amazing as to how he's continuously evolving from an RCM player to a full-scale SaaS company focused on the American medical system.
And just to probe the tenets that you have said yourself, in all your three companies that you mentioned, Star Health, Metro Shoes, and what is the last one's name?
Inventurous.
Inventurous. The culture is there that you admire?
Absolutely. And there are common elements and there are distinct elements.
Culture to them, but there is a...
Yes, common elements being all of them are frugal, all of them are focused. They respect external capital. They respect internal capital. Capital allocation is very, very prudent. And in general, they are prudent. They don't take risks easily. And where they take risks, they manage those risks brilliantly. They are all focused on execution. It's not about big ideas.
Devil is in the details.
Yes, they are all focused on execution. They are all focused on delivering. And to them, they have a sense of purpose. It is much beyond just running a business, just beyond making profits. They have a purpose. And that purpose extends to not just their customers, but also to their employees.
Delivering value, basically, every time.
Delivering value to all stakeholders, and consistently, and over a long period of time. And every little miss pains them. They bring that passion, that dedication to the process.
Got that. Delivering value. As a final roundup of question to you, Dr. Amit, let me ask you, someone asked you this question. I really enjoyed listening to your answer.
I hope I give the same one.
Yeah. Give us a health hack. At that time, I'll tell you what your answer was. You said that use vaccines, don't worry too much about the efficacy. Any vaccine is better than no vaccine. I thought it was a brilliant answer for the time when there was a lot of debate on whether to use it or not. Give us a health hack for 2022.
Health hack?
Yeah.
Prevention. All of you sitting in the room, make it a due diligent habit that on your birthday, go get yourself a health checkup done. I cannot tell you the number of diseases unfortunately, that you may pick up, but more importantly, the sense of comfort and peace that you will give yourself, your companies, your family, by just making sure that you are trying to stay healthy.
It's not because you're invested in diagnostic companies, right? You just they basically believe that.
That's just a minor side comment.
Okay. Thank you. I know it is. Thank you. That's great advice. Prevention is better than cure, as we've learned since almost childhood. Utpal, I'll let the final word with you, but I'll ask you in a different tack. Index is close to 60,000. What is the financial hack? Rare's view of the market, Rare's view of the sector, and Rare's view of a financial hack. Can you give us some color on that?
Okay. If you permit me a little digression, I will say that Warren Buffett made his investment in Apple after Apple was a $500 billion market cap company at an age of almost 90 years, right? And he made $120 billion on that investment. That says it all.
It does, it does. It's actually staggering.
Yes. And that tells me that we have to remain focused on terminal value. There will be opportunities. We have to seize the right ones. We have to commit to them. And the idea is to think of what can be rather than all the ills that we can talk of in the world today. Because 3 years from now, 5 years from now, there will still be ills. It will not be the same ills, but the world will go on. The world has lived through, droughts, wars, viruses, and so on. So I think be focused on terminal value would be what we do. And I'm not worried about markets going down, which they may, but I'm not focused.
But they almost certainly will over periods of time. They'll be volatile.
Yeah, but I'm not focused on trying to time the market. I'm trying to find the next value creation opportunity.
It's always called the triumph of the optimist, and a point I'm sure you know, maybe Dr. Amit Verma also knows, that Warren Buffett created 95% of his wealth after the age 60. Yeah. So I have hope. Thank you, gentlemen. You know, there's an old saying, an Arabic saying, which goes, keep your gold, keep your silver, but give me your pharma wisdom, which both of you have so ably shared today. Thank you both for all the knowledge and insights you've given our delegates today.
Absolute honor. Thank you.
Thank you very much, Mr. Ramesh Damani. That was a job sincerely well done. May I request our President to please come up and present a memento along with Mehul Shah. Mehul, come. This is the President. To Dr. Amit Verma. And to Utpal Sheth. Thank you very much. So we now go to another very important and interesting award, which is known as the IDMA Corporate Citizen Awards. We've been giving these awards for the last almost 5 years. And I'll request our President to please come up. And I'll request a senior partner, somebody from KPMG, please, to join us. Ex-KPMG will also do. Please come. Okay, I'll welcome you. So we've had two categories always, companies with a turnover of less than 500 crores and companies above 500 crores. So first we give it to the companies up to 500 crores. IDMA Corporate Citizen Award presented to RPG Life Sciences Limited. Yugalji was there. The Knowledge Partners KPMG Assurance and Consultancy Services LLP at the Idma 60th year Diamond Jubilee celebrations. All the best. Now we go to the category above 500 crores, presented to Zydus Life Sciences Limited. Knowledge Partners KPMG Assurance and Consultancy Services at IDMA 60th year Diamond Jubilee celebrations. Selected these people. All right, so we are through with. Thank you. We now break for tea and coffee. Mehul, President sir, do we break for tea now? Right. So we break for tea for 15 minutes. If you can all assemble here by 4:25 or so, then we have another very important panel discussion, which is disruption, enhancing value from manufacturing to consumer. That's going to be very interesting for all of you. So please be here by 4:25. You can get your tea and coffee cups inside. Thank you. Ladies and gentlemen, we are about to begin the post-tea session now. Very interesting session. Disruption, enhancing value from manufacturing to consumer. We've got some eminent speakers, panelists, so please settle down. But before that, I have a small duty to be performed. Mehul, can you come on the dais, please? You all should be knowing that IDMA works very closely with USP, the United States Pharmacopoeia, and there has been a change of guard there, and we've got Mr. Girish Kapoor, the USP India site head. We would like to just acknowledge his presence. Give me a bouquet. And we've got Matru Prasad Priyadarshi. He is the General Manager, South Asia region. So may I request Mehul Shah to please present flowers. Please come up. Milind, why don't you join us? You also work very closely with USP. Come. One more. So USP has been in India for more than now 10 years now. One more bouquet. One sec, please. How can we forget you? So thank you very much. So may I request Mr. Parijat Ghosh, Senior Partner, Bain and Company, to please come up. He did a wonderful job of conducting the fireside chat with Honorable Minister Mansukh Mandavia. And now he's going to chair this panel. We've got Dr. Dhaval Shah, co-founder PharmEasy. And we've also got Ajit Pai, the CEO of Delivery. So that's all. Who's that? Yeah, we've got Raj Kiran C, Senior Director, PTC. Please come. So it's over to you, Parijat, and you may introduce the panelists and then go ahead with the panel discussion. Thank you.
Great, thank you, and welcome to what promises to be hopefully another interesting and insightful session in what has been a day of interesting and insightful sessions. So let me tell a little bit more about the esteemed panelists in here. Dr. Dhaval Shah, co-founder at PharmEasy, is an MBBS from the Rajiv Gandhi Government Medical College. He did his MBA from XLRI and worked at McKinsey for a few years, and then really has been at PharmEasy, been at the forefront in terms of trying to solve for affordable, authentic healthcare solutions. He's most recently also been featured in the Fortune 40 on 40, so congratulations again on that. Raj Kiran is the Senior Director and Head of IoT and Augmented Reality at PTC. He's now been there, helping companies start their digital transformation journey and really chart out overall their plans for an overall, post-COVID environment as well. He holds an MBA in Finance and IT from MDI Gurgaon and a BTech in Computer Science. The second unicorn now on the panel, Ajit is the Chief Operating Officer at Delivery. He's been associated with Delivery for almost a decade now, since 2013. Holds a bachelor's degree in engineering from NIT Suratkal, and then a PGDM from IIM Bangalore. Welcome to all three of the panelists here, and we'll get started with the session. And The first question, Dhaval, I'll start off with you. The theme of this is around disruption and how do we unlock value from manufacturing through to the consumer. And as Pharmeasy itself has evolved from being an online pharmacy to begin with to now more of a health tech player across multiple different parts of the healthcare system, how has your own perspectives on the pharma value chain, and the opportunities therein, how has that changed?
So very interesting. So I'll tell you how did we start. I think when we started, it was very simple. We said if education, if commerce, if news, everything can go online, why can't healthcare? And we said we will solve for healthcare. We were pretty naive. We said it's just about delivering medicines, tests, and consults. Like how difficult can it get? And that's where we started the entire ecosystem, wherein we thought that let's start by delivering healthcare solutions. Obviously, it was a honest mistake and a disaster. I think the biggest learning was 80% of it is pharma in terms of spending. And that's where the biggest disruption needed to happen. The supply chain was fragmented, multiple challenges. I think that's where we said, let's empower local retailers. Let's help them unlock the potential out there. In terms of just supply chain, the biggest or the highest margin in supply chain in any industry to the supply chain that is given is in pharma. The only industry in the country which does not have its own supply chain is pharma. And it was just surprising to see that the benefits were not being passed on to the customer because there was a cost which was there because of the inefficiencies of supply chain. I think that's what we started working upon. And that's where we just shifted gears to say, this is what we will start with. Then we'll move into our entire goal of healthcare and health tech. Now with ThyroCare and now with, multiple forays. I think the vision is now coming back to life, wherein we are saying, when a consumer starts their healthcare journey, you can, healthcare is like a sphere. You can enter anywhere and it's just the same. So you enter with a test, or you enter with a prescription, or you enter with a requirement to speak to a doctor. At the end of the day, your solution should be within that ecosystem. I think cross-functional or cross-pollination was not happening. This is what we want to do, wherein if a consumer is buying healthcare products or say diabetes medicines, we want the consumer to also check for a HbA1c test every single quarter.
Right.
That's how I think technology will play a role. That's where we step in, and that's what our goal is.
Excellent. No, that's great to hear. And taking off from that point on supply chain also that you mentioned, and Ajit, if I come to you, delivery really started off as solving the supply chain problems within India. And it's now since expanded into, providing custom solutions for pharma as well. What are some of the areas that you've had to customize for pharma? Because it's also very specific in terms of its requirements.
Yeah, so in terms of pharma, what we have seen over the last 3-4 years, and more so, obviously, a lot of the supply chain optimization across more traditional industries has taken off post-GST. And obviously, GST changed the entire paradigm in terms of not having to necessarily get 25 warehouses to supply your stockist or your distributors from, etc. I think the two major points that we have seen. One is obviously pharma is a very, very value-dense sector. It's also extremely complex in terms of inventory, right? So when you have a combination of value density, complex inventory, expiry being a very, very critical point, I think the importance of using technology within the four walls of the warehouse has become extremely critical. Now, this was something which, when you were running much smaller warehouses, was probably not as important. But as you consolidate, the entire paradigm shifts to basically how do you manage inventory within the warehouse efficiently, right? Why this is critical in pharma is also because I spoke about value density. Now, the value density, in a sense, if you look at the equation, dense, high value into high complexity equal to high inventory cost. And the only way to basically optimize this is as you go for warehouse consolidation,
How do you manage the inventory within your warehouse much better? How do you use data to figure out the trends on what is moving where, when, how, and literally be able to give inputs back to the manufacturing side of it to figure out how to optimize the production. So it's almost like it's the front end of manufacturing in a sense. So you have manufacturing which has to figure out what to manufacture, and then you have the supply chain which is giving those inputs back. So I think it's largely about that, and that's the difference we're seeing. Obviously, what that means for somebody like us is that from having discussions around what will be the per kg cost of transporting, from Delhi to Bombay or from Bombay to Ahmedabad, it has now actually moved to figuring out how much can I reduce your inventory, in comparison to your sales. So your inventory sales ratio has become the key metric around which a lot of our discussions now get to.
Excellent, excellent. And continuing with that theme, and Rajkiran, if I can come to you, there was a lot of conversation earlier on in the day also about, starting to adopt digital in a big way within pharma. And pharma has typically been a laggard as compared to other industries in terms of adopting digital tools. What role do you see digital, IoT, AR really play within pharma, and especially in Indian pharma? What are some global learnings that you see being relevant to the Indian context?
Yeah. So pharma has been a laggard. Maybe they are a very cautious player, right? We've observed that not just in India, but also globally. That's one of the last sectors that wants to adopt technology. And we know the reasons for that. It's the regulatory burdens, it's the sensitivities around data, etc. Now, with the coming of the pandemic a couple of years ago and the stress that laid on the supply chain, there's been this ever-increasing need to spend on digital technologies for something that Ajit referred to as well, which is the manufacturing efficiency as well as the feedback loop from the field, from the supply chain. Because of that, we're seeing significant spend now. There's significantly higher number of conversations that are happening in that space. What IoT can really bring is end-to-end supply chain visibility, right? You can have real-time information coming into the central repository with which people can take faster decisions in quick time. And that itself improves the operational effectiveness overall. And then the inventory reduction happens significantly. And the whole chain is optimized entirely. Now, globally speaking, there's so many companies that have started off doing this, have implemented it to a great extent as well. There are companies that have mainline pharma companies that have decided to call all their suppliers together and prescribe a certain kind of prescription for technology adoption. So all that is happening. And I think India is also getting on board very soon, and we're seeing a significant ramp up.
Excellent. And it's refreshing to hear all of you talk about, disruptions and, optimization and removing inefficiencies in the existing system. That's absolutely kind of the way to just take it to another level of higher level of equilibrium. Dhaval, if I can come back to you, though, from a slightly different perspective. A lot of the conversation that we just had was around inefficiencies in the current value chain. Now, a large portion of the Indian population is also underserved from a healthcare perspective. There's challenges around access, there's challenges around affordability, infrastructure, and so on and so forth. Now, as digital tools become more mainstream, as digital really goes from India to Bharat, do you see tech disruptors also starting to play a very key role from a patient perspective, really increasing access, availability to healthcare that they erstwhile, didn't have? And how do you view the role of tech disruptors in that space?
So we keep getting asked, right? How do you ensure that an e-commerce player or a platform which does not have a physical store, how does it reach every single pin code in India? I think our answer is generally very standard, that we are actually not trying to create awareness for PharmEasy as a brand. We are trying to create awareness for healthcare as a category.
Yeah.
The problem is there's a problem of complete awareness. You just step out of the 8, 9 metros which contribute to almost 60-65% of the industry as of now, and the awareness of chronic conditions, awareness of solutions available is so minuscule even today that there's so much more that can be done. Even today, if you look at our, we cater to all 19,000 habitable zip codes, and we partner with Ajit and the likes on various zip codes. I think the biggest learning has been there is a inherent requirement in sectors and in geographies where you wouldn't even know they existed, and the very fact that the purchase power is there, there is an inherent push from manufacturers as well as from service providers to be present in that area, but just the logistical, operational cost or the fixed cost does not make sense.
Yep.
That's where our network of partner retailers is something that, it works out for everybody. So what we are trying to do first is trying to create awareness of healthcare solutions, which will eventually translate into our brand and our recognition beyond a point.
Got it. And Ajit, especially as you think about going deeper, right, into different geographies. Now, in general, the Indian pharma industry faces problems, as you were saying, around demand forecasting, inventories, expiries, and so on and so forth. How do you see really supply chain technologies, coming in a big way to actually make sure that some of these inefficiencies, some of these problems are relegated to the past, and we, move forward from here?
Yeah. So I think the basic set of technologies that that have come in over the last few years, at least, where players like us have come and brought in more modern ways of warehousing management, tracking systems which are sort of 100% visible on a basis where every single movement is tracked, right? I think these are really the basic foundations, right? I think beyond that, I think a lot of it actually boils down to players in the pharma industry actually collaborating with us, like for example, Pharmacy has, to be able to access and get to to markets which traditionally were much more harder to get to, and hence were accessed in very different ways, right?
Yeah.
They were accessed through multi-layers, in a sense, which obviously meant that the information just did not boil up in terms of where it was going. So I think it's largely about that. It's largely about using the information. It's about using the networks that have been created, and in a sense, I think pharma can benefit significantly from that. I mean, Dhaval just spoke about reaching 19,500 pin codes. Now, 19,500 pin code network was not built purely for pharma, but it's now available for pharma, right? And you could think of different ways of reaching these pin codes. You could think of reaching the retailer. You could think of reaching the medical representatives directly. You could even think of taking some of these things D2C. And obviously you have then, for the vast majority, you have the marketplace kind of networks that people like Pharmacy have created. So right. I think it's a question of how do you tailor your usage of each of these networks? What is it that you want to achieve? If you want to achieve depth, you want to achieve more information, you want to delayer, I think that's the choice that the industry will have to take.
Yeah, and what's increasingly becoming clear is that there is a new level of sophistication to manage the complexity that is inherent in India, and a new level of sophistication using new digital tools, technologies, and so on. And Rajkiran, if I can come to you with that, because I know you had a perspective on that. These issues, while they are quite severe in India, maybe around, the supply chain issues, etc., they're not unique to India. There are other countries also which have, similar challenges. So as you've looked at technologies and use cases, what are some of the key takeaways that you have on the pain points and, how we can address them?
Right. So broadly, there are 4 areas in the supply chain between the pharma supplier and the patient, right? There is the production networks of theirs, which is internal and external. There's also the warehousing logistics provider. Then there is the wholesaler, the distributor. And then there is the doctors, the pharmacies, the hospitals, right? Now, ideally with technology, you should be able to get a consolidated end-to-end view of the whole thing. The problem and the challenge that exists is that there's so many different players doing a little bit of technology in all of these 4 boxes, right? There's so many, they're all heterogeneous. They're using different kinds of technology, and they probably are, not integratable with each other. What can be brought up as good solutions is a solid backbone beneath that can take inputs from all of these different systems, integrate all of the players within the supply chain, and provide one consolidated 360-degree view of the entire picture, right? And that requires good technology investment. I can give you an example. There is a $5 billion company called Lonza in Switzerland, a long-time customer of ours. And what they did is call upon all of the different suppliers, took a consolidated view. So now the ownership of the entire project was also taken up by this mainline pharma company. Made sure that there is some kind of a prescription. Obviously, they couldn't do it to the T, but there's some kind of a prescription of the technology that needs to be adopted, that is needed to be adopted by each of these players in the chain. And then they've been able to get, some degree of supply chain visibility. And with that, inventory cost reductions were there. There were a lot of inefficiencies in the chain that were identified due to doing that. So what is required is a robust platform which can probably help to integrate with every system in this entire supply chain. And that's the ideal state. I mean, we're all striving towards that. India could be more complex, but it is kind of complex even in other more advanced countries. But we're all striving to that ideal situation.
Great, thank you. Maybe from the sector and the supply chain, we changed the perspective a little bit to the consumer. And Dhaval, you started off with that, which is that benefits were not being passed on to the consumer. That was one of the points that you made. And when actually online pharmacies more broadly, when that started as a business model in India, there was clearly the benefit of actually seeing higher availability than necessarily the neighborhood chemist. There was also an economic advantage that consumers saw, and clearly in terms of also greater range that they were you were being able to provide. As health tech, online pharmacies, as kind of these different newer business models also evolve, do you see improving health outcomes? And I'm deliberately kind of taking a very, very difficult, outcome. Do you see improvement of health outcomes as an objective that some of these platforms should also aspire to?
No, I'm so glad that you asked this, right? See, I think in general, people tend to, see, if you look at any industry that has gone online, healthcare was the last. I mean, amongst the day-to-day industries that we deal with, right? Health tech, if you may call it, started online in 2016, came to mainstream in 2018. It's just been around 4 years.
Yeah.
3.5 to 4 years. Obviously, COVID acted as a big boost.
Catalyst.
If you see any category that has gone online, the penetration is still in single digits for a vertical in India, in spite of spending a decade. And that has been on the back of crazy marketing, crazy discounting, freebies, and generally we've seen horizontals thrive better in our country versus verticals like a e-pharmacy, etc., etc. I think the hook for an e-pharmacy has never, it will never be, let me put it ahead, will never be discounts. Beyond the point, the consumer actually does not care. My healthcare purchase is capped at roughly, say, 30,000 rupees a year, which includes my tests, my consults, etc., etc. 65-70% of this is in metros.
Yeah.
Even if I land up saving 15% more for a consumer, in these geographies, it amounts to some 4,000 rupees in a year.
Yeah.
It does not account for like a significant quantum for 90% of the people who are spending on 30,000 rupees.
Yeah.
Savings will never be a hook. The hook will always be improving healthcare outcomes, giving me everything at one single place. Wherein if I am diabetic, like I'm 33, tomorrow if I have diabetes. I don't know what to do. I mean, so yeah, I am a doctor, but I don't practice. So as it is, it's a bit of a bad spot that I'm in. But had I not been a doctor, I don't know what do I do, right? I mean, I can just go to a doctor, maybe consult with him. That consultation might last for 10 minutes. After that, there's nobody to handhold me. Yeah. I want regular medication. I want testing. I want a dietitian to call me. I want a change in my lifestyle because I am going through a crisis wherein I feel I'm hooked onto some medication for life. The very fact that you have somebody to handhold, and we're not saying we are still there, it's work in progress, but I think that's the objective that we are all trying to get to. And once we're able to do that, you will see drastic changes in healthcare outcomes, right? If I'm able to improve a glycemic index of a diabetic patient by even 10%, I mean, I've done something much more than maybe saving 30% of what he spends on healthcare. So I think that's the outcome. There are different ways to get there. Maybe we take 5 years, maybe we take 10 years. Maybe it might just happen in 2 years. But yes, that's the overall objective. The discounting, the freebies that come along is just to tell people shouting at the top of the roof that we are there, right? I mean, because it's just impossible. Building a brand in India is crazy, and you know, we would just you know, we love the fact that people have built fantastic brands in the past, but I think that has happened over a few years. If you want to crunch it down in 4 or 5 years, there's no other way to do it but then maybe go out there.
Excellent, great, and excellent vision, you know, very inspiring vision, if I might add. If I now come to you, Ajit, and say that, you know, there's clearly an element of just improving the quality of diagnosis, improving the quality of treatment, adherence, and then, you know, getting to health outcomes. From a delivery perspective, where you're thinking about the distribution space, what are the kind of benefits that both pharma companies and as well as you know, consumers themselves can actually expect to see?
So I think if you look at it from different angles in terms of how you approach the consumer and how you approach the supply chain itself, I think there are different benefits there. So the most obvious one is the one that Dhaval referred to, which is that how do you make things accessible to consumers who otherwise will not have access to it? Something like chronic medication, it's possibly hard for a pharmacist in a village to stock all kinds of chronic medication, or all kinds of high-value medication. So can you create a system where he can directly, you know, come to you on some kind of an app, and it can be delivered overnight to him, right? So he has the consumer wants the medicine. How do you make such a supply chain work, right? Today, you have the technology, and more importantly, the pipes have now been set, right? The way we look at delivery, for example, is that it's a giant pipe, right? Yeah. Now that pipe can be used to pump things into different parts of the economy. You can pump it into retailers, you can pump it directly to consumers, you can, you can pump it to your distributors for fast fulfillment, pretty much all of those. So I think one aspect of basically how you can take advantage of it is in this way, right? The other is basically the consumer is also evolving. Let me sort of, just to give you an example, and this is something that we have seen very starkly over the last couple of years post-COVID. I think pre-COVID to post-COVID, the one large difference we've seen on consumers is that there was a set of consumers who were simply not willing to experiment with online channels for anything, right? They just, and it was not a question of affordability, it was not a question of not being able to use the technology, but they just did not want to do it. That changed with COVID. So now you actually have senior citizens who are ordering online, who are comfortable with ordering online because they've done it through COVID, and at that time there was no choice, right? Yeah. You have a whole bunch of people who've discovered, whose primary mode of discovery of products other than the brands that they know is actually online. And nutraceutical is a fantastic example of that. I don't think the number of nutraceutical brands that exist today would have actually existed without an online channel. It's demand which probably was highly latent or was created by this. Yeah, absolutely. So I think that's the second part of where I think the pharma sector can take advantage, right? Which is basically how do you create these, how do you create this kind of demand? Because there is a consumer out there who is willing to engage with you in a very different way from how you have traditionally seen pharma consumers engage, and there is a way to actually now fulfill the demands of that consumer. So I think that's how I would look at it. On the distribution side, I think it's pretty simple. I think the question is one of delayering. I think the first level of optimization has happened on the mother warehouse slash forward fulfillment centers.
Yeah.
I think the question, and this is something which I myself would be very curious to know from the pharma industry, right? We hear about this across the board now, that getting distributors is hard. Distribution as a business is no longer as attractive as it used to be. And this sentiment is heard across FMCG, across stuff like appliances, and possibly even in pharma. That I think is, if that's the direction that India is going in, then I think the pharma distribution supply chain will need to look at delayering over a period of time. And to be able to delayer, I think you need to fundamentally change how you approach the supply chain. The last bit is actually, and one of the things that is unique about the pharma industry is that it is one of the few industries in India which relies on a massive direct sales force, right? And that sales force is highly distributed, right? Now, can you be more connected with them? Can you work with them more directly? Today, they can anyway interact digitally with you. Can you also ensure that the physical delivery of products to them, etc., is done in such a manner where they know exactly when they will receive something, what do they have to do with it, how do they approach doctors? Can you go direct to doctors? Right? I think these are all questions that will get answered over a period of time. And I don't think there will be a 0-1 switch. I think, like most things in India, the old will continue while the new gets layered on, right? So I think that's how I would think about the distribution and the consumer.
Excellent. Thank you very much. Rajkiran, if I come to you now and really go to the other end of the chain. So we spoke a lot about consumers and what the value for the consumers. If you think about manufacturing efficiencies and operations improvement there, IoT, augmented reality, Industry 4.0, those are new technologies that have all become more mainstream. How do you see that playing into pharma?
Yeah. Very relevant question now. Fourth industrial revolution, we are in the midst of it. And I think it's the age of cyber physical systems. And across the supply chain, the maximum efficiencies are going to be coming from the factory, from the manufacturing shop floor, from the production facilities. That's where the inefficiencies are, with these large equipment not performing to the optimal level. And there is always room for improvement there. So industrial IoT is that aspect. So the manufacturing efficiency is one aspect, quality is another, asset reliability and maintenance is another, right? Now, these are where all of it can be improved. Now, I'll go into each of them in detail. On the manufacturing side, and at a basic minimum, the plant manager should be able to see a dashboard of the production performance and the KPIs. And he should be able to take informed decisions based on something he sees on that dashboard of how his processes are performing, right? Now, he needs to do that in a very sustainable way. So energy consumption, water usage optimization, et cetera, are extremely relevant there. Coming to the quality aspect, pharma is the industry where the quality leeway is the least, right? The range of rejection percentages are actually the least, where batches can be rejected if it's not meeting the right kind of areas. Now, that's where AI and ML come into play. Now, with the number of ingredients that go into a pharma formulation process and manufacturing process, you need to exactly be able to pinpoint what ingredient has defects in it and what are the factors because of which there needs to be rework done. So that is something that is extremely critical there, and we see a lot of pharmaceutical companies being able to get their payback from purely the quality aspects. Then the maintenance and reliability side. And a close cousin of the industrial IoT is the augmented reality area, which is the concept of being able to convert the digital back into the physical world and see data contextually. You know, you've seen those wearable devices that people can wear, look at a machine and get the real-time statistics out of it. Now, when people use augmented reality, they actually learn faster and retain better, which means that if they are taught a process, which is a standard operating procedures, there's so many SOPs in the pharma world, or they are taught the maintenance procedures and how you should improve and maintain the assets that you have on the shop floor, they're able to do it much faster. It's much better than reading a paper manual, much better than sitting in a classroom and listening to a lecture, and therefore that improves efficiencies as well. What we did in the first part of the pandemic, wave one, is when Prime Minister of UK, Boris Johnson, called for what was called a ventilator challenge, which was to ramp up the production of ventilators. And he called, the research agencies, the manufacturers, as well as the pharmaceutical companies into that. And Smiths Medical, Ford, BAE Systems, all of these came into the picture in the consortium. So we provided our augmented reality technology to be able to ramp up production significantly at that time. And really, this has been adopted even by companies like Pfizer to be able to reduce the errors and be able to do things faster as well. So, these two technologies are really complementary and can derive maximum efficiencies.
Got it. So far, we've really spoken about, commercial data, and we've spoken about operational data and how do we use commercial and operational data for improving business, generating more value. There's also an aspect, and especially in healthcare, around the clinical data itself and the medical records and the fragmentation of the medical records between multiple doctors, diagnostic labs, the patients, how the systems don't speak to each other, and so on. Dhaval, now PharmEasy is actually present in multiple parts of that healthcare ecosystem. Is that also an area of disruption that you're looking at? How are you thinking about really integration of clinical data across all of these different silos of healthcare?
So there's this saying internally within our company as well that monetizing healthcare data is a myth. Nobody will actually be able to solve it. I think we've been speaking about healthcare data since like maybe 4 or 5 decades, but nobody's actually been able to do anything meaningful out of it. And I'll tell you the reasons for it. I don't think you can ever make money, and you should ever make money from healthcare data. It's just not possible, especially in an Indian context where 95% of pharmacy stores today don't even have a barcode. The details entered of patient don't actually match the name or number or the address of the consumer. It actually, there's no way that you can actually monetize any of it or make meaningful decisions based on that. I think what is interesting is what can you do to improve the efficiency at your end. So let's say if you were to split this entire thing into say just broadly 3 pieces, right? The patient. What can you do for the patient? If I am diabetic, I'm consuming your insulin, right? You tell me when should I consume it. I don't think that's advertising. I don't think that's breaching into my privacy. That's actually hand-holding me. That's a brand being present when I need it to be present. What's the most efficient time in the day that I should take it? Like, how does it work well? That's something that I want to learn as a patient. Adverse drug reactions, meal interactions. I think those are things that I would love to hear from manufacturers as a patient. And that only somebody who has access to end-to-end consumer data, which is, hey, the doctor wrote so-and-so, and the patient got so-and-so, and hence, there's a relevant TG. This is funny incident that happened, right? We were actually discussing internally what is the drop-off rate of a consumer. Yeah. You have 100 people who buy from a platform today. There is 100 minus X over some time. And we're like, why is the X so high? Anything non-zero for a chronic patient should be unacceptable. And then we looked at the retention of a pharma company. If I'm consuming insulin of a manufacturer and then I do 100 minus X of that manufacturer, the X was so high as compared to our platform that we were like, we are doing fine, right? Because consumers do not, even today, consumers relate medicines and healthcare to the retail store and not to the manufacturer. Because obviously, for obvious reasons, you cannot reach out. But this is where people like us or integrated ecosystem can play in, wherein you say, hey, you are under the care of X manufacturer through so-and-so, so-and-so, so-and-so. This is the dosage that they generally recommend. This is the percentage of adverse reactions out of their products, etc., etc. And that works beautifully. I think that's the way forward. That's what we feel. That's where stitching data together will help. Wherein if I say after, if the HbA1c level is so-and-so and you've been consuming insulin by so-and-so, generally your HbA1c should be in this range. Yeah. I think that's just beautiful. I mean, doctors, consumers, patients would just love it. That's how we plan to move forward in the direction. I don't think monetization is something that will ever work out.
Yeah. Yeah, and like you're saying, it's not necessarily about monetization, but this flows into your improving the health outcomes point that you were making earlier. Great. One more question, Dhaval, to you, which is that, health tech is still in its infancy in India. There are challenges around, regulations. There are challenges around, it's still a large out-of-pocket market, etc. Other markets, the US is reimbursed. China has a different system. What are the different directions that you think it could take in India?
So I think the biggest problem in India even today, if you ask us as a consumer, I think why is healthcare not taken care of in general as an individual? If I'm a consumer, if I'm a patient, if I make my monthly budget of expenses, the last I would account for is unplanned healthcare expenses, right? That's something that just doesn't come to us naturally. And this is very counterintuitive in a market like India where 90% of OPD healthcare is out of pocket. Yeah. The 10% is just maybe governmental institutions or private corporate insurances that cover in parts of OPD care. I think that's bound to change. We feel that, so we currently partner with 100,000 pharmacy stores. One thing that we're realizing across is everybody wants to do more. Everybody wants to adopt tech, move closer to the consumer. Every retailer wants to do it, but the cost of doing it is something that a individual retailer cannot afford. Yeah. The direction in which we can do is as you said, healthcare outcomes which are directional in solving healthcare conditions, wherein I say, hey, you have this condition. These are the three important stakeholders: a lab, a store, and a doctor. These are the three stakeholders who will take care of it. You pay X amount a year, and it will be taken care of. Now, whether that money is paid through some insurance, or through your corporate, or through out-of-pocket, or some schemes, etc., that's something that we will all figure. But I think you will get very soon, you'll get into all of us trying to solve for conditions through an integrated approach versus me moving as a consumer from a lab to a store, to a doctor, to a hospital, and not finding a solution at any place maybe.
Great. No, that's a vision of an integrated system really working to the patient's benefit. So that's great to hear. Ajit, last word from you in terms of how you expect the distribution system in India to evolve from a pharma perspective. It's been, as you were saying, it's been fragmented. There are changes certainly happening. Not many people want to do distribution anymore. So how do you see that space?
I think a couple of things are happening, right? One is basically the fact that access has changed, and that obviously means that there are many, many more ways of doing distribution than have existed. So I think more than the distribution system changing from what it is currently, I think what we'll start seeing is newer and newer layers of distribution, different channels emerge. And each of these will be relevant for certain kinds of products. They may not be relevant for all products, right? Does it really make sense for for a very commonly used OTC drug to be sent in a single pack, 250 gram pack? Possibly not, because it's available 5 minutes or 10 minutes from your home. But does it make sense for a completely new distribution system for certain kinds of drugs? I think that certainly does, right? So I think what we will see is basically, depending on what the demand for a product is, how do you create that access for it? What should be the cost of distributing it? You will see different distribution systems emerge, right? And in a sense, I think that's really what this country needs. And it's no different in that sense from something like FMCG or fashion in that sense, right? Where different kinds of products are now being sold in different ways. So if you look at, for example, if you look at just how e-commerce has changed over a period of time, and Dhaval spoke about this very briefly in terms of the e-commerce consumer, how the e-commerce consumer behaves. In the last couple of years, D2C has become a much more prominent part of e-commerce. It's something which probably did not exist. Now, that doesn't mean that you don't have a large number of consumers who are coming into the horizontals, right? Yeah. That flow has not stemmed, but there is a consumer who's also, in a sense, maturing and is going beyond the horizontals and going D2C, right? So I think what you will see with the consumer and hence with distribution is that different consumers for different products will adopt different channels. The question, I think, for the industry and for supply chain players like us is how do you create sort of very, very flexible systems? How do you create very flexible supply chains that can literally cater to all of these? One size fits all is possibly a thing of the past, if you would ask me about how distribution would play out.
Great. No, I think it's been interesting to capture the theme around how we are moving to much more segmented, much more kind of consumer-oriented solutions. We have time maybe for a couple of questions, so I'd throw it open to the audience. Any questions for the panelists here? If you could just give your name, who you want the question from, and just and the question itself. Sorry, yes, if somebody can get a mic to that, to near the end of the piece. Thank you. It's at the back.
Thank you so much, wonderful panel. In fact, I'm also into healthcare. So my question is to Ajit as well as to Dhaval. Both of them are leading this industry. How do you see basically tier 3, tier 4 and beyond towns evolving in terms of supply chain, deliveries, etc.?
Yeah, it was to you. It was how do you see the supply chain for tier 3, tier 4 towns? How do you see that supply chain evolving?
With friends like Ajit, I think we can reach everywhere. I don't think there was ever an issue of accessibility. It was always an issue of viability. I mean, beyond the point, if a tier 3, tier 4 town does not generate enough volumes, why would anybody go there? But with a model which is, say, central and a hub and spoke model, which almost every company these days operates on, and if you have the logistics partners who are super efficient in terms of cost, and even if you can generate basic demand, it's very easily doable. And that's what we do. Obviously, there are challenges in pharma, especially with cold chain management. But again, one thing at a time. So I think you can almost solve for 80-90% of the problem right away as of now. So and the demand has always been there. It's just about awareness and viability.
I think the challenge that both of you are saying is that we'll get the supply chain to work, we'll get the product there. It's more about how do I convert that need into an actual demand generation. And
in a viable way.
In a viable way.
Yeah, I mean, like, there have been instances wherein there are orders from Andaman and Nicobar Islands, right? And the cost of sending a shipment there is some 700 rupees. I mean, it's just not viable unless the ticket size is such or there's enough density. So that's the challenge. But I think over time, we'll all be able to overcome that.
So supply chain is not going to be the constraint to the growth of the sector. It's more about demand generation at the front end. Great. Any other questions? Great. I think we are sorted then. Thank you very much. Dhaval, Rajkiran, Ajit, thank you very much for answering all the questions and for an insightful session. Thank you.
Thank you. Thank you.
So thank you very much. That was a very interesting session. May I request our president to please come on the dais along with Neha Thakur, Neha, and Mr. B.G. Barve. They are part of our organizing committee and we haven't given them any work. So, Barve Saab. Yeah, ये लेके आओ डबल. Yeah, bring this. And Ajit. Thank you very much. One more. Thank you. So we have some people to be felicitated who we could not do in the morning. And I would like to call upon Dr. Saranjit Singh. President, sir, would you present flowers to Saranjit Singh, our very dear friend who retired after almost 40 years of service, sir, from Naipur? 4 decades, 5 decades. Fantastic. Mahesh bhai, please come up. We have got Chakravarti AVPS. Chakravarti, where are you? Come. He is a world ambassador of packaging. Please come. And I think he also has a memento for our president. We have Mr. Susanta Mahapatra from 3SMG Events. Mr. Mahapatra, are you there? Please come. Yeah, he's there. One more. Go and give it. We have Mr. Senkatir. Mr. Senkatir, our Deputy Drugs Controller from West Zone. Yes, welcome, sir. We also have Mr. Jayant Kumar, the Deputy Drugs Controller from Gujarat. Please come. Then one more. Is our Chairman of the Gujarat State Board there? Dr. Shrenik Shah. Shreni Bhai, Gujarat State Board has the highest number of registrations today. So big hand to them. Thank you. Thank you, sir. So with this, we now request Dr. George Patani, our Vice President West, to please give us his closing remarks and propose a hearty vote of thanks. Over to you, sir.
So, thank you one and all. I have been General Secretary for the last 2 years, and you know, whenever they called me, it was at the end of the show, and they would ask me to finish up quickly. So I'm not going to keep you all away from, we're going to have high tea after this, and after that, we're going to have a really nice entertainment program. We'd like you to all relax, sit back, and enjoy. Now, you know, it's very humbling for me to stand here today and actually thank, first of all, each and every one of you for being here, for being patient, sitting back. And, you know, like our General Secretary Mehul said, if we could take back just one point from all that we have learned and imbibed today, then, you know, we have really achieved something. We are extremely lucky today to have our health minister who spent so much time with us, told us all the initiatives of the government. We are grateful to Dr. V.G. Somani, Dr. Mandeep Bhandari, who have been very kind with, you know, their, very kind to us in terms of the service that we did during the pandemic. It's very, you know, after the job is done, it feels nice when you are thanked for something, but we still know that we need to continue to serve our population and the rest of the world. But there are a number of takeaways that, you know, I like to highlight from Madam Aparna. And she said that we need to ensure drug security for our country and for the world. We need to work on innovation, and not just innovation to increase value. Of course, value is going to be more important than volume, that a number of our speakers have shared with us today. But we are talking of cost-effective innovation. We are talking of cooperative collaboration. You know, we should think of ways we can collaborate with our colleagues right here. We are going to look at collaboration with maybe competitors. We may be competitors in some field, but there are areas where we can collaborate. And finally, we need to look at upskilling of our professionals. So, I think a lot of takeaway for us from Madam Aparna. And, then I was deeply touched to see all our past presidents who came here today. As you all know, all these presidents have spent countless hours in the service of IDMA at, very often sacrificing time at their own businesses and family time. So we are deeply touched by their service and their presence today. I'd also like to really, share with you quickly, some of the takeaways that I took down on my notes. And, you see, I was happy to share with you what Mr. Dilip Sangvi said, that we still need to leverage digital. I think that's something for even small companies, medium companies. COVID has taught us that we need to leverage digital more. We must continue doing more of what we have done. And you see, more diseases will be managed by devices. This came about through a number of speakers, that devices and drugs are going to come together, and that will help us to manage diseases better. Mr. Pankaj Patel said, yes, we need to continue doing what we have been doing, but we need to do different things too. Again came the point of drug and devices, that they must come together, and that will help us get more value and not just focus on volume. Finally, we also had Mr. Satish Reddy, who highlighted that, it's just not the US market that we are all looking at. Sometimes we first made money in India. Then we started looking at the other markets. Today, everybody envies the market that we have. So we must keep our focus on the market in India too. Now, we need a lot of policy support from the government. I think the government is giving us a lot of support, but we need more policy support, and we need it quickly. Innovation is important. Product mix is important, and also the ability to distribute. And this will help us increase value. So I am grateful to Mr. Utkarsh Palnitkar, who very nicely, was able to bring out these points to us. And you see, we must appreciate the amount of effort that has gone into preparation. So thank you very much, Utkarsh. We next had a panel discussion, which was again, very enlightening. I thank Mr. Ramesh Damani. Excellently moderated panel. Well, what can private equity bring to your business? It will bring discipline. It will make you think larger. It will give you a global outlook. And it will help you build global practices. So I think this is what is important. So if that's what we are looking at, then we're looking at private equity. Another very important point that came out is all about culture. And, culture is something that we must take very seriously, because it deals with the customer, it deals with the employees. And, in our pharma business, it's how we look at risk. Culturally, maybe, we didn't look at risk so seriously. But being in pharma, I think we must give a lot more importance to, risk management. And finally, what's important is accessibility, awareness, affordability, and quality. We must be frugal, we must develop focus, and we must know how to execute. And that is what private equity is looking for. And finally, the last session was very interesting. I thank Mr. Dawal Shah, Mr. Rajkiran, and Ajit Pai. You see, we must be consumer-centric, and we must be able to pass on benefits to the consumer. If we can do that, then we have achieved what we are in the business for. It's important. We are seeing consolidation of distributors in India. And we are talking of, consolidation of distributors even in the US market, and it's happening globally. So I think consolidation of distributors is not that it's hard to find distributors, it's just that there's so much consolidation happening in the distribution. We must know that there must be an inherent demand, and there must be that this demand must come across from various sectors. It's only then that we can collaborate and use available technologies to finally deliver to the end consumer. So I think all in all, it has been a day of great learning. And of course, the use of augmented reality to ramp up production. We must slowly start looking at artificial intelligence, augmented reality to improve our skilling efforts. So all in all, it's been a great day, a lot of learning. Maybe it's time for us to sit back, take these notes down, because I'm sure we're going to, see how this really impacts our business and how it has come across from various experts across various industries. So thank you one and all. My only request is that please come on time at 7:30 for the entertainment tonight. Tomorrow morning is again a packed day, so please make sure that you are at your seats by 9:50, and we hope you have a wonderful night. Thank you so much. Yeah, and of course, please continue. There's going to be a high tea right now, so there's lots of networking and high tea. So one of the highlights tomorrow is we have Mr. N. Chandra. As Mehul said, he manages over 62 companies. Well, for me, 62 names are difficult to remember. So I think there's going to be a lot of learning. So please make sure you're on time. He is going to be very punctual with his time. He will be here at sharp 10. So we request you all to be on your seats here at 9:50. Thank you so much, one and all. Thank you for being patient. And please join us for high tea.
See offices already lining the roads of the city. Here people can choose to cycle or even walk to work. Fantastic, right? There is a grade A manufacturing and logistics park planned over 800 acres that is already home to leading global companies. While majority of Indian life sciences companies are headquartered in Mumbai, the city still lacks an established R&D ecosystem due to limited compliance spaces and infrastructure. Here in Palava,